third phase, and fourth, relevance. The second objective is, how do the cigarette consumers perceive the effectiveness of graphic and textual health warnings in terms of, first, enhancement of knowledge, and second, behavioral changes. The third objective is, what are the recommendations of the professionals and consumers that can help improve the graphic health warning and textual warning? And last, what can be the probable layout of the graphic and textual health warnings as proposed by the researchers based on the recommendations of the respondents? For our methodology, first, we let our questionnaires to be validated, and after that, we let it to be pilot tested, and luckily, the data that were gathered during our pilot test passed the reliability test. Next, before we float our questionnaires, we let our respondents sign the consent letter we've prepared. After they signed the consent letter, we immediately proceed with the data gathering. We have two sets of respondents, the experts and the smokers. For our experts, we float our questionnaires via Google form, while for the smokers, we conducted a face-to-face setup so we can personally extract their recommendations and say on these graphical and textual health warnings seen on cigarette packs. Right after our data gathering, we code all the data and prepared it for analysis. Next slide, please. So for this slide, it represents the results of the data gathered. The first table, or the table 1.1, shows the mean, standard deviation, and descriptive interpretation on the assessment of the professionals in the graphic and textual health warnings on cigarette packs in terms of content. So as seen from the table, the statement health warnings in cigarette box contains clear, direct, and accurate message, has the highest frequency of 3.97 with a standard deviation of 1.8, descriptively interpreted as agree. On the other hand, the statement the graphic pictures enhance the effectiveness of warning labels has the lowest mean of 3.63 with a standard deviation of 1.25, which is descriptively interpreted as agree. The categorical mean of 3.82 and a standard deviation of 1.9 indicates that the professional respondents generally agree to the effectiveness statements of the graphic and health warnings on cigarette packs in terms of content. Next table. The second table is the table 1.2. This table shows the mean, standard deviation, and descriptive interpretation on the assessment of the professionals in the graphic and textual health warnings on cigarette packs in terms of construct. As seen from the table, the statement the picture can be easily seen has the highest frequency of 4.17 with a standard deviation of 1.4 and descriptively interpreted as agree. On the other hand, the statement the font size of the text is too small has the lowest mean of 3.10 with a standard deviation of 0.79, which is descriptively interpreted as neutral. The categorical mean of 3.75 and the standard deviation of 1.97 indicates that the professional respondents generally agree to the statements of the features of graphic and textual health warnings on cigarette packs in terms of construct. Next slide, please. This slide is the continuation of the last slide. So for table 1.3, this shows the mean standard deviation and descriptive interpretation on the assessment of the professionals in the graphic and textual health warnings on cigarette packs in terms of face or appearance. As seen from the table, the statement, the health warning labels in the cigarette packs help you understand clearly what can happen if you continue smoking, has the highest frequency of 4.27 with a standard deviation of 0.96 and descriptively interpreted as strongly agree. On the other hand, the statement, the health warning labels on cigarette boxes do help in telling people not to start smoking has the lowest mean of 3.77 with a standard deviation of 1.5 and descriptively interpreted as agree. The categorical mean of 4.1 and a standard deviation of 0.87 indicates that the professional respondents generally agree to the statements of the features of graphic and textual health warnings on cigarette packs in terms of face or appearance. Next table, please. For this table, the table 1.4 shows the mean, standard deviation, and descriptive interpretation on the assessment of the professionals in the graphic and textual health warnings on cigarette packs in terms of relevance. So as seen from the table, the statement makes you aware of the illness or disease depicted on the graphic warning has the highest frequency of 4.20 with a standard deviation of 0.87, which is descriptively interpreted as strongly agree. On the other hand, the statement is convincing to stop or lessen smoking has the lowest mean of 3.83 with a standard deviation of 0.78, which is descriptively interpreted as agree. The categorical mean of 3.95 and standard deviation of 0.91 indicates the professional respondents generally agree to the statements of the features of graphic and textual health warnings on cigarette packs in terms of relevance. Next slide, please.
Who's presenting? Hello?
Hello, ma'am. Si Mika na po ang magpe-present sa part na yan, ma'am. Mika Marcos po.
Yes, wait. Open ka. Table.
I think she's having technical difficulties. Can anyone present for her? Mary Jane, you may continue, I think. Hello, anyone in the group? Mika, we cannot hear you.
Wait lang. Table 2.1 shows mean standard deviation and descriptive interpretation on how consumers' perspective the effectiveness of graphic and textual health warnings on cigarette packs in terms of behavioral change. As seen from the table, the statement the health warnings made me think about quitting smoking has the highest frequency of 3.84 with a standard deviation of 0.83 descriptively interpreted as agree. On the other hand, the statement the health warnings didn't affect me at all has the lowest mean of 2.22 with a standard deviation of 0.03, which is descriptively interpreted as disagree. The categorical mean of 3.20 and a standard deviation of 0.83 indicates that the consumer respondents generally neutral to the statements on the effectiveness of graphic and textual health warnings on cigarette packs in terms of behavioral change. Next slide, please. Next slide po. Um, next po. Dun sa may sa recommendations of professionals. Recommendations of professionals and consumers to improve graphic warnings. Based on the thematic analysis of the qualitative data gathered, the following emergent themes were generated on the recommendations of professionals and consumers to improve graphic warnings. The professionals recommended that the graphic warnings in the cigarette packaging should include pictures that are accurate depictions of the results of cigarette smoking. The participants also pointed out the need to cover all the important health risks to fully inform consumers about the health consequences of smoking. Graphics must also give consumers enough realistic information to fully understand the risk of smoking. The consumers, on the other hand, recommended that the graphic warnings should have a picture that is bigger and much more realistic. The participants stressed out that the picture should depict the actual effect of the cigarette in the lungs of smokers. Next slide, please. Recommendations of professionals and consumers to improve textual warnings. Based on the thematic analysis of the qualitative data gathered, the following emergent themes were generated on the recommendations of professionals and consumers to improve textual warnings. The professionals and consumers recommended that the content of the textual health warning be presented with bigger text and catchy. The participants were further informed that there is a need for improvement on the font size to emphasize the disease being displayed. There must be a consideration of text colors that are catchy to the eyes. The use of words that are simple and understandable in layman is highly recommended. Next slide, please. Probable layout of the graphic and textual health warnings. The probable layout of health warnings for cigarette packages should include text statements accompanied by photorealistic color images to promote greater public understanding of the negative health consequences of smoking. It is highly suggested that the use of understandable Filipino text under the clear graphics depicting realistic pictures of dreaded diseases caused by smoking cigarettes. Since the respondents pointed out the use of simple words in text, it is highly suggested that the texts are in regional languages should be used for a clearer understanding of the information written in the packaging of cigarettes. Next slide, please. For our conclusion, in the light of the findings of the study, the following are the conclusions of the study. The graphic and textual health warnings are relevant in order to inform the users about the health hazards and detrimental effects of using cigarettes. The professionals display perceptions that depict a clear understanding of the content, construct, appearance, and relevance of the graphic and textual warnings. The consumers perceive that warnings in cigarette packaging, be it graphic or textual, enhance the knowledge on health hazards and cause behavioral change. Next slide po. For the recommendations, based on the findings and conclusions of the study, the following are the recommendations. Graphic health warnings in the packaging of cigarettes must be enhanced, periodically updated to inform the users of the possible health risks. Textual health warnings must be revised and constantly reviewed to fit in with the current risks and hazards of using cigarettes. The cigarette companies should, in part, take action on the constant advocacy and the promotion of healthy living through a balance between profit and corporate responsibility of informing the users on health risks of cigarette smoking. A follow-up qualitative study on how consumers react to the graphic and textual warnings must be conducted. A study on how consumers perceive and understand the graphic and textual warnings about the health risk of cigarettes must be conducted. Next slide po. That would be all. Thank you for listening. And to our panelists, we are ready for your comments and suggestions.
Thank you so much, Group 7A. May we hear first from our chair, Sir Julius.
Good morning. This group, no? I love the context of how you actually made the research. Before that, I'll ask Ma'am Jinky. Ma'am, do we have this for being part of the proposal we submitted in the campus in-house, where it just talks about evaluation of those materials for vaccination?
Those materials for vaccination only, direct. This is not part of it.
Okay, so this is one good model, no, in particular the questions that they have, no? That's the strength of the study. So if you can get the questionnaire, and then we have to validate and improve on the questionnaire, at least it will be a very good start. And if I will have to fund for this SEM, for example, that one for immunization, at least it is something doable, because there's not so much of efforts to do. You just have to set some good people to work on the evaluation together, some qualified individuals, and then using their tool, so to speak, we can finish the research for a year.
Yes.
So that's doable. So anyway, congratulations to this team. There are only concerns that I have now, because for me as a guru in research, I want things to be perfect. And I was thinking aloud of several things while I was trying to appreciate the entirety of the paper. Number one, we'd talk about the evaluators or the respondents. Can you brief me again of who the respondents are? This group, can you describe who your respondents were?
Hello po, Doc. Hello po, Direct pala.
Yes, go.
So Direct, we have two sets of respondents po kasi. The first one are the smokers or yung consumers, while the second are the experts po. Yung sa consumers po, within sa Tugigaraw lang po yung kinuha namin. While for the experts po, professionals from different places po.
What do you mean by professionals? I was anticipating there is a clear description of the professionals.
Yes po, Doc. For the professionals po, these are consists of respiratory therapists po, tapos yung mga graphic experts po, ganyan po, Doc. And then we also include doctors po, ganyan.
Okay, so there I see the misfit of the respondents. Why misfit of the respondents? When you talk about these graphic and textual health warnings, they are meant to convey messages. They are simply under what we refer to as education, information materials, or information education campaign materials, so to speak. No, In other words, no, the best of your respondents could have been health education promotion officers of the Department of Health. That would be number one. Number two would be, well, you could have the, the layout artists, a few of them, but they're not really exactly what we want to engage here, because you talk about content more than the design. Well, there must be a balance between the content and the design, but we give more emphasis on how will our general public learn, correct? So it should have been like, other than health promotion officers, you should have included as respondents our English critics, okay, things like that. Okay, I was actually also trying to convince myself as to your research design. What is your research design? What is the research design? Because I see something wrong with the flow of the procedure. So this is descriptive what? Is it descriptive, or what other design did you use?
Mary Jane?
Hello po.
Mm-mm.
Descriptive, Director, descriptive lang po yung ginamit namin dito sa...
Ayun yung sinasabi ko. Kasi hindi nyo ata, it's like this, no? The objectives were well framed. No problem with that. But remember, if the objective is the steer wheel or the blueprint of the research design is the framework of the methodology. If you look into your methodology, is it not that you had also FGDs? Right or wrong? Towards the last part, I heard something like, comments from the experts, from the professionals you were saying.
Is this
po,
FG?
Direk.
Yes
po.
Oh, so it does not fit into a descriptive design already, because it's like this. If you make a tool, example, the case of what we are trying to propose, but this is something easier, Ma'am Jinky. Sa vaccination kasi, using the COMVAC tool, if you make use of a tool, a standard one, to evaluate already existing IEC materials, then it becomes a descriptive analytical research. It falls under what we refer to as an applied research. But in your methodology, it's clear that it became, and it must be rather, a mixed method design. Now, there are two types that is applicable here. We have what we refer to as your sequential exploratory design and sequential explanatory design. Which design is best for you to use? It must be sequential explanatory design. Why? Because the results of the evaluation for content, recall, behavioral, whatsoever, should be the basis of doing your FGD. Why am I highlighting this? Kasi yung mga recommendations nyo, anak, are actually opposite of their answers in your quantitative analysis. Tignan nyo yung tool nila. Sinasabi nila, maganda ang design, maganda ang ganito, pero tignan mo ngayon yung recommendations ng mga professionals, magkasalungan. Magkasalungan. Tignan nyo yan. I was keenly observing yan. Sabi niya, ang gaganda ng mean natin, ng quantitative part. Correct? Sabi nyo, ito yung, it clearly detect the blah blah, what, mga ganyan. Pero pagdating mo sa recommendation, it contradicts your earlier finding. So it should have been, you proceed with the quantitative part, whatever you want to verify, those are the highlights of your FGD. You don't ask them again of the same questions which were already there in the questionnaire. That's redundant. FGD is meant to verify. FGD is meant to dig deeper on the issue, so it gives us a better view. I love some of the recommendations towards the last part. But this is a paper full of recommendations, correct? There's recommendations in part 4, and there's another set of recommendation in part 5. See? So I don't know, this is a thesis that is awarded to be best in recommendations, not on the very issue that you have the good ones, but well, it has a lot of areas where you have recommendations. Now, third, my point, no, in doing this research is for you to come up with a better layout. Where is that? Intindihan? It should have been like, you took one example. This is lung cancer. This is emphysema. A Marlboro something or a Mighty or I don't know what brand. Intindihan? So if this is the original layout, how do you want it to be? Bearing the inputs already of the professional. Para makita namin na, ganun pala dapat. Oo nga. Diba? Kesa agtang taga-inip kami na, okay, it should be in like this and like that. I don't know exactly. Because if you give me a cigarette pack now, the way I look at it is, that's best. That is in its best form. But if you provide me another layout to convey that there is a better form, then I would say, this is a better form. Can you do something like that? Even 3, no? Random lang. Naintindihan? Mag-sample lang tayo, mag-sampling lang tayo. Para wala kayong mga ma-violate na rules, ilagay nyo sa significance of the study yung mga cigarette manufacturers. That the study shall aim to propose a better way to convey the messages in the printed in the cigarette packs. Oh, that's it. Wala na kayong ma-violate dyan. Okay? Kasi Marlboro Philippines yung isa kasi Philips, ewan ko, naintindihan. So, ganyan. At least safe kayo doon sa ating, tawag dito, wala namang plagiarism issue dyan, naintindihan. It's a public commodity. Wala na kayong violate dyan. Nag-propose na kayo ng bago. So, kahit hindi pa kayo magpaalam, okay lang because it's everywhere. Everywhere you go, in every barangay, in every household perhaps, merong ganyang nakatiwangwang. So, di ba? So, yun yung hinahanap ko mag-propose ka ng bago. So, if I may, can some of you just work on 3, no? Tignan nyo, ang tanggalin na natin ganito, no? Yung recommendations part, doon sa chapter 4 mo, tanggalin mo, no? Ang recommendation na kailangan natin ay based on the FGD na kailangan yung i-validate din. Yung FGD result, i-validate nyo kasi it contradicts with the quantity, no? Results. Doon sa area ng recommendations nyo, layout na better. Saan nyo ilalagay yung mga recommendations na dyan sa number 3? Tignan nyo dyan yung mga recommendations na akma para doon na lang sa recommendation nyo sa baba. Naintindihan? Nakukuha nyo ba? That would be a better view. Gets, mga anak? Naiintindihan nyo ba?
Yes po, Direk. Yes
So yung chapter 4 mo, tanggalin mo yung recommendations. What I would want to see there is a better layout. Just randomly select, naintindihan, ito siya, parang gano'n. Okay? Having all the inputs of the professionals whatsoever. And then, you study again, naintindihan, recommendations you place in chapter 4. If they really do not contradict, or perhaps baka yun din yung sinasabi dun sa qualitative part ng research. Tignan mo na lang kung alin doon ang dudugtong mo doon sa recommendations part ng chapter 5. Naintindihan? Okay, so I would like to reiterate, no? Number 1, your objectives are good. No? Second, I would like to commend your questionnaire. Pero saan kayo pumalpak? Design. Hindi nyo naunawaan yung design. Naintindihan? Okay, kasi you had 2 procedures, no? 1 quanti, 1 quali, so it becomes a mixed method, sequential, explanatory. Naintindihan? So explain, deduce, whatever results you have, no, in your quanti, those would be basis supposed to be for your quali, and then of course you come up with a better layout, and then you do some sort of recommendations towards the end. Okay, that's for me, Ma'am Jinky. Thank you.
Thank you po, Direk.
Thank you so much, Direk. Tumatawa na kanina si Ma'am Jennifer. So let's hear from Ma'am Jen.
Hi, Direk. Good morning po. Ma'am Jinky, Ma'am Lily, good morning. So,
Ma'am Jen, hi Ma'am Lily.
hello po. Ay, I would like to also congratulate the group for a very nice yung study nila, best friend, yung kasi parang this is actually something na kung because isang issue nga din yun kung ano nga ba yung impact nung graphic and textual warning dun sa mga pack ng cigarettes, kung nakatulong ba siyang i-reduce yung number of smokers sa Pilipinas. So I just love how the group actually crafted yung buong study, and I also love that they make use of a mixed method to validate the quantitative part of their study. Ito lang siguro, best friend, no, kwan lang naman siya, parang more of recommendation. I totally agree with Derek kanina when he said something about the methodology. How did you do your design, as well as ito pala ang tanong ko, anak, what did you do to the professionals? You floated the questionnaire and you follow it up with an FGD. Did you do the same with the consumers?
Yes po, ma'am. Ganun po yung ginawa namin. Pero for the professionals po, ma'am, is flinote po kasi namin yung questionnaires via Google Form, and then parang nag-follow up call na lang po kami sa kanila regarding dun sa second part, which is yung sa may recommendations po.
Okay. Kasi I just don't know, pero based on our din, anak, pwede din kasing nakita nyo na sabi ni Derek kanina, parang hindi nagkasundo yung results ninyo doon sa recommendation, parang ganun. Pero kasi pwedeng nangyari dyan, anak, is nagkaroon ng doon sa methodology mismo, like you make use of a different methodology of data gathering doon sa professionals, and you make use of another data gathering method dun sa kabila naman. So these things are really really crucial kasi pwedeng yung mismong yung manner kung paano mo kinuha yung data mo can actually influence their answers. Okay? So it could have been better kung you make use of a uniform na method or way of which you have gathered your data. Like kung ano yung method of data gathering mo sa mga professionals, ganun din yung method of data gathering na ginamit mo for the consumers, to ensure that the manner by which the data is being gathered do not actually influence the results of the study kasi uniform nga yung pagkakagawa. And then siguro, darling, what can you say about their parang perception? Effective daw ba yung mga graphic na kasi doon sa presentation yung anak, you make use of mga I'll call this one yung sentences lang kung nag-agree or disagree, but it did not show there kung effective ba para sa kanila or hindi. Pag sinabi ba nilang agree, is effective yun para sa kanila? Parang something like that. So doon siguro sa part na yun, no, parang siguro kaya pa siguro nating level up pa. Kasi you just said na nag-agree, pero it does not capture kung ano yung perception nila about the effectiveness. Are you getting the point, anak? And then,
yes po, ma'am.
And then also siguro, darling, doon sa, wala kasi akong nakitang din, I just don't know if I have missed it out. Doon sa discussion na part, bakit nila nasabing ganun? Kasi you just highlighted the results, but you did not make mention about, you did not explain bakit yun yung naging result. Okay? Bakit kaya ito yung perception nila? Bakit nag-a-agree sila? Bakit kaya ganito, ganyan. So hindi ko alam kung hindi ko lang ba nasundan or I just missed the point, but I did not see any part of the discussion because you just shared to us what are the major results of your research, but I did not see how you explain it so well. Kung ano ba yung naging explanation, why do they perceive, why do they agree, why do they see it as an effective, that they're just okay with the graphic and textual, health warning printed on the cigarette packs, ganyan. Lumutang lang doon na meron silang recommendation, but I just don't know kung hindi ko lang ba siya, or na-miss ko lang yung point. Okay? So, again, congratulations everyone. I agree din dun kay Derek, no, para ma-compare kasi anak, ano ba yung ma-offer na better ng inyong research? Like for example, tama si Derek, no, absolutely excellent. Kasi ito yung present. Okay, ito yung present. But your study is actually trying to come up with a more ideal way of doing the graphic and textual warning. So why we conduct this study is in order to improve the real, and we make sure that whatever is the recommendations being generated from the is a research-based recommendation, we can apply it, and yun my point of comparison, so that my utilization yung magiging findings ng study ninyo. Okay? So, yun lang po sa akin, Ma'am Shinky. Thank you so much po.
Thank you so
you,
much,
Ma'am
everyone.
Jen.
And yes, andito pa ba ang kanilang advisor, Ma'am Lily Ann Malyabo. Advices ko to, sabi niya. Okay.
Kaya sabi ko, mag-wave ako ng ano. Good morning to everyone. First of all, congratulations to the group, no, for your accomplishment, and for completing this paper. Although, yun nga, medyo siya, may limitations talaga, no, doon sa lalo na doon sa implementation ng methodologies, no, ng research procedure. So from the comments and suggestions of Direct Julius and Ma'am Jen, siguro ang role ko na lang as their advisor is to, hindi na ako mag-critic, but to assist them in finalizing, okay, the paper. And yun nga, ang talagang direction nito is, of course, no, maganda kasi ang impact nito with regards to research, it's research utilization. So
really, I mean, no, tutukan mo to kasi if ever that we push through with the research competition by December, ito yung una mong ipasok.
Yes, direct. So, yung sa comments yung suggestions yung kanina, ano po namin, ayusin natin ganun kasi tulad nga ng sabi mo, we aim for perfection para naman po maging maganda rin yung presentation ng paper na ito. Saka talagang, ayun po, magtutulungan namin na ayusin po itong paper for to be ready for the presentation po. Thank you po, Direk and Ma'am Jen, for all of your suggestions and recommendations.
Thank you so much, Ma'am Lily. And for me na lang, no, finale. So, isasend ko sa inyo yung recommendations kasi dito sa mismo papers nyo. But, meron akong major. Wala kayong nilagay advisor sa inyong abstract page. And sa abstract, alam na to ni Ma'am Lily, the first statement must be an introduction of your paper. And it should be 150 to 200 words only. And then sa inyong research paradigm, Sir Julius, should this be IPO? Hindi ba to IVDV? Ma'am
Ma'am, hello.
Sir Julius?
Yes, okay. So, yan, isa pang usapin dun sa paradigm niya. Yes, it is an IPO because obviously you have 3 different procedures, no? What procedures was that? Number 1 is the collection, correct, of the cigarette packs, and then second one would be the critical evaluation. Okay, and the third one, yung critical evaluation mo is dalawa, quantitative analysis. And the third one is you are going to propose, yun yung empty link, no? Propose a better version. So dun sa process niya, 3 box yon, tapos 3 arrows din going to 3 different outputs.
Yes, so the output is the proposed graphic and textual health warnings, diba?
Yun yung third na output. Because you have we have 3 procedures, so 3 outputs.
Yes. So I hope andyan naman si Ma'am Lily, pero I hope the group got that. Kasi yung inyong pagkakalagay ng IPO natin, ang output niyo are the recommendations. And for,
ano na rin sila yan, nag-conceptualize na rin sila on lalo na din sa output nila na suggested graphic and textual.
yes.
Yun.
And then sa scope and the limitations and also for your respondents, hindi nakalagay kung, kaya tinanong kanina ni Sir Julius, sino yung mga professionals? So wala tayong inclusion, exclusion. So I think meron akong example sa activity natin na to. We should have like experts according to like, are they, sabi nga ni Sir Julius kanina, like, yung sa akin kasi like it's a manual, so it's an instructional material expert, test expert, mga ganun. So there should be experts like tinanong nga ni Sir Julius kanina, dapat ang mga tumingin nito are yun nga,
health, education promotion officers.
Officers, yes.
Tapos you have English critics, ganyan, health teachers, mga ganyan.
Yes.
And
so
then another one, ma'am, I forgot, no. Since you have 2 sets, no, of procedures and obviously 2 sets, no, I think 2 sets of respondents, students and the health professionals. Remember for the FGD, the basis for selecting them, because you have only 8 to 12, no, individuals, would be roles.
Yes.
Okay, roles portrayal ang mga yan. So sino sila dun sa FGD mo? No, hindi lang yung baka pare-pareho. Kunwari, lahat sila health promotion education officers. Edi wala na, hindi na pare-pareho lang yung magiging recommendation. So paki-highlight din yun sa FGD kung bakit ano yung basis nyo of selecting them as your respondent. So it's basically highlighting their roles.
Yes. And then, yun nga, originally ang nakalagay dito is descriptive analytical, but because you have FGD or interview yung ginawa nyo dito is dapat siya ay mixed method na, sabi ni Sir Julius. It's you have a quanti and a quali part already. So ang mas fit dito, Ma'am Lily, is sequential explanatory. Yun nga yung sinabi ni Sir Julius because they did the quantitative part first. And then yun ang kukunin nila, yung their findings for that, ang kukunin nila for their FGD questions or their interview questions. So going to your chapter 4, mali yung pagkaka-title nyo dito, no? Ma'am Jen, paano ba ang title nito sa table na to? Hindi naman siya mean standard deviation.
Yes, best friend. Ano siya, best friend? Diretso lang. Perceived effectiveness of blank, blank, blank by ganito. Tanggalin nyo na yung mean standard deviation. Ganun. Just based it on your research objectives.
Yes.
Tanggalin nyo na yung mean standard deviation doon mismo sa title. Ayun, best friend. Thank you.
Thank you, best friend. And then, ito, bakit may naka-bold dun sa mga first na table nyo? Hindi ko naintindihan bakit may naka-bold.
One lang yan. Best friend, tama ba? Dun sa table presentation, if they make use of APA, yung table number lang yung bold, tapos italicized na yung title ng table.
Yes, best friend. Pero dun sa mismong table kasi nila, may mga 2 of the 5 sentences may naka-bold. So, may naka-bold na mga sentences. Bakit nga ba, Mary Jane? Hindi naman siya negative.
Hello, ma'am. Ma'am, hinighlight lang po namin yung yung highest at saka yung lowest po namin. Kaya naka-bold po siya.
Ayun, hindi nyo kailangang i-bold. Dapat meron siya dun sa ninyo.
Yes,
or kung meron yung ganito, dapat na naka-bold is the categorical mean actually. And what's mean na hindi nabanggit ni Sir Julius, na lagi niyang binabanggit sa ibang batches, is wala kayong overall mean. Saan effective na part? Is it in terms of content? In terms of, so after, kasi sa inyo, pinaghiwa-hiwalay nyo yung table nyo on the content on the construct, on the relevance, mga ganon. So
Yes
dapat
po, ma'am.
after all of these ones, sa mismong professionals lang, you have another table. After natapos nung dun sa professionals, you have another table na it shows yung categorical mean ng lahat. Na gets ba yun, Mary Jane? We do that
Yes
activity.
po, ma'am.
Exam nyo ata yun. Hindi ko alam exam or activity nyo yun. Meron siyang in terms of yung content, construct, face, appearance, and then you compare all those. Aside from the individual tables na meron kayong overall na table. Only for professionals muna. And then the same thing as dun sa meron kayo sa consumers. And pwede rin sana, after all the consumers and professionals, i-side by side mo. If pareho
Yes po,
yung
ma'am.
mga constructs na ginamit doon, kung ano yung tingin ng professionals, tingin ng consumers. Parang ganun. Pero overall, maganda yung discussion after you've presented kung ano ang mataas, mababa. You have backup already of your literature. Bakit ganon? Bakit kaya ganito? Kaso may kulang nga. Yung kulang na yun, yung part na yun. And then the part na recommendations of the professionals and consumers to improve the graphic warnings. Sabi mo, nag-thematic analysis ka, but I don't see the themes. Meron ba? Wala akong nakita. It's like 2-3 paragraphs, pero walang theme. Tapos wala yung verbatim. Every time we do a thematic analysis, ano yung mismong sinabi ng mga professionals? Ano yung mismong sinabi ng mga consumers natin? So wala dito, wala akong nakita. And then same sa professionals and sa consumers also. And then yung probable layout nyo, sinabi nyo probable layout, pero wala naman yung layout. Yun yung hinahanap ni Sir Julius kanina. Na
Yes, ma'am.
output
Naka-word lang po siya, naka-in sentence form po. Pero we'll work out on this po, ma'am. Gagawa po kami ng probable layout po.
Maganda yung questionnaire nyo nito. So you do probable layout. Yung questionnaire nyo ata kasama yung iba-ibang graphic warning. So yun ang pwede nyong tapatan lahat. Especially RT kayo, maganda na kay Sir Julius, mabait pa Sir Julius, gusto niya sample lang. Ako gusto ko lahat ng existing. Kasi meron kayo for emphysema, meron for something. So ilan lang actually yun? Ilan yung meron?
Mag-hoard na sila ng cigarette packs.
Hindi, meron na sila. So, Ma'am Ili, nandun sa questionnaire nila eh.
Oh,
Yeah. So, yun nga, ang sabi ni Sir Julius, maganda itong paper ninyo, dapat marami siyang recommendations. So, nakulangan ako sa recommendations kasi maganda nga yung, and may recommendations na tayo by the consumers and the experts. Pero from the quantity also, kaya nga sabi ni Ma'am Jen nasa procedure. Dun sa quantity natin, meron silang mga nag-neutral sila, meron yung mga agree lang, may nag-disagree naman dun sa iba, pero meron yung mga nag-strongly agree. So, dun tayo sa bakit agree lang kaya ito, hindi strongly eh. Sabi nga ni Sir Julius, parang best na yung nakikita nating fact. Sana strongly agree lahat ng sagot nila, pero hindi ganun yung sagot nila. So, yun lang for the group. Congratulations sa group. This is one of the groups na sobrang makulit. But I do appreciate na makulit sila, Ma'am Lily. Yeah. So, congrats sa group na to. Do you have questions for us? I'll be sending this one. I think si Carlo yung laging nangungulit sa akin. So, I will be sending itong mga recommendations, tong papel nyo mismo kay Carlo. Meron kayong tanong, Mary Jane, Charisse, Trisha, Carlo, and Mika?
None so far na po, ma'am. Yung mga recommendations nyo po is i-improve na lang po namin sila sa paper po namin. Thank you po.
Anak, dahil gustong-gusto ni Sir Julius itong paper ninyo at presentable talaga siya. If you can go back or you can add yung mga hinahanap namin, yung education promotion, I think kinontak yung DOH for this one, di ba?
Yes, ma'am. Ma'am, si advisor po namin, si Ma'am Lily po, yung nag-contact. Pero ang sabi po niya is hindi daw po ata sila nag-send sa message. Ang busy
Busy
daw
kasi
po
ang
ata sila,
hepo.
ma'am.
Ang hepo. Baka this SEM, kasi di ba mag-duty ang mga public health doon. So, siguro,
Ma'am Lily,
Pero
they
ang
have,
contact ko kasi doon si Sir DJ, medyo busy sila ngayon ng...
oo, sa kanilang
OT sila doon, Mare. Nadatnan namin silang nag-OT doon.
At saka lately kasi ewan ko kung kasali siya sa mga nag-quarantine. Kasi, ito yung finalization na rin sana namin. Pero okay lang, itong SEM naman, since may internship naman ng public health. So,
pwedeng
mag-a-ask.
add nila, kasi parang maganda nga ito. Ito ay magandang
Pero yun nga, kaya integrate namin yung recommendations nila ni Dean at saka ni Ma'am Jen, saka ikaw. Actually, di ba co-advisor kita, Char? Dalawa tayo dito. Pero hindi. Tawag dito, yun nga, para mas maging maayos at mas presentable din yung result. No?
Yes.
Okay.
Yes, ma'am.
Tulad ito nila Ralph So,
Yeah, yung may babalikan sila. Kaya sabi ko, after,
makulit.
marami pang gagawin after.
Sila Ralph, actually, nasa process na sila ng nung sa proposal, program proposal, program plan na sila.
Oo, tapos na sila. So ito, instead of program plan, yung kanilang mismong layout. Ang kanilang ipapakita. Okay, thank you.
So, congrats. Andiyan na si Ma'am Lily at Ma'am Jinky, mga anak. Naku, carry yan. Diyos ko. Congrats.
Thank you po. Thank you so much po sa inyong mga panelists po and sa advisor namin at kay Ma'am Ikay po. Thank you po.
Ma'am Jen, Sir Julius, tsaka Ma'am Lily, I sent already yung grade sheet natin para si Ma'am Jen kasi bago dito. Agad best friend para hindi mo malimutan ang kanilang papel.
Okay.
Group 2 na tayo.
So thank you presenters and thank you panelists for your recommendations and inputs. So let's now welcome the other group for their presentation.
Good morning, everyone. In behalf of my group mates, I will be presenting to you our study about the knowledge and attitude of mothers towards pediatric hypertension in Barangay San Jose, Centro, Enrile, Cagayan. Next slide, please. According to the American Academy of Pediatrics, pediatric hypertension is defined as repeated or systolic diastolic blood pressure of above 95th percentile for children aged 1 to 12 years old and a BP of greater than 130/80 mmHg for children 13 years old and older. Over the past years, the prevalence of pediatric hypertension has been on the rise. Along with that trend, several studies were conducted to further understand pediatric hypertension in terms of its etiology, signs and symptoms, diagnosis, and treatment and management. In connection to that, multiple factors were found to be the causes of childhood hypertension, among which are obesity, diet, gender, academic stress. These are found to be the leading causes of primary pediatric hypertension. In addition to that, obesity has been directly associated with primary pediatric hypertension, and the prevalence of obesity has also on the rise, especially on developing countries such as the Philippines. Next slide, please. Furthermore, pediatric hypertension is found to be a significant predictor of adult hypertension and poses a threat to long-term cardiovascular risk. However, with all the existing gaps and regarding pediatric hypertension, it has always been overlooked and undiagnosed. This is in particular for physicians who, among the several conducted studies, are having difficulties in identifying and diagnosing pediatric hypertension. In light of that said issue, this study aims to evaluate the knowledge and attitude of mothers towards pediatric hypertension to help in understanding the disease in terms of its diagnosis, monitoring, evaluation, treatment, management, and prevention and control. Next slide, please. For the statement of the problem, generally, the study aims to evaluate the knowledge and attitude of mothers towards pediatric hypertension in Barangay San Jose, Centro, Enrile, Cagayan. Specifically, it aims to answer the following questions. Number one, what is the demographic profile of the respondents in terms of age, highest educational attainment, type of family, ethnicity, number of children, zone, and number of seminars attended. For socioeconomic profile in terms of their occupation, average monthly income, religion, membership to organizations, appliances at home that harness health information. And for their health-seeking behavior, the course of action during health-related problems, times of consultation. Next slide, please. People they reach out to for health-related problems, institutions they visit for health concerns, and channels or resources about health issues. For their habits and lifestyle, that includes alcohol consumption, cigarette smoking, exercise, and food preferences. Number two, what is the level of knowledge of the respondents towards pediatric hypertension in terms of signs and symptoms, treatment and management, prevention and control, and the contributing factors? Next, what is the attitude of the respondents towards pediatric hypertension? Number four, is there a significant difference in the respondents' level of knowledge and attitude when grouped according to profile variables? And lastly, is there an association between respondents' knowledge of pediatric hypertension with that of their attitude? Next slide, please. For the methodology, the researchers of this study use a descriptive correlational research design to describe the knowledge and attitude of the respondents toward pediatric hypertension. After gaining permission from school and from the chosen locale of the study, the researchers use consecutive stratified random sampling to determine the participants of their study who are mothers under reproductive age from Barangay San Jose, Centro, Enrile, Cagayan. The sample size was computed by using the Slovin's formula and were equally divided for 5 zones of the barangay through proportional allocation. Meanwhile, this study adopted questionnaires from studies conducted about pediatric hypertension. The questionnaire is divided into 3 sections: for the profile of the respondents, for the assessment of knowledge, and for the attitude of the respondents. Before the researchers proceeded with their data gathering, the adopted questionnaire was validated and undergone reliability testing. The questionnaires were floated by the researchers themselves. After the questionnaires has been retrieved from the respondents, the data were coded, computed, analyzed, and interpreted. The profile of the respondents was described using frequency and percentage distribution, while the level of knowledge and attitude was determined through mean scores. Meanwhile, non-parametric tests was used to compare the responses on knowledge and attitude with that of their profile. Similarly, the non-parametric test Spearman correlation was used to show the relationship between the participants' level of knowledge towards pediatric hypertension with that of their attitude. Next slide, please. For the results of the study, the table shows the generated result for the demographic profile of the respondents. As we can see, most of the respondents are those who are in their middle adulthood. According to studies, the age 35 to 49 years old are regarded to be the age with high fertility rates. In terms of educational attainment, most of the respondents were college graduates. Most of the respondents also maintain a nuclear family. Indeed, nuclear family is still the basic building block of most Filipino families. Next slide, please. The study was also dominated by Itawes, which is just natural since the respondents are from Enrile, Cagayan, where most Itawes resides. Then, moving forward, most of the respondents have 1 to 2 children. Among the 120 respondents, there were only 16 who reported to have attended at least 1 or 2 seminars. Some of the respondents supported this because, according to them, they do not have the luxury time to attend seminars and that there are actually no seminars intended for them to attend. Next slide, please. For the socioeconomic profile, based on these tabulated results, it shows that most of the respondents are employed. Majority of the respondents had an average monthly income of below 10,975 pesos. This resulting monthly income supports the respondents' occupation, which are mostly small businesses and sari-sari stores. The study was also dominated by Roman Catholics. As for the appliances that harness health information, almost all of the respondents reported to have multiple gadgets at home, particularly mobile phones and televisions. Next slide, please. For the health-seeking behavior of the respondents, the table shows that most of the respondents practice self-medication in times of medical needs. This part is quite alarming since we all know that self-medication has been one of the public health's concern. This result is followed by those who consult a physician but only when sickness worsens. Most of the respondents were also reported to visit a medical institution at least once a year. Next slide, please. Majority of the respondents were also reported to visit a medical institution at least once a year. Majority of the respondents also reported that they consult a physician in times of health issues. Most of the respondents also prefer to visit their own rural health units. Lastly, the respondents reported that TV news reports and social media posts has been their main source of health information. Next slide, please. As for the respondents' habits and lifestyle practices, there are only 8 of them who reported to be occasionally drinking alcoholic beverages. Not surprisingly, none of the mothers indicated that they smoke. In terms of physical exercise, most of the respondents reported that they do exercise occasionally. This is probably because of their busy schedules on their household chores and jobs. As for food, many of the respondents still prefer vegetables over anything. Next slide, please. For the respondents' level of knowledge, the table summarizes the level of knowledge of the respondents towards pediatric hypertension from signs and symptoms to contributing factors. Generally, the respondents were very knowledgeable on signs and symptoms, prevention and control, and contributing factors, while highly knowledgeable on treatment and management. These findings could be related in some factors as presented in their profile variables. First, the level of knowledge could be attributed to their educational attainment. Since most of the respondents were college graduate, it could be assumed that they went through some higher studies in different fields, whether general education or in their major course, as these were required in their college level. However, we cannot generally conclude that all mothers are very knowledgeable and well aware of pediatric hypertension, since this study is bounded only to one barangay and the assessment of knowledge conducted is limited only to the respondents' perception. Lastly, since majority of the respondents were connected through TV news reports and some social media posts, it was very much possible that they were updated of some topics, lessons, and ideas about pediatric hypertension. Next slide, please. For the attitude of the respondents based on the table, based on the table, it shows that the respondents have high regards towards pediatric hypertension. Furthermore, the highest among these questions was, I feel like I want to know the signs and symptoms of pediatric hypertension. Next slide, please. Next pa. This result yields to a conclusion that the respondents are curious about the signs and symptoms of pediatric hypertension, and they are well aware of its risk. This result is supported by numerous studies conducted about the etiology and prevalence of pediatric hypertension. First, over the past years, the prevalence of hypertension among children and adolescents has been on the rise. Secondly, studies have shown that high blood pressure in children can result in serious long-term health effects, including cardiac diseases, renal diseases, and stroke. These findings on the attitude were very much favorable for the respondents because they have positive attitude towards pediatric hypertension. Next slide, please. For the significant difference on knowledge and attitude towards with their profile variable, the table shows the results of the study. Among the profile variables, only the age and times of consultation yielded a significant difference. As for the age, it can greatly affect the respondents' knowledge, as we can see from the demographic profile of the respondents. Most of them are in ages 35 to 49 years old, where it can be inferred that mothers at this age have enough experience in parenting. The rest of the respondents are considered to be young adults, in which it can be concluded that these age groups have easy access to all forms of communication and acquiring information, and thus have updates on the events of their society. Likewise, with the time of consultation, this supports the results of the study, where respondents are very knowledgeable about pediatric hypertension. All those respondents who consult in various schedules, except for those who consult twice a year or more, were very knowledgeable about pediatric hypertension. Also, most of the respondents were college graduates. According to Cardol et al., a mother's educational level has been shown to be a strong predictor of frequency of children's new consultations. This result could mean that the times of consultation in healthcare institutions had an influence in the level of knowledge of the respondents. Meanwhile, only the occupation among all the profile variables yielded a significant difference for attitude. Aside from the significant difference, it showed also that except for blue-collar job mothers, all other type of occupation had a high regard on the items presented to them regarding their attitudes towards pediatric hypertension. Furthermore, women's lives are marked by complex work and family routines that have implications for their children's health. Prior research suggests a link between mothers' work hours and their children's weight. But few studies investigate that child health implications of increasingly common work arrangements, such as telecommuting, and flexible work schedules. Next slide, please. For the association between the respondents' level of knowledge with that of their attitude, the table shows that there is no correlation between the respondents' level of knowledge and attitude. This means that the level of knowledge was not associated with the level of attitude of the respondents. Even if mothers are highly knowledgeable about the disease, it had no impact on their attitude in dealing with it. This corresponds to the study which states that the amount of knowledge had no effect on attitude, behavior, consistency. The following slides will be discussed by another member. Kayla.
For the summary of findings, the profile variables represent greatly the nature of respondents. This showed their physical, mental, social, and other related conditions pertaining pediatric hypertension. The respondents generally were very knowledgeable on the causes and risk factors, signs and symptoms, and prevention and control, while they are regarded as highly knowledgeable on treatment and management of pediatric hypertension. Similarly, most of the respondents had strongly agreed with the attitudes relative to the pediatric hypertension. Thus, they have high regard on these conditions or ideas. Next slide, please. Also, only the age and times of consultation yielded a significant difference for knowledge, and only the occupation indicated for a significant difference on knowledge. Lastly, the result of the study shows that the level of respondents' knowledge was not associated with that of their attitude towards hypertension, pediatric hypertension. Next slide, please. For the recommendations, parents, particularly mothers, should further engage themselves in all ways to acquire information such as attending seminars, reading articles, and participating in programs and advocacies regarding pediatric hypertension in order to refresh and update their knowledge and improve their attitude towards pediatric hypertension. To the Department of Health, they should conduct seminars, symposiums, posters, and other forms of campaign strategies to increase the level of awareness against pediatric hypertension, not limited to one place, barangay, city, or town, but to the entire country. The Philippine Society of Hypertension should involve not only the adults in their campaigns in raising awareness such as Hypertension Awareness Month and May Measurement Month. Next slide, please. To the healthcare providers, physicians, nurses, and midwives should establish a good plan of action in achieving positive therapeutic outcomes by motivating the pediatric patients and their parents to adhere to the treatment and best practices against pediatric hypertension. All forms of healthcare institutions should make ambulatory blood pressure monitoring as part of the routine assessment to all pediatric patients. To the rural health units, they should advocate dietary approaches to stop hypertension or the DASH diet as part of their campaigns and to make it accessible for both children and adults. Next slide, please. To the local government unit, they should establish an effective and feasible program to strengthen advocacies concerning pediatric hypertension. Epidemiologists should aid in the development of future programs and interventions for effective health education in the community. Lastly, the future researchers should broaden the scope of their study and consider other research design as the study focuses more on descriptive area where it can be made or substantiate more in a qualitative study to further understand how to expound the knowledge and attitude as well as the practices of mothers towards pediatric hypertension. And that would be all po. Thank you. And we are now ready to hear your comments and recommendations po.
Thank you so much, Group 8B. We listen to Sir Julius' comments. Is Sir
Ma'am Ikay, I think Ma'am Lily can go first. I'm talking with Jello. Probably I'll come in 5 minutes.
Sige po. Ma'am Lily, mauna ka na. We also acknowledge the presence of our advisor for this group, Sir Kelvin is here. Hi, Sir Kelvin.
Hello, ma'am. Good morning po. Hello,
Hi,
sir.
Mr. Morning.
Maganda yung pagkakasulat ng paper nila. Maayos, Ma'am Jen, di ba?
Hindi ko kasi nakita yung mismong paper, best friend. So more of PowerPoint presentation lang ang ano ko.
Ay, ganun. Nakala ko sinend ni
Oo.
Ma'am Dorina sa'yo.
Baka na ano ni Dean, best friend, baka na ano niya, nalimot niya
Oo,
siguro.
sige. Forward ko ngayon, best friend. Kasi,
Sige, thank you. Sige,
Ma'am
sige.
Lily, go.
Okay.
Maayos naman kasi si Sir Kelvin ang advisor. Sure. Sige, good morning to everyone. Congratulations to the group, no, for your completed paper. First we shall start dun sa abstract kasi usually ito naman yung comment ko, no, dapat ang nakalagay doon is yung ang i-emphasize niyo doon is yung yung main problem na kailangan nating i-resolve dito sa ating research. So though you have emphasized naman on pediatric hypertension. So and you have linked this with the different factors or contributing factors associated with pediatric hypertension. Ang hinahanap ko is yung siguro yung baseline assessment, result ng baseline assessment nyo, or yung kung nag-baseline assessment ba kayo on the prevalence of pediatric hypertension, most particularly in the local that you have chosen in the study. Diba? Kasi syempre, kaya tayo gagawa. Kasi usually, kapag kaya tayo gumagawa ng knowledge attitude studies, mga CAP studies, is yung meron, meron talaga tayong basis na kailangan talaga siyang aralin doon sa area, doon sa local nyo or doon sa kung saan nyo piniling gawin yung study ninyo. Okay? So, ang tanong ko, una, bago tayo pumunta doon sa ibang parts ng paper, naggawa ba kayo ng baseline assessment ninyo with regards to prevalence of pediatric hypertension?
Good morning po, ma'am. Ma'am, trinay po namin pero wala po kaming makuhang data from CHO or sa barangays po kasi, ma'am. Kaya yun din po, naging knowledge and attitude nga lang din yung study namin, tinanggal namin yung practices kasi hindi po kaming makuhang prevalence at saka hindi po namin makita kung ilan talaga yung may pediatric hypertension.
Yun din. Anyway, siguro yun sa mga clinics, wala. Sa mga pediatric clinics, hindi kayo nag-try?
Ma'am, nag-try po, ma'am, pero sabi po ng mga private clinics, kami daw po ang magmano-mano na maghanap sa medical records nila.
Okay, that's tasking. That was, anyway. But with regards to the contributing factors, like, or the disease factors and yung mga underlying diseases associated with pediatric hypertension, did you not do research on that? Yung sa mga, like for example, di ba, you have made mention of, for example, you have kidney diseases, no, that may contribute to the development of pediatric hypertension. Tapos yung mga cases of obesity, doon sa area, walang ganong assessment.
Sa mga respondents po, ma'am?
Oo.
Wala po, ma'am.
Kasi for example, sa Baggaw ba maraming obese na mga children?
Hindi na po namin
isang risk, that's one of the primary risk, parang ganun no, of the development of pediatric hypertension. So at least kahit sana meron tayong baseline nun para talagang yun lang, no, para mas may mas ma-highlight na merong mga ganitong factors that may lead or contribute to the prevalence of pediatric hypertension. So siguro yun isa sa mga suggestions ko. Try yung ang ano ko kasi dito kay ang isa sa mga suggestion ko, dapat meron yung para mas maging maganda yung impact. Okay? Though very good naman yung result. Kaya sabi ni Ma'am Jiki, ang ganda din ng pagkasulat ng inyong papel. No, pero yun lang, kailangan may present natin kung ano yung actual scenario that or actual risk or contributing risk to the prevalence of pediatric hypertension, most particularly in the area where you chose to do your research. Kasi para din to parang ang end result din nito, directed din siya towards implementation of programs that would help prevent the occurrence or the prevalence of pediatric or of hypertension among children, kasi sila na pala ngayon ay vulnerable with this type of disease. Diba? So, ang bata pa lang nila, tapos, you have hypertension na, and nasabi niyo sa literature niyo that their history would, of course, is associated with the development of hypertension, adult hypertension or hypertension in the future. Okay? So, ano yung research design ninyo, dear?
Descriptive correlational po, ma'am.
Descriptive correlational. Tapos yung inyong sampling ay?
Consecutive stratified random sampling po, ma'am.
Oo. So, ano yun? Sorry. You have?
Stratified
random sampling. Okay. Paano nyo sinelect yung mga participants?
Ma'am, after po namin makakuha yung overall population ng mothers under reproductive age sa barangay, ma'am. Tawag doon? Kayla, ikaw yung nag-compute, di ba?
But mothers on reproductive age,
Ma'am?
Mothers. Mothers na yan, Ma'am Jinky, di ba?
Yes.
Women on reproductive age, dapat.
Mothers na yun eh.
Mothers na yun eh, di ba? Mothers ang nyo, di ba?
Mothers na lang dapat.
Mothers na lang.
Na may children na age.
Oo.
Not
so, mothers with children, ganun, di ba? Oo. Kasi kung women of reproductive age, yon. Pero kung mothers naman ng respondents yun dito, di ba? So, mothers with children, yun ang, yun ang basis nyo?
Yes po, ma'am.
Oo. Tapos, ano yung inclusion niya with children?
Age 1 to 18 years old po, ma'am.
Age 1 to 18.
Para, 1 to 17, para
considered pediatric, yun ang age. Oo. Okay. Tapos, okay. Tapos nag-proportional allocation kayo. Tama? Parang parang kina-Ralph din.
Yes po.
Sige. Wala kasi yung Pwedeng balikan natin yung sa research objective. Okay naman tayo doon sa inyong sampling. Ayan. Ang dami nyo ding ang dami nyo ding inassess dun sa profile ng mga respondents. Okay? Ang maganda dito, importante kasi itong profile na to assess, to relate to the knowledge and attitudes of mothers. So doon sa result ninyo, dapat medyo tawag dito, mas ano ba yung tawag dito, Ma'am Cindy? Para maikwento nilang mabuti, no? Mas, kasi marami din kasing mga significant results, no? Marami kayong factors that may be associated with the knowledge and attitudes of mothers towards pediatric hypertension. Doon sa result ninyo, tingin ko improve nyo na lang on how you are to relate, no, the significant factors, okay, to that of ano yun, yung i-associate nyo siya with that of the knowledge and attitude of the mothers. Okay? Though, yun nga, sabi ko, maganda yung pinag-present nyo nung inyong result. Okay? And I think, tawag ito, na i-present nyo naman, okay, ng mabuti yung mga different variables that are associated with the knowledge and attitudes of the mothers. Siguro, Ma'am Jinky, pwede ko bang i-review yung sa may conclusion at recommendation part nila kasi medyo hindi ko na ano kanina.
Sige, ma'am.
Si Ma'am, na lang muna, si Ma'am, si Ma'am Jen, kung meron siyang
sige, we skip muna yung summary, conclusions, and recommendations.
Summary, conclusions, and recommendations na lang kasi hindi ko siya narinig kanina.
Yes, so
Pero yun ang major na yun ang major suggestion ko. Sana meron silang preliminary baseline assessment in order to present, no? Yung gap na kailangan nilang i-resolve specifically dun sa area kung saan nila ginawa yung research study.
Yes. Thank you, Ma'am Lily.
Ma'am Jinky.
Okay na ba si Sir Julius? Sige, Ma'am Jen na muna at may kausap pa Sir.
May kausap ata si Direct Best Friend. Ayun, so congratulations sa group na ito, no? So mahirap mag-collect ng data sa panahon ngayon kaya having able to accomplish and finish the conduct of the study ngayong panahon ngayon is already a big achievement. Okay, so congratulations. Hindi ko pa kasi nabasa yung buong paper nila. Pero I agree with Ma'am Lily, siguro maganda kung yung naging basis of selecting the barangay is yung barangay na may mataas na pediatric hypertension, highest na recorded na pediatric hypertension na cases. Okay, so para maging more scientific yung pagpili doon sa local ng study. Ito lang anak, na-appreciate ko na lumabas sa findings ninyo na ay doon sa survey ninyo na wala silang masyadong pediatric hypertension seminar. Okay? Kasi talagang ibig sabihin pagdating sa information related to pediatric hypertension, parang hindi pa ganun ka well reinforced. Ngayon, ang question ko, darling, is may question kayo dun sa profiling ninyo na kapag meron silang health-related problems, kanino sila nagre-reach out? Now, are you talking about doon sa kapag nagkaroon ng health-related problems yung anak nila? Kanino sila nagre-reach out? Or sila mismong mother respondent kapag sila ay nagkaroon ng mismong, meron silang sariling problem related to health, kanino sila nagre-reach out?
Ma'am, yung general po, ma'am, sa inter-household nila, parang ganun.
So kapag kunyari ako yung mother na ina-interview, tinatanong mo ko kung kanino ako nagko-consult ng aking health-related problem, sa nanay ko, parang ganun? Or kapag in case na nagkasakit yung anak ko, ako bilang parent yung unang
Ma'am, sa anak po, ma'am.
Sa context ng anak?
Yes po, ma'am.
O yun, kaya medyo misleading siya anak. Why I come up with that question, darling? Kasi dun sa succeeding na questions ninyo, ang tinatanong niya is yung activity ng magulang. Kung how often do they exercise, parang something like that. In which kung ito ay pediatric hypertension, I don't know if I'm getting it right, no? Pero ang na-imagine ko kasi is tatanungin ninyo kung how often nila pinapa-exercise yung anak nila, ano yung mga activities and routines ng anak nila. Parang ganun yung expectation ko. But it turned out na ako bilang nanay, ako yung tinanong mo. Pero ang problem natin is all about pediatric hypertension. Parang ganun. So, I don't know kung nagkaroon lang ba ng mismatch with the way I see it and with the way kung ano ba yung general na impression about it. Kasi it turned out, anak, na dun sa knowledge nila, mataas yung knowledge nila. Okay lang ba makita kung ano yung breakdown nung how did you do the measuring of the knowledge ba? Kasi very knowledgeable, yet pagdating sa attitude nila, they felt the need to attend more seminars and trainings. Parang may ano ba, parang may disparity between the knowledge and the attitude. And then meron din sa seminars na sinasabi nilang wala silang masyadong na-attendan, parang ganun. So meron lang akong gustong tingnan. How did you do yung sa mga questions ninyo about knowledge ba?
Ma'am, yung sa knowledge po, hindi lang po namin nilagay yung yung table nung specific po for
Yung items? Oo.
Yes, ma'am.
Oo.
Ma'am, ipakita po ba namin ngayon,
Oo.
ma'am?
Okay lang ba makita, anak?
Sa mga ka-group ko, sinong pwedeng mag-share screen sa inyo?
Yun no, kasi medyo na ano nga ako, kasi sabi sa results ninyo, very knowledgeable. Yet pag in-assess mo yung kanilang seminars and training, wala silang seminars and trainings na attendan masyado. In fact, medyo alarming yung number kasi wala nga silang masyadong na-attendan. And then doon din sa attitude, sinusupport niya din na wala nga silang na-attendan. Kaya sinasabi nila that there's really a need to attend, they felt the need to attend. Yet doon sa knowledge niyo pinapakita na they are very knowledgeable about these things. Parang ganun. So, yun siguro yung isa sa mga gusto nating malaman, anak, no? Okay lang ba makita kung paano mo siya ginawa? Kahit yung raw na questionnaire. Yes, yung raw lang na question, anak. Silip lang.
Sige po, ma'am.
Okay, sige.
Hintayin
Thank
ko
you.
lang po yun.
And then, anak, how did you do your sampling here? You made mention of while waiting doon sa anak, no? Consecutive stratified random sampling. How did you do that?
Ma'am, nung nag-agree po yung sa barangay, ma'am, since sabi po nila wala silang, kami po mismo yung nagbilang doon sa data nila ng mga, ng tawag doon, ng mga citizens sa kanila, ma'am.
Na mother.
Binilang po namin mismo yung mga mothers na hinahanap namin.
And then, after that?
Tapos nag-proportional allocation po para sa 5 zones, ma'am.
Okay,
since 5 zones na po yung available na nabigay.
Okay, so dun sa 5 zones ninyo, anak, how did you float your questionnaire? Like pagpunta ninyo doon sa area, nag-float kayo ng questionnaire? Or
Yes,
nag-identify muna kayo ng mga taong pagbibigyan ninyo ng inyong questionnaire? How did you do it?
Ma'am, tanungin ko lang po yung ka-group ko na siya po mismo yung nag-float.
Sige.
Kayla?
Hello po. Ay ma'am, doon sa pag-float po, ma'am, nung na-identify ko na po yung names, yung mga pasok po sa criteria, pinuntahan ko na po agad sila pagka-sign po nung consent sa barangay.
Ilan sila lahat, anak?
Ma'am, 120. 120 po.
So, nag-random selection ka na sa kanila after mo silang ma-identify?
Opo, ma'am.
Oh, I see. Kasi kadalasan kasing anak problem pupunta sila doon tapos ibigay na lang nila doon sa mga mothers yung questionnaire, parang ganun. So they did not really do the parang selection, parang ganun na meron kayong may frame population frame kayo na pinagbasehan. Okay, so I appreciate that. And then sige, doon nga sa questionnaire, anak, tingnan natin kasi doon sa times of consultation, frequency siguro yung more appropriate term natin doon, anak. Frequency of consultation with that of knowledge. Mas knowledgeable yung twice a year lang yung pumupunta sa ano, 'di ba parang ano siya, parang
May ano po, ma'am.
come again?
Sabi po sa result, ma'am, mas yun sa may mga paano ba?
Nagko-consult?
Yes po, nagko-consult sa once a year. Both po na yung mga nagko-consult once a year or yung sa twice per year ba yun?
Oh, twice a year. Oh, nakita ko yun. Pero what about yung every month?
Every month, ma'am.
Parang yun kasi yung medyo nagtaka ako doon, no? Kasi bakit parang parang it's quite unconventional ba? Eh gusto ko makita yung knowledge na talaga. Sige nga anak. Sige ta baka may ano.
Kailan yung buong knowledge part ang ipakita mo muna? Ma'am, yan po ba na questionnaire, ma'am?
Yeah. Sige. Yung sa knowledge na. Ano to? My gosh. And then you get the mean ano. So for example, yan yung ano, tas dinescribe ninyo. Okay. Anyway, maybe it will just be part of my recommendation na lang siguro. I'll just make a comment on the paper na anak. Kasi usually, ang ano kasi, mas maganda siguro kung we make use of parang frequency counts, kung ilan sa kanila yung knowledgeable, ilan ang hindi, mga ganun to best describe the data rather than making use of yung mga mean score kasi mukhang hindi talaga siya sumasakto doon sa iba pang, parang yung consistency nung results. Okay, sige. Yun lang naman sa akin, darling. I'll just make my recommendations doon na lang sa paper ninyo. So thank you so much and congratulations.
Thank you po, ma'am.
Okay. Ma'am, hingin na lang namin yung recommendations sa paper nila soon sa'yo. Sige, for my part, pwede na ba si Sir Julius? Okay, ako muna.
Pwede na po.
Okay, pwede na Sir Julius. Sir Julius muna. Okay.
Pakilagay nga doon sa title.
Title, please.
Ayan, yun na yun. Doon sa objectives mo na, doon na yung title niya, di ba? Sige, o yan na, period. So number 1, you said knowledge, attitude of mothers on pediatric hypertension. Now, I would like to ask, is pediatric hypertension really a common issue or a common circumstance? Yes,
Sir,
correct?
Yes po.
Yes, you see that, no?
Yes,
Commonly occurring, correct? Only that, probably a lot of mothers do not know about pediatric hypertension. That's why the issue there is you should have completed the KAP recommendation na lang, no? You should have had completed the KAP framework because the practices matters much. Knowledge affects practices. Attitude affects practices. The most important among the 3 domains would be the practice. Why? Because if they are doing things which are wrong, then we should have had corrected. If they are doing things which are right, then that is what we have to commend. Madali lang kasi kapag may problema ng knowledge, naintindihan? Madaling i-cure yan. Madali rin i-cure ang problema ng attitude. Pero napakahirap i-cure ng problema pagdating sa practices. Because in philosophical constructs, it says you cannot change people's practices overnight. Naintindihan? People's views and opinions, you can influence them. You can change them overnight, but not for the case of practices. And this is one thing that I hope the study should have had dug into. what are the bad practices along pediatric hypertension so that we will have an evidence to correct those practices. Now, second, when you talk about your so sana i-recommend nyo na lang kasi hindi nyo na ginawa. Sayang, hindi mo naman na pwedeng mabalikan. Ito yung sinasabi ko, sayang. Kung kayang kumpletuhin ang KAP model, intindihin ng lahat, pinaka-importante dyan would be the practice. Kasi yan na yung ginagawa nila. Okay, yung sa ayusin nyo yung demographic profile. Naintindihan? So, you have here mothers, right? So what is the inclusion-exclusion criteria of mothers? Mothers who are? Can you discuss to me?
Mothers who are 15 to 49 years old po, tapos may anak na 1 to 17 years old, sir.
Okay, so the mothers there would be middle-aged. Correct? Middle-aged group.
Meron din po yung mga respondents namin na nasa 15 to 19 years old ata, sir.
Oh, kaya sinabi ko nang mali. Maintindihan? Kasi katulad niyan, if I ask, ikaw na rin na nag-squill, 15 to 19, did you have assent and informed consent?
Meron po, sir.
Dun sa 15 to 19 years old, who gave the informed consent?
Sir, nung nag-float po ng questionnaire, kasama po yung informed consent noon, sir.
Ang nanay nila? Yun sinasabi ko. Because they are not supposed to give the informed consent because they are vulnerable groups. In the vulnerable sectors of the community, a representative should give the informed consent. That's why as much as possible for researches, we don't touch below 18 kung ayaw nyong magkaroon ng assent. Yung sinasabi mong pipirmahan noong individual na less than 18 years old, ang tawag dyan, assent form. But the assent should come along with the informed consent. Yun yung problema. In research, there's got lots of things you still have to know. Magkaiba ang assent form sa informed consent. So, that is a limitation of the study. Meaning, you place that forming part of the limitations of your study. Now, for your demographic profile, you determine which needs to be asked first. For example, zone. Ano yan? Zone? Zone of what? Zone of residence.
Sir.
Zone of inhibition yan, naging bacteria ang mga ito. Correct? Bakit importanteng mauna mong itanong yung zone of inhibition? Zone of residence. You know why? Bakit ko una, yan ang number 1 na dapat itanong mo? Why? You ask. You know why that should be number 1 among the profiles under demographic? What is your sampling design? So, yun na yun. That will answer the question. What is your sampling design? How did you get the individuals, the respondents in the study? Come on, can anyone please talk? How did you get your respondents?
Sir, stratified random sampling po.
How did you do stratified random sampling?
Mano-mano po namin binilang yung mga mothers na nasa 15 to 49 years old sa barangay, sir. Doon sa barangay na yun.
So,
tapos,
yes
sir, then Sloven's formula po. Tapos, 5 zones lang po kasi yung available instead na 7 zones. Kaya nag-proportional allocation po kami, sir. Para sa 5 zone na yun. Yun ba yun,
which
sir?
gives us a problem. Why did the other 2 zones not qualified?
Wala na pong binigay yung barangay na data.
Akala ko ba nagmano-mano pa?
Yes, sir, pero hanggang 5 zone lang po yung nabigay nila.
So paano yung ginawa mo dun sa zone? Ilan, for example, anak, no? Ilan sa zone 1, ilan sa zone 2, ilan sa zone... Doon ka nag-proportional allocation?
Yes po, sir. Para... Wait lang po, sir.
Doon sa zone ka nag-proportional allocation.
Yung sino ba yung nag-compute dito? Ano po? Yes, sir.
You see,
Di ba?
why? Yan yung sinasabi ko, bakit number 1 ang zone dyan? Kasi the valid way to get your sampling size is stratified random. Ni-label, di ba? Hindi ba't ni-label mo sila bawat zone? Am I right?
Yes po, sir.
Bakit stratified? Bakit hindi stratified? Ang ginawa mo, simple random sampling when the population is taken as one. And you didn't do that. The first thing you did is to sort them out per zone. Correct? Naintindihan? Did you sort them out per zone? That is not the first thing you did, right? Ilan sa zone 1 ang mothers, ilan sa zone 2 ang mothers and all that, right?
Kailan yun ba ginawa mo?
Yes po, sir.
And that is stratified random sampling. That's why zone should be, you ask first, saan siya nakatira bago ka magtingin-tingin ng age, ng education attainment, etc. And then you change your sampling design into stratified random sampling because it's not the entire thing that you took into consideration. You did zone residence determination prior to determining who are the exact population, who are the elementary unit for each of the zones. The elementary unit talks of who are the respondents themselves who were taken in the study. So change your sampling design into stratified random sampling. Now, in stratified random sampling, there are two ways to address derivation of your sampling size. Number 1 is proportional allocation when it is huge. Huge. Naintindihan? Okay. Or you would have computation of your Sloven's formula. So which one did you have? Proportional allocation, you said, because I
surmise. Sloven's din and proportional allocation.
Hindi ko na naintindihan. So in other words, wrong. Hindi ko alam kung alin dyan. So, nag-Sloven's ka, tapos nag-proportional allocation ka.
Sir, yun po tinuro ng statistician namin na pag-compute ng sample size. Sloven's and then mag-proportional allocation.
Okay, ganito kasi yan, Number 1, you had determined the respondents per zone. Correct? Intindihan. Second, if you determine the eligible respondents per zone, you compute for the valid sample size per zone. That is the time you can make use of the Sloven's formula. Okay, but why did you still have the proportional allocation when the result for the Sloven's formula is already very small? Correct? For example, for zone 1, after computing for Sloven's formula, what is the result? Sige nga.
Sloven's formula.
After computing for Sloven's formula for zone 1, what was the result? Does it talk about hundreds? No.
120, sir.
After computing for the Sloven's formula, 120? Are you sure ganyan kadami ang mother sa zone 1?
Ay, hindi po, sir. Per zone, proportional allocation. Yung Sloven's formula, ginamit nila para ma-solve yung total sample size na 120. Tapos yung sa proportional allocation po, doon po na-solve kung ilan per zone.
Okay. So yung proportional allocate, the Sloven's formula was to compute for the total number of sampling size in the entire barangay.
Yes, sir.
Okay. And the proportional allocation was derived in order to determine how many of respondents should be taken in the zone.
Yes, sir.
Zones. Yun yung explanation para tama yung ginawa. Naintindihan?
Yes, sir.
So still, if that's the case, then it is a simple random sampling with proportional allocation for determination of the elementary unit.
Sige po, sir.
But, Well, pwede rin naman. Valid naman kasi 120. 120 lang siya. Okay, so anyway, I hope that you placed there in your exclusion criteria about the case of the two barangays, but it should not have really been done. Kasi, linabel natin na Barangay San Jose, tapos incomplete pala. Ma'am Jinky?
Yes po.
So this is inappropriate.
Exclusion,
So it becomes in select puroks of Barangay San Jose. Am I right, Ma'am Jinky? Not barangay. You excluded 2 barangays. So this is not a picture of the entire barangay. Correct? So it becomes in select puroks because you have only 5 out of 7. So change your title. Okay, and then you just refine your statement of the, for example, number of seminars attended on premarital sex. Diba? Attended on hindi ko alam, no? Now, example, you look at ethnicity, it is a social variable more than a demographic variable. Okay na? Social variable yan. Ethnicity. Okay. And then, yung appliances found at home, no, that harness health information. Okay. And then, health-seeking behavior. I think we have a problem here. No? For health-seeking behavior, there are only, sabi ko nga, dapat, kung nag-benchmark kayo sa health-seeking behavior, 4 lang ang tinatanong dyan. 3 malimit, pero may pang-4. No? Number 1 would be the personnel approach for medical concerns. Personnel. Number 2, institutions visited for medical concerns. Number 3 talks of platforms utilized for health consultation. Pag sinabing platforms utilized, you'd have virtual consultation, face-to-face consultation, by appointment. The third one would be self-directed. Self-directed siya ng bahalang mag-Google kung ano ang pwede sa sakit niya. Naintindihan. And the last one is frequency of consultation. Yun lang ang laman ng health-seeking behavior. For example, times of consultation. Sige nga, ano yan?
Yung frequency po, sir.
Imagine, times nga rin ang consultation. When you talk about frequency, frequency of consultation, kasi defined. When you talk of frequency of consultation, ang magiging sagot dyan ay weekly, monthly, quarterly, yearly. Sige nga, paano mo ginawa yung times of consultation?
Once or twice per year, mga ganun po, sir.
Naintindihan? Imagine, once or twice per year, huge difference yan because you talk about 6 months and 1 year. Naintindihan? Kaya nga, weekly, ganun yan eh. Weekly, monthly, quarterly, semi-annually, annually. As frequent as, yung isa naman is, as the need arises. Ganun ang last niya. Dun sa frequency. Kaya, sabi ko, hindi ko alam. Sinasabi mo palagi na this tool was validated. No? I wonder, how did we come up with these final parameters when it should have been validated? You know what my problem is? We are talking about a peculiar disease which is pediatric hypertension. Where in the profile talks of ano ang health concerns ng anak niya para makita natin sana. Okay. Meron ba siyang child na may pediatric hypertension? Man lang? Wala naman. Naintindihan? So, ang tinatanong kasi natin dito is pediatric hypertension. Okay. Sana matanong man lang natin kung merong pulmonary concerns yung anak niya. Kasi this is
lead to hypertension.
Parang that leads to hypertension or whatever, or kaya man lang yung health profile ng anak niya. Kasi ang bida dito, anak, ay yung kondisyon ng anak niya, hindi yung nanay. Yung nanay lang ang tinatanong natin kasi hindi eligible, hindi kaya nung ating bata ang magbigay ng datos. Yun sanang pre-profile nyo. Nasaan yung profile ng mga health concerns ng anak nila? Sabi ko nga, kung tama ang dinaanan ng questionnaire na to, there should have been more than just but this. Anyway, wala tayong magawa kasi natapos. Ayan, sinasabi ko lagi, akala nyo ang pinakamadaling gawin ay descriptive analysis, lalo na ang KAP, mahirap kaya yan. Kapag meron akong mga students sa graduate school until the College of Medicine, hanggang 20 times kami magre-revise ng questionnaire ng KAP. Tanungin nyo kina Ma'am Jen kung ilang beses itong inupuan yung KAP nila. Mahirap ang KAP, hindi ganito. Intindihan? Hindi lang ganito. Okay. Pero wala na tayong magawa kasi natapos. Okay, next. Baba. Iyan. Tingnan nyo yung before, di ba? Tinanong nyo yung nanay, meron siyang alcohol consumption, yung nanay, cigarette smoking nung nanay, exercise nung nanay. Nasaan nga yung bata? Yung patungkol sa bata ang hinahanap natin. Kasi, for example, ako ganito kasi ang assumption sa public health. Meron akong anak na may pediatric hypertension. Pag nagpakonsulta ako sa doktor, di ba na-enhance yung knowledge ko kasi nagdi-discuss na siya ng pediatric hypertension. Okay. Na-enhance rin yung attitude ko about sa mga dapat ginagawa ko sa anak ko kasi nga, it was diagnosed to have pediatric hypertension. Kung hindi man pediatric hypertension, it should be a disease of the child. No? Okay. Mga ganyan. Okay? Kasi parang ito, binaling pa natin sa nanay, parang naging kasalanan pa ng nanay, kaya natin tinanong ang habits and lifestyle ng nanay. Di ba? Hindi naman, tanggalin mo na lang yung number 4 dyan. Hindi siya maganda. No? Kasi tinan mo, ang isang objective mo, is there a significant difference on the knowledge of the mothers when grouped according to profile variables? Yung habits and lifestyle niya, tapos pediatric hypertension. And then, for example, kung cigarette smoking siya versus pediatric hypertension, it should have been yung profile ng anak niya, di ba? Mas mataas ba yung knowledge niya kung may sakit yung anak niya? Mas maganda ba ang attitude niya kung may sakit yung anak, mga ganyan? So, ito yung isacrifice nating tanggalin mga anak ang 1.4, no? Kasi it sounds irrelevant, naintindihan? Buti sana, saka natin ilalagay yung 1.4 pag nag-compute tayo ng prevalence. Bakit? Kapag kunwari, number 2 mo is, what is the prevalence of pediatric, ano ba yung action?
Direct. Tumatahol na si Chantal kasi yung rider mo daw nasa labas na. Hindi daw sinasagot yung phone.
Sige, wait lang po. Ibang kaso ito. Anyway, saka ka maglalagay ng habits and lifestyle, anak, kung meron kang prevalence. No? Bakit? For example, kaya nagkaroon ng pediatric hypertension kasi nagko-consume ng alcohol, kasi cigarette smoker, kasi hindi nag-exercise, sedentary ang lifestyle niya, tapos ito yung mga food preference, ganon. No? There is an instance when you are going to place habits and lifestyle. We appreciate that if we computed for prevalence, which you did not. Right? Naintindihan? Ito, at least natututo tayong lahat. No? Kasi ito, sa medicine kasi, meron kaming subjects na tinuturo sa medicine, family medicine dati, family medicine and community health. Ngayon, ang tawag na sa kanya, preventive medicine. Naintindihan? So may mga strategies na ginagawa. Okay? So katulad nito, wag mo nang ilagay, sayang naman sa bagay. Nanghihinayang ako kasi nandyan yung material. Ano ba yan? Kasi imagine, yung knowledge ng nanay ng pediatric hypertension ay may kinalaman sa kanyang food preference. Di ba? Di ba ang kinalaman ng ang kaalaman ng nanay sa pediatric hypertension ay may kinalaman sa kanyang being alcoholic? Parang wrong, di ba? Ang maganda diyan, may kinalaman ang alcoholic status ni nanay doon sa prevalence ng pediatric hypertension. Yun yung tama. Kaya dapat sa prevalence studies kasama si 1.4. Gets nyo na?
Yes,
kaya tanggalin nyo si 1.4, pati doon sa statistics nyo, tanggalin nyo si 1.4 kasi naaayon yung magiging inference natin dyan. Naintindihan?
Yes,
Okay.
yes.
Now, doon sa pediatric hypertension, okay, nakalagay dyan, signs and symptoms, treatment and management, prevention and control, tapos contributing factors. Yung contributing factors, kasama yan anak doon sa prevention and control. Tama? Yes or no? Yan nga yun. Prevention. How do you prevent? How do you control? O yung contributing factors yun. Di ba? What do you prevent? What do you control? Di contributing factors po. Tama po ba? Yes?
Yes, sir.
Oh. See, naging, ginawa niyong komplikado lang yung mga buhay niyo na pwede naman anak na pasimplify.
Sir,
Right?
ito po kasi yung mga sinabi nung last na defense. Sinunod po namin yung mga recommendations.
Pero ang number 1 na recommendation na sinabi ay kailangan ang questionnaire mo ay ma-validate. Nagpunta ka ba
Yes,
sa akin for validation?
Yes, sir.
Sabi ko
Nagpunta po yung mga yung isang kagroup ko sa inyo, sir.
Doon sa validation ng questionnaire?
Yes, sir.
O tapos yung na-validate ko, bumalik ba?
Bumalik pa po, sir.
Tapos, meron pa rin contributing factor?
Yes, sir.
Ilan ang nag-validate nito? Ako lang?
Hindi po, sir. Bale 5 po, sir.
Bakit hindi pa rin nakita? Anyway, dun sa contributing factors mo, anak, 2.3 and 2.4, magkaiba ba? Yung
Direct,
question
dapat kasi parang ang natin dito nun, risk factors. Yung,
ganun sana.
oo, risk factors siya. Kasi kung contributing factors nga, magpo-fall, yun nga yung sabi, magpo-fall siya under prevention and control. Yung parang ganun.
So, I think the advisor would just go over kung paano ang i-label. Baka wrong lang ang labeling natin. Pero yung prevention and control na contributing factors, redundant yan. Gets mo na? Pero pag sinabing risk factors, that would be another. Baka it talks about risk factors niya. Okay na. Naintindihan, Nicole?
Yes po, sir.
Okay, next. Doon sa ating sige nga, balik ka nga doon sa ano natin kanina. Yan. Okay. An associate. Sige, balik na tayo doon sa chapter 4 na. In particular, sige, chapter 4, bilis. Huwag na yan. Ayoko na yan. Yung profile variable, ito yung tanda. Sige nga, yung discussion natin sa profile variable, hindi natin masyadong gina-justify. Intindihan? For example, there are, for example, ethnicity. There are more of this type rather than this type. Hindi na rin nila kasalanan, wala rin tayong magawa patungkol sa distribution ng ethnicity. Huwag mong sabihin, marami dito kasi, kung hindi na. The profile variables just intends to introduce who are our respondents. But there are profile variables that we need to discuss. Naintindihan? Okay na, that we need to discuss. But not all of them we need to infer or justify. Okay. So for example, this one, what is this? What is that? Sige, balik ka doon. Second, no? Hindi, ayoko na yan. The way you discuss your, what's this, table 1. Di ba, yung chapter 3 natin consists of presentation, which is the table, discussion, which talks about the trend, correct? And the last would be your justification. Right? Okay. Naintindihan. Okay, for example, zone. Zone of residence is not clear to us. Magkikwento ka sa amin dito eh. Sabi niya, Ma'am Jinky, 1, 2, 3, 5, 8. Tama, kasi select. Sabi niya, ang intindi ko kanina, 1, 2, 3, 4, 5. Yun pala, wala ring 4, wala ring 6, walang 7. May 8 pa pala. So katulad dito sa zone anak, 1, 2, 3, 4, 5, 6. No? Ang inference, ang magiging chapter 3 mo dito ay, for example, yung table niya is already here. Second is the discussion. Ang discussion niya dito ay, most of the respondents fall or are residents of zone 3, 5, and 8. Tell me about zone 3, 5, and 8. Are they at the periphery? Are they near the barangay health center? O sige nga. Kasi ito hindi ko alam. That's the time you justify. Correct? Naintindihan?
Yes
Neneng?
po, sir.
So tell me, what about 3, 5, and 8? Where are these located? Are they far from the barangay hall? The point of reference kasi is the barangay hall. Correct? Because it's in the barangay hall where you have the barangay health center, correct? The daycare center, the senior citizen center, and all other centers. Even the basketball court, I believe, is there, correct? So tell me, what is with 3, 5, and 8?
Si Kayla po yung taga doon. Kayla.
Okay na. So, ganun pala. For example, seminars attended about pediatric hypertension. And we say 16 attended. What were these seminars on pediatric hypertension? How did they acquire? Correct? Was it in the form of a webinar where like people went there to do some sort of like community or mothers classes? Diba? May kwento, diba, na hindi namin alam. Yun yung kailangan sa profile variable. Gets? Huwag mo nang ikwento yung number of children na 1 to 2, kalimitan, di ba? Huwag mo sabihin na konti lang silang mga anak kasi family planning sila, kung that's out of the story. You give us the story, okay? Because there are things we don't see here, right? Okay na? Okay. Now, you look, in ethnicity, others, story, 5. Ba yan? O, diba? Block ba siya? Kayo ang may datos. It's like this. In research, the stories are known by the authors because you were immersed. You own the data, you did it. No? What we want as panelists is that you share to us the story. There are things we don't know that these figures, cannot even explain. Correct? So in your narratives, do the explanation. Questions? Did you get that, Nicole?
Yes po, sir.
Okay, you tell us the story. Next, no? For example, here, all of them, average monthly income, correct? All of them are in the most, I don't know, most ba? Or all of them below to the poor bracket, correct? Poor bracket of families, right? All of them, right? Hello?
Yes, sir.
Sa DSWD, ganyan ata. Or, kasi average monthly income of the family to, di ba?
Yes po.
So minimum na yan. Kasi tinan mo, may contradicting kasi ito. Yung white collar job mo, anak, 13. You know what collar jobs are. Pero yung average monthly income mo, mababa. Intindihan? Nakukuha mo ba, anak?
Yes, sir.
Okay. Kaya nga, i-discuss mo. Ano ba yung mga white collar jobs na yan? Baka walang doktor dyan, walang lawyer. Correct? Baka ang white collar job dyan ay teacher. Si teacher kasi maraming loan yan. Loan doon, loan dito, lahat ng pwedeng paglonan, loan niya yan. Gets? Kaya siguro gan. Kasi mayroong, di ba there's a story, now you realize, mabababa yung monthly income, pero may white collar job na 13. O, ang white collar job, mga disenteng trabaho yan, anak. Baka hindi discuss mo, if may flight stewardess dyan, may piloto, may doktor, bakit ito lang ang sweldo? Problema yan. Tell us about the story. Okay? O, religion, others, kung ano yung others na to, Iglesia ni Cristo, others doon sa questionnaire. Correct? Pero kapag i-discuss mo naman na yan, may sagot na yung nasa questionnaire. Ilalagay lang natin yung others sa questionnaire kasi wala tayong maisip. Naintindihan? Sabi, others specify. Kung na
Yes, sir, na-specify.
correct? And now, you have to specify. Correct? Neneng?
Yes, sir.
I-specify mo na yan, ganun. Pati yung white-collar job, i-specify. Kung na, di ba? Di ba, auntie?
Yes, sir.
Ngayon, wala namang, di ba? Wala naman sa discussion kung ano yung white-collar. Sige, may I know from you, yung white-collar job, ano naman yung ginagawa ng mga yan? Naglalaba, tapos lalagyan po ng Clorox yung kwelyo, kaya white-collar po. Yun ba?
Aba, ikaw yung mas kabisado mo yung mga yung mga ano.
Yung blue collar, ano naman yun? Anong mga yan?
Mostly teachers po sa white collar jobs, sir.
Kaya sinasabi ko, kaya ganyan. Sabi ko na teacher ang mga yan kasi ganyan lang ang sweldo nila. Gets mo na? Not for anything, pero kasi jay talaga. Okay, next. So, nakita nyo na? Kaya dapat merong salary standardization ang teachers katulad ng mga police. Okay? Hayaan mo rin nasa college na mayayaman kami. Yung mga nasa elementary, high school, mga purita, zubel lang mga yan. Katulad niya, religious organization. Baka naman satanista ang mga yan. Di ba malay ko ba? Okay, gets? You see, one thing I love here, sabi mo, dun sa appliances that harness health information, poor sila, di ba? Economically poor. Right? Pero tignan mo ang appliances na meron sila. Neneng, may computer with Wi-Fi na 30, may cellphone sa 130, may iPad! Ngayon, paano mo balansehin yung datos na yon? Naintindihan? Kasi baka ang mga health information na ito ay ginagamit naman ng mga anak nila for instruction. Right? Kaya sila merong ganito, prioritize nila para sa pag-aaral ng anak nila, lalo online. Correct?
Yes, sir.
May kwento. Balansihin nyo lahat ang mga yan. Ngayon nyo na-realize, oo nga, mga purita silang sinasabi nila dong karu bituyo, the computer. Na. Di ba? Maiintindihan ko yung television saka yung radio. No? Because by literature, talagang basic sa household yan. Kasi yung mga balita, ganyan. Pero yung cellphones, kada iPad, kung kunan, hindi na makatarungan yan. Maliban na lang kung talagang kailangan because of instruction. Ganon ang paggawa. Can I have this group do it like that? Kaya niya na, di ba?
Sir, babalikan po namin yung mga respondents namin para or...
Hindi. Sabi ko nga, paano mo babalikan? Di ba ginawa nyo to?
Yes, sir.
Sabi ko nga, di ba, you knew the story because you made this. Ba't yung babalikan? I think you know the story. You have the, di ba? You have the data. Yung others, ganyan, nasa data yan. Okay, next. Walay ka, Jose Nicole, babalikan. Health-seeking behavior. Ano ito? Okay. Natatawa naman ako dito. Health-seeking behavior, tapos multiple responses. Consult a physician. Kasi nga naman, 86. Tingnan niyo yung table nyo frequency, tapos sabi mo multiple responses. Tapos meron kang percentage, no? Paano mo kinompute yung percentage? Wrong yan. 80 plus 65 plus 3.3 per 1.7 equals 100. It's more than 100. Neneng?
Sir.
Di ba wrong? The total should be 100%, correct?
Yes, sir.
Compute mo pa lang 65 at 80, na 100 yan. Multiple din, nanganak din yung mga percentages niya. Christ have mercy. Tignan nyo ito, balikan nyo sa wronging. Get? Nakita nyo? Actually, hindi ako nakikinig nung nagdi-discuss kayo, pero pag amoy pa lang kasi, makikita mo nang may mali. Sige, balik, susunod, no? So, multiple responses. Ibig sabihin, ang isang tao, marami, naintindihan. Pero kapag ganyan, anak, hindi naman akma Sige, balik mo nga doon, anak. Hindi akma na i-percentage natin dyan. Normally dyan, anak, ang importante, ranking. Naintindihan? Frequency and ranking kapag multiple response. Okay na? Get?
Yes po, sir.
So, pwedeng siguro, ilagay mo lang, frequency percentage, tapos i-rank mo na lang. So, ang pinakamarami ay nagsiself-medicate, yun bang marami? Tapos, bakit? No? Yung iba naman, nagko-consult ng physician, no? Bakit? Yung iba naman, traditional healer, bakit? Ganon. Okay na? Tatanungin kita, anak, bakit nagsiself-medicate karamihan? Kasi, ano yung kwento sa community?
First of all po, sir, sa panahon ngayon, sir, especially na may...
And hindi sa panahon ngayon, doon sa community. Hindi pananaw mo, anak, ano ang nangyayari sa community? Oh, ikwento mo yan.
Yes, sir.
Oh, di ba? Nakukuha mo na. Ano yung kondisyon sa community? Yun ang sinasayang ina-analyze natin. For example, ito, once a month, kalimitan sa kanila, hindi nagpapa-check up. Kasi, di ba sa standards ng health promotion, nagpapa-check up dapat tayo once a month. At least once a month. General, expectation. So, ang trend dito, hindi sila nagpapa-check up. Tama ba? Malimit. Correct?
Yes, sir.
Bakit kaya? O, yun na. Magkwento ka na. Base sa kondisyon ng komunidad. Okay na? Kaya, sabi ko, sir, paano yun? Doon sa konsepto ng triangulation, doon sa data gathering tool, meron tayong tinatawag na triangulation. You made use of other methods other than your primary tool. And in your triangulation, you had interview of respondents to verify responses. Number 2 is observation. Third can be documents review and other things you can do. They form part of triangulation. Okay? So yun ata yung isa pa na i-add nyo sa strength ng research. You make use of triangulation. Okay? Sige, next. Ano naman ito? People, you reach out for people. Alam mo, ito pang problema ko, no? Sabi mo kanina, traditional healer. Saan ko nakita yung traditional healer? May nakita akong traditional, pero it's not actually seen right here. People reach out for health-related problems. Nakita ko yung traditional healer somewhere, dun sa mga questions kanina. Dun sa table. Dun sa table ko nakita yon. Ayan health-seeking behavior. Consult a traditional healer, frequency 4, right? You go back to the next. Where is 4 there? In people reach out. Where is traditional healer to begin with? Wala. Can you see the inconsistencies? Kaya na, anak?
Yes, sir.
See? So, ganun ang mangyayari. Alam mo kung bakit ganun? Kasi wala dun sa choice. Pero alam mo kung dumaan talaga sa akin to, hindi ganito talaga yung health-seeking behavior Kasi sa parlance ng health research, 4 lang naman talaga yung health-seeking behavior. Tignan nyo nga yung nilagay ko yan, sacred places. Malamang, lagi pag nagpapanel kami, naririnig din na Ma'am Jinky, lagi kong sinasabi, institutions, sacred places where the traditional healers are. So wala naman siya dun sa institutions. Okay. Kaya hindi ko dapat makalimutan na merong sacred places. Minsan sinasabi ko, scared places. Sabi ko pa kasi scary naman talagang pumunta sa sacred places. Okay. Parang ganun. Anyway, balansehin nyo. Pati yung percentage nyo dito, anak, Hello?
Yeah, basta pag multiple responses po, sir, magiging ranking po yung gagawin.
Multiple responses ranking. Kung gusto mo na siyang i-percentage mo pa rin siya. Basta for each category, 100. Bakit saan ka kumuha ng percentage ang dami-dami? 80%, 31. Ano yan? Grade nyo sa anatomy? Gets? Na 20% na lang dyan ang naiiwan. Kaya mag-suckers. Naintindihan? Yung sinasabi ko, pag nag-compute ang percentage, di ba? Paano ba i-compute ang percentage? Bakit nagkaroon ng balloon? More than 100 naman ito. Gets? per category mo i-compute. So pwede mo pa rin kunin yung percentage yan, pero more importantly, frequency, ranking kasi iaayos mo na yan base kung ano ang rank 1, rank 2, rank 3, gano'n. Kasi nag-multiple response kayo. Gets? Okay, next. Ano naman ito? Ito na naman, lifestyle. O, wala sa kanila ang nag-cigarette smoking?
Wala po, sir.
O, itanggalin mo na yan. Wala naman pala, zero ng radiation, galin mo na yan. I-discuss mo na lang yan doon sa narratives mo na walang nag-cigarette smoke. Okay?
Yes, sir.
Yung mga 0-0. Tapos natatawa naman ako dito yung food preference. Ay, sabagay pinatanggal ko to, no? Kasi nakakatawa siya. Oh, nakita mo na yung food preference. Vegetables, fish, fruits, meat. Kung ako yan, i-check ko lahat yan. Multiple response nga, Ruth. Ang sinasabi nyo, hindi ko makain yung iba ng canned goods. Di ba? Oh, kasi multiple response ka Ewan ko. Pero i-abort mo na nga itong habits and lifestyle, hindi siya makakatulong. Syonggalin yan. Okay, next. Pati dun sa statistics, tanggalin na part yan. O yung contributing baka risk factors nga lang. Pero, ang problema dito, ito na naman, Ma'am Jinky, very knowledgeable, highly knowledgeable. Ano yato? Anong difference ng highly sa very? Oy, mga Jose, Nicole, sige nga, anong difference ng highly sa very? Kunwari, queen, highness, kung na. Pag princess, very, ganun lang. Ano yan? Ano yung very sa high?
Sir, susunod na lang po namin sa very knowledge po. Lahat.
Hindi tingnan, hindi gano'n, that's not what I want you to do. Naintindihan? The thing is, mali siguro yung bracketing mo. Baka ang level of knowledge, for example, is very high knowledge, moderate knowledge, low knowledge, mga ganyan siguro. Baka ganon. Tignan ko nga yung, sige na nga, dun sa chapter 3 nito, nasaan yung figure na to sa chapter 3?
Kayla pa share. Ay, share screen po, sir.
Pwede ba? Or kahit basahin mo na lang. Kasi kung sasabihin, ilagay kong lahat na very knowledgeable, that is not to make a good, thing, no? Baka naman talagang yung highly dyan would be very knowledgeable, tapos yung very knowledgeable mo would rather be labeled, will appropriate or correctly labeled moderately knowledgeable. Kasi pag na-label mo yun na moderately knowledgeable, maganda ang magiging discussion mo. You know why? Ito, anak. Honestly, di ba ang assumption ko, the very first thing I told you kanina, hindi alam ng nanay ang patungkol sa pediatric hypertension. Correct?
Yes po, sir.
Bakit ito? Bakit ito ang resulta? Sige nga. Kasi alam ko yan. Kaya ko nga sinabi na mag-KAP kayo ng pediatric hypertension kasi walang nakakaalam ng pediatric hypertension. But to my amazement, no? Alam ng mga nanay ang signs and symptoms, ang treatment and management, prevention and control, contributing factor. You ask your neighbor, auntie, alam mo ba ang pediatric hypertension? They would not know about pediatric hypertension. Bakit taliwas ito? So nakikita nyo na, may mali along the way. Paano ba yung administration ng questionnaire? Knowledge ba bago attitude ang ginawa nyo or attitude bago kayo nag-knowledge?
Attitude bago knowledge po, sir.
Pero pareho. And how come this is the result? And this is barangay which is remote. Correct? Remote ito? Or baka city ito? City of Angel? See? Remote ata. Kaya tignan nyo, mukhang mali yung interpretation natin. Mas maigi na bantayan nyo yung interpretations kasi baka yung highly dyan magiging ile-label mong very, tapos yung very, baka naman lower level. Kahit papano, may alam, pero hindi masyado. Di ba? Papasok pa din sa...
Meron na po yung table na sinasabi niyo, sir.
O sige nga, basahin mo. Ilang...
Sir. 4.21 to 5, very knowledgeable. 3.41 to 4.20, moderately knowledgeable.
O,
Ganun po, sir.
Nasaan yung highly at saka very? Moderate naman pala yung susunod. O, di ba? Oo nga, no, kung nabataan.
Yes, sir. Di po namin napansin yung binigay na sila.
Oh. Pati yung mga percentage, hindi mo napansin. Ngayon, hindi mo na mapansin yan. I-go over nyo. Okay na? Pareho sa attitude, anak. Ganyan din. Okay na? And one thing I would like, no, for you to probably, sige, ibalik, for you to have this, no, actually, wala talagang alam ang mga nanay sa pediatric hypertension. No? Yun yung gusto kong i-expect ko talaga kasi matagal na ako dito sa field na to, talagang wala pa silang alam. Kaya gusto ko sanang itong paper ang maging ebidensya na wala silang alam para maging basis ng isang programa or isang aktibidades ng gender and development ni Ma'am Jen Lu yun, ng extension program, kung sino man ang extension program coordinator, ganun sana. Kaso dito parang hindi natin siya magawa kasi knowledgeable naman na siya kung na. Di ba? Yun sana ang gusto kong mangyari pero nagkamali ako or mali kayo. Dalawa lang naman yan. Nakukuha nyo ba? Anyway, sige. Next. Tanungin mo si Ma'am Jen kung alam niya pediatric hypertension. O si Ma'am Jinky na lang. O may anak pa yan. Pati may mga asthma na nanay. Alam niyo ba yung pediatric hypertension? No? Nila anak, alam yan. Katulad na naman to, 4 point ito anak or 5 point?
5 point po, sir.
So yung attitude mo 4. Tama? Kasi 1, 2, 3, 4. Balik ka nga. So paano yung hierarchy mo na naman sa attitude? 4 din yung pinag-interpret mo?
5 po, sir.
Doon sa kanina, 5
din po, sir.
Whatever. Pero ito, hanapin mo na naman kasi high regard na naman lahat sila. O sige nga, ibalik mo dun sa... Just Christ have mercy. Siguro yan. Hindi, next. Siguro alam ko na ito. Ay, Lord. No. Hindi ko alam. Hindi ko talagang mawari. Kasi ang assumption ko talaga, pag tatanungin mo sa nanay, alam mo ba ang pediatric hypertension? Ang sasagutin niya, ano yun? Kasi pag adult hypertension, alam nila yan. Correct, Nicole? Kasi lahat high blood. Di ba? Yung mga matatanda sa community. Pero pag pediatric hypertension, siguro ganito na lang. Or baka ang alam nila, pareho yung adult hypertension doon sa kasi siguro. Baka ganun ang konteksto. Di ba? So ang ganun siguro. Kaya yun ang mga first na question sana natin na hypertension among children is different from that of adult. Yun ang first na question. Pag sinabi, disagree, nakuha na natin na ay wronging. O talagang hindi na nga talaga niya alam. Yun yung first na question sana natin. Kasi nakita ko dito, hypertension, nakita mo pagtaas ng BP, pagkain ng salt, kung pula ng amin. Kaya siguro, ito din. Kung pula na siguro. Sige. Anya nga, Rod. So yung iniisip ko pala na extension program saka yung God-related na program applicable. Naintindihan? Kasi nga, ito yung result. Well, wala tayong magawa. Ganyan tayo yung result niya. So, siguro, sige, gawin. Siguro nakita ko ng mali. No? I think it talks about siguro framing ng questions. At saka yung briefing muna. Alam nyo mali dito, alam ko na. Sir Kelvin, advisor?
Yes
Sinong
po,
advisor
sir.
nila? You know what's wrong here, Sir Kelvin? Number 1, the principle of inception activity. What is the principle of inception activity? When you go to the community, no, you have to make sure that they know about the concept you're working on. In other words, there was not a clear orientation of what hypertension among children was about. Yun yung na-miss siguro natin.
Yes,
Kaya
Doc.
nagkaroon ng confusion, correct? Nang naiisip nila pareho. Yun yung, kasi everyone knows about hypertension among adults. I surmise. Naintindihan? But it seems, kaya natin ginawa yung child hypertension or neonatal hypertension or whatever, child ganyan, kasi may pagkakaiba. So siguro doon sa orientation, yan yung ginawa. Kasi I'll share you a story. No? When I went to Gonzaga, during the time na schistosoma, hindi nila alam yung schistosoma, yung paglaki ng tiyan, alam na nila yun, paglaki ng mga bulate, alam nila. So ang first na ginawa ko doon, inception activity, in-introduce ko muna kung ano yung schistosoma. Correct? Tapos sa kanila na-realize, okay, iba pala ito doon sa mga previous na ini-study nila. I mean, it's just but a remote. Hindi ako nag-discuss ng signs and symptoms, treatment and management, hindi. A view, an overview of what schistosoma is. At na-appreciate, okay, ito pala, iba pala to. Kaya na-gauge ko doon na may mga poor knowledge sila along some things. No? So, siguro yun yung naging issue natin, yung leveling off or inception. No? Yung inception nyo was limited to, nagpaalam kayo sa barangay na gagawin nyo ito. But you forgot the second thing, that this is a phenomenon which is something unusual, or probably if it's usual, something not really known. No? And we should have had disclosed, no, a little something, a primer, no, okay, on child hypertension. Siguro ganun, no? Sige, baba nga natin. Sige, very high regard eh. So, sige, in other words, anak, may association, di ba? Ano yung recommendation natin? Bring me to the recommendations part na. Okay. Yeah. Ito na. Ito na yung sinasabi, ito na yung worry ko. No? Bakit? Yung recommendations nyo do not meet, no, the standard recommendations based on what we saw in the table. Imagine, you would want them to attend seminars, read articles, participate in... kala ko ba very highly knowledgeable, very good regard na? O di wala na. Improve their attitude. It's already very okay. Imagine, yung attitude mo is highly kunanapan. Kasi improve tayo pala, nandoon na sa kanila yung material. So nagkaroon na naman ng mismatch. Naintindihan? Yung recommendations mo, base doon sa table. Kasi yung number 2 mo, still, DOH will do seminar, symposium, wala nang problema dun sa knowledge. Correct? Nagigets nyo na? So siguro, wala tayong magawa doon sa results niya. Baguhin nyo na lang yung other parts ng paper, Sir Kelvin, lalo na pagdating sa conclusions at saka sa recommendations. Iakma nyo doon. In other words, magkwento kayo. Make use of the power of your immersion. Magkwento kayo ng kakaiba. Alam mo kung bakit, sabi mo, mataas ang knowledge, mataas ang attitude. Kasi pala, no, baka naman may pumupunta doon na may nag-adapt na ba sa community na yan? Kasi remember, some communities are extension sites or adapted communities of schools. Enrile barangays are adapted by St. Louis. Core shelters are adapted by Grad School of CSU. Linawan, baka naman may ganon. May eksena bardang na gano'n na ikwento nyo kung ano talagang nangyayari dyan. O talagang masigasig, kasing sigasig ni Ma'am Jinky at Ma'am Jen, yung kanilang barangay health workers. Dapat sila agle-lecture. Alam yan? Baka gano'n. Ikwento mo nga, bakit naging gano'n yung kwan? Gets? Something is so... I find something of peculiar interests dyan sa lugar na kung bakit matataas ang knowledge nila. Magkwento kayo. That's it. And then, refine the recommendations kasi it does not match our findings in the chapters 4 and chapters 4. Okay? So that's it for me. Thank you.
Thank you po, sir.
Thank you so much, Direct. So, opo daw, Direct, sabi nung anak ko. Siya ang sumasagot kanina. Opo, Direct, sabi niya. So, konti na lang kasi nasabi na halos lahat ni Direct. Sa paper nyo, congratulations pala to the group and to Sir Kelvin sa magandang papel. Actually, magandang papel in terms of kung paano siya nasulat, tsaka kung paano siya na craft. Pero yun nga, same problems na nakita ni Sir Julius, Ma'am Jen, tsaka ni Ma'am Lily on the findings. Nagulat talaga din ako kung bakit ang taas ng knowledge nila. Me, myself, allied health naman ako nag-work and pharma naman yung tinapos ko. If you ask me about pediatric hypertension, honest to goodness, I will say hindi ko talaga alam, mga anak. So, siguro si Ma'am Lily alam niya kasi nurse yan. Doktor yung asawa niya. Pag tinanong mo si Ma'am Jen, I doubt.
Hindi ko talaga alam.
Ma'am Jen, kahit wala pang anak si Ma'am Jen, pero I doubt na alam niya. So, yun, amazed lang ako kung bakit matataas yung knowledge nitong mga to. So, nakita ko, sa questionnaire nyo kasi anak, lahat sila positively stated lahat. Walang negative. Ito yung problem natin. Kung nagpa-check kayo sa akin, Nicole, I will ask you to put negative questions. And I'm sure I'm not, actually, niisip ko ngayon ulit kung nagpa-check kayo sa akin, Nicole, kasi I will write there. I know sa questionnaires, lahat na nagpa-check sa akin, I will put negative questions. Kasi doon mo mag-gauge yung knowledge nila if they are just putting yes, 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 or knowledgeable ako dito, knowledgeable ako. If you put negative question and ang sinabi nilang knowledgeable sila about that, and it's a negative question, then doon natin matetest talaga yung knowledge nila. So, that's why I always ask sa knowledge questions na you put negative questions para mag-gauge talaga natin kung tama o hindi. Actually, mas marami kayong makukwento kung they still said na knowledgeable sila dito and yet the statement is negative. Another is, ano pang nakita natin dito? Yung ano pala anak, makalimutan ko. Statement of the problem muna before hypothesis. And then, sa scope and delimitation nyo, dapat naka-past tense na yung mga yan. And yung ating citations ulit. And yun, yung hinahanap ni Ma'am Lily on the baseline study, dun sa locale of the study natin, dapat naka-state doon, bakit natin gusto kay San Jose Enrile. Bakit nga ba? Siyempre sasabihin nila Nicole kasi yun yung merong taga dun sa kanila. Pero we cannot say that sa research na dahil taga dun kayo. Dapat taga dun kayo plus may nakita kayong problem on this. Let's say, you tried your best naman na maghanap sa City Health Office at saka sa ano ng data about pediatric hypertension. I doubt kung meron talaga kayong makikita kasi nga, hindi lahat may alam nitong pediatric hypertension. Hindi katulad nito ng hypertension for adults na meron talaga silang data nito. So ito, kung inisa-isa nyo na sana yung mga pinuntahan yung respondents, iyanong nyo na sana kung meron kayong mga obese na mga mga anak sila. So that makita natin kung mayroon bang risk of pagkakaroon ng pediatric hypertension yung mga anak nila. So yun ang ilalagay natin, state in this part kung bakit San Jose tayo. And the part na yung kayo ay nag-stratified random sampling. Actually, that is okay. That is good. Kaso meron tayong in-exclude na dalawang zones. Yung sinabi kanina ni Sir Julius. If we excluded 2 zones, hindi natin pwedeng sabihin dahil wala tayong data nito. That's why the right thing to do is you change your title to select zones or select puroks of Barangay San Jose na. Unless meron tayong exclusion criteria kung bakit natin in-exclude yung dalawang zones, but not because dahil wala tayong data on those zones. Nakuha ba yon, Nicole?
Yes po, ma'am.
Yes. And then dito na tayo. Yon, sa inyong, actually, ang ganda ng pagkakagawa ng inyong profiling, except yung mga tinanggal especially yung sinabi ni Ma'am Jen tsaka ni Sir Julius to, yung pang-fourth niya, yung tinanong nga ni Ma'am Jen kanina to, na sino ba yung mga tinatanong niyo on this? So kasi yung other groups natin, meron itong lifestyle and habits kasi we are really asking about or i-correlate natin ito sa kanilang mga practices, knowledge, and attitudes. But for you, kasi yung mga pediatric hypertension, so yung mga bata ang gusto nating malaman. Itong part na to, kung pinagaya man namin yung objectives ng iba, it's because yung iba, yung part na ito is meron silang cigarette smoking nila mismo. Sila mismo yung chine-check natin but not yung anak nila. So hindi nababagay dito. Sa profiling nyo din, your percentages, dapat pare-pareho yung significant figures nila dito, Ma'am Jen, di ba?
Kahit first decimal place lang, best friend.
Yes, kasi meron sila yung isa lang, meron yung tatlo.
Yung dalawa, tatlo.
Medyo eyesore siya. And pinagkakay ko dito, insert here the significance of the profile to pediatric hypertension. Sabi nga ni Sir Julius, there are profile variables na hindi mo naman kailangang i-discuss pa. Kasi you are just profiling. But there are profile variables na kailangan mong i-discuss. Like these seminars mo, kung ano yung type of seminar, actually kailangan mong i-discuss yung mga yon. And kung marami silang seminars, bakit kaya? So you discuss that. That's why we ask, kahit pa ito ay questionnaire, you still need to triangulate. Meron kasi mga side answers yung mga respondents mo. So maganda yung mga answers nila na yon pagdating sa discussion mo. That's why maganda nga kapag may mga mixed methods na mga papers kasi they really ask itong mga to for the discussion part. And then, yun, tanggalin yung part na yun. Yun, yung tinanong ko, did you give negative questions? Yun nga, walang negative questions doon sa inyong. And yung last part dito, yung contributing factors. Hindi ko alam kung si Ma'am Lily ata nagtanong kanina nito or si Sir Julius. Paki-review natin itong contributing factors. And yun, maganda naman na meron kayong overall, pero the very knowledgeable and highly knowledgeable are questionable. So pina-review na yan ni Sir Julius. Kasi anong difference ka ng very knowledgeable sa highly? Ganito, si Ma'am Jen ay very knowledgeable, ako ay highly knowledgeable. So anong pinagkaiba naming dalawa? Hindi ko alam, parang ganon. Same as, actually okay naman yung sa attitude niyo. Pero maganda yung attitude nila. Siguro yun nga, ang sabi ni Sir Julius, it's in the method. Or yung una na wala tayong inception meeting. Or yung unang tanong dapat natin is, alam ba nila yung pediatric hypertension? Just one question before starting with the questionnaire. Yun lang, siguro yun yung mismong tanong. Kasi baka the questions or yung statements nyo is pertaining to, kamukha naman niya, syempre, yung marang signs and symptoms ng adult hypertension natin. So they will agree to that. Alam nila, narinig lang nila yung hypertension, di na nila narinig yung pediatric. Sinabi nilang alam nila. Syempre ako pag tinanong mo ako about hypertension, alam na alam ko, mga ganon. Pero pediatric hypertension, hindi ko alam. So, yun lang for this group. Also, meron pa pala. Sorry. Ito sa significance ninyo, mga anak. Sinabi nyo na, that's why important na nag-discuss din kayo sa profiling. Kasi pagdating ng significant difference between yung level of knowledge and the profile variables, wala kayong di-discuss about it. Sinabi nyo lang na significant. Period. Wala na tayong sinabi kung bakit siya significant in terms of itong variable nila na ito. Wala lang, significant lang siya. And yun, magaganda yung recommendations nyo, ang dami actually. Pero yun nga, hindi siya akma hindi siya suitable. Very suitable siya kung hindi maganda yung knowledge and attitude na nakuha ninyo sa quanti ninyo. Unless you discuss it, tulad ng sinabi ni Sir Julius, dahil kayo ang gumawa nitong paper nito, i-discuss nyo na they do agree, but, alam mo yun, may mga but sila. Alam nyo na nag-triangulate kayo na but, mas inaano nila to for adult hypertension. That's why they agree kasi feeling nila, katulad nilang si adult hypertension. Things like that. So, yun yung mga pwede nyong gawin. Sir Kelvin, may question ka ba for this group?
Wala naman po, ma'am.
Wala na. Okay ka lang, Sir Kelvin?
Yes po, yes po.
Parang mahina yung dating ni Sir Kelvin.
Hindi, may sipon at saka ubo kasi ako ngayon, ma'am. Kaya...
Pareho kayo ni Sir Nico. Pagaling kayo. So, tapos na kasi kami. So, si Ma'am Jen susunod. How about sa group na to, Nicole? Do you have questions?
Ma'am, sa akin po so far wala.
Nicole and company?
Kasama ko.
Ma'am Jinky.
May question.
Yes, Ma'am Lily.
Oo. Di ba, dun na lang sa pag-improve ng paper nila, hindi ba possible na parang magiging yung design nila magiging mixed method, magiging sequential. Kasi pwede naman kasi kung kunwari meron naman silang data nung mga kanilang respondents. Ang dami na ng respondents.
Actually, maganda yung sinabi mo, Ma'am Lily. Hindi na nila papalitan itong quantity nila, di ba? Pero babalikan nila sila to confirm kung ito ba yung sinasabi nila.
Tsaka
maganda
yun nga yung sabi ni Direk, para may maikwento sila kung bakit. Oo, kasi
actually
hindi tayo mag-guess kung ano talaga yung rason kung bakit mataas talaga ang knowledge nila. So parang ang approach nila, parang sequential mixed method na di ba ito na yung result ng quanti nila eh. So magka-quali approach sila. And purposive naman yun. Kung alam naman nila
exploratory
yung respondents nila. Tapos kumuha lang sila ng
exploratory. Exploratory. Quali bago ka mag-quanti. Explanatory naman.
Explanatory to direct, di ba?
Kung yun ang gusto nilang gawin. Kung gusto
quanti, explanatory quant.
Yun ang balak gawin direct, explanatory,
sequential
quanti na sila tapos kita na natin lahat.
Makikita nyo dyan, ang worry ko dyan, no?
Knowledge and attitude nila. So,
Ma'am Jinky, ang magiging suicidal note dyan ay ganito. Aaminin nila na wala silang alam. Ang lumabas sa quantity, may alam sila.
Oo nga.
Meaning, something went wrong kung nasangaw. I'm sure yun ang nangyayari, di ba? Ay, ganun pala. Mali yung sagot namin. Kung nasangaw.
Wrong yung una nilang sagot.
Mare, yung siguro yung, since purposive sampling naman siya, yung balikan talaga nila, yung may mataas na knowledge. Para later on, pag sinabi nilang knowledgeable sila, so sila yung i-confirm. Ay, kasi very knowledgeable. Tapos mag-join ka doon. Me knowings. Ganyan. Basta check.
Ito na lang. To make it simpler for Kelvin and the rest, no? Wag nyo nang ilagay yung second part na mixed method. Let it be quanti. But you triangulate. Diba? Quanti siya, but there's an essence of triangulation. Ilagay nyo sa methods, triangulate sila. Ang tool ng triangulation nila would be interview to verify responses. So, mangyayari kasi dyan na while this is their claim, naintindihan, this is actually what they believe it is. Explain na lang nila. Kasi gusto kong lumabas dyan, Sir Kelvin, na actually, nako-confuse kami. Between your adult at saka yung pediatric that's very good. At least, nakakita, okay, nandun na yon, nailista na natin doon sa kwan. Correct?
Siguro na parang lalabas doon na knowledgeable sila, pero
Knowledgeable sila sa
pero
hypertension pangkahalata.
Adult, parang
Correct?
ganun.
Para yung magiging recommendations nyo, for example, ang center talaga ay pediatric hypertension nga, parang gano'n. Kung lalabas na gano'n yung discussion nyo, partly magiging correct pa yung recommendation nyo, parang gano'n.
Yes, actually.
Talagang mag-storytelling sila dito, Doc.
True, the fun.
Doon sa discussions, so kailangan nilang, kasi babalansehin mo ngayon eh. Kasi ang assumption talaga natin hindi nila alam, pero bakit alam nila? Tapos ngayon, magkwento ka na ba? Para hindi ka na mag-FGD. Magkwento na lang siya. Okay?
Yes, Doc. Sige, Doc. Thank you, Doc. Thank you, Ma'am.
Thank you, Ma'am Lily. Thank you, Sir Julius. So if we do not have any questions anymore from this group, congratulations again, Sir Kelvin, and to the group. Marami pang gagawin. Meron pa silang isang buong SEM to finish yung draft 2 after the recommendations. Dave, we now move on to the third group.
Thank you again for the panelists for the comprehensive discussion. Now let's move on to the next group.
Good morning, everyone. We are the Group 9C and we are going to present our study entitled Indigenous Practices of SNAG Mothers in the Management and Treatment of Respiratory Diseases in Selected Barangays of Pudtol, Apayao. Introduction. Indigenous healthcare practices are widely practiced in the Philippines and they have become part of the development of medicine. Indigenous healthcare practices continue to be practiced in the Philippines, particularly by indigenous communities, because it is part of their culture and practices. However, some of these practices were shaken because of different factors that affected their implementation. One of the indigenous communities with distinct healthcare tradition is the SNEGs in the province of Apayao. Thus, this study aimed to determine the indigenous practices of SNEG mothers in the management and treatment of respiratory diseases in selected barangays of Pudtol, Apayao. Statement of the problem. Generally, this study aimed to determine the indigenous practices of SNEG mothers in managing and treating respiratory diseases. Specifically, this study sought to answer the following questions. Number 1, what is the profile of SNEG mothers in terms of socio-demographic profile? Age, educational attainment, occupation, average household monthly income. Clinical profile, disease, comorbidity, and vices. Health-seeking behavior. Person visited for medical consultation, institution visited for medical concerns, and modalities used for medical consultation. Number 2, what are the indigenous practices of SNEG mothers in the management and treatment of respiratory diseases like chronic asthma, pulmonary tuberculosis, and community-acquired pneumonia? Number 3, what is the perceived effectiveness of SNEG mothers on the indigenous practices in the management and treatment of respiratory diseases? Is there a significant difference between the profile of SNEG mothers in terms of treatment and management of respiratory diseases? And what are the factors that affect the implementation of indigenous practices among the SNEG mothers in the management and treatment of respiratory diseases? Methodology. Stratified random sampling was utilized and Slovin's formula was used for the computation of appropriate sample size for the respondents for the survey questionnaire, and non-probability sampling was used for the respondents in key informant interview. The researchers adopted an enhanced questionnaire and undergo validation. And to facilitate better understanding of the questionnaire were translated into their vernacular language. Following the validation of the questionnaire, the letter of permission, the barangay captains of the chosen barangay was sent. And after that, pilot testing and reliability testing was also done. Data collection through survey questionnaire was done, followed by data collection through key informant interview, and data analysis. Results and discussion.
Table 1.1, the distribution of the respondents in terms of socio-demographic profile. It is evident from Table 1.1 that most of the respondents are 30 to 39 years old. The majority of the respondents are from Barangay Upper Maton, and the minorities are from Barangay Lower Maton. This is because Barangay Upper Maton has a larger number of households than Barangay Lower Maton. More than 50% of the respondents' types of families are nuclear. This result is congruent with the findings of Medina and de Guzman in 1994 that 94% of the houses in the Philippines are family households with a family core, or most commonly called nuclear family. 94 of 101 respondents are Roman Catholic, because it is the most common religion in the Philippines. Moving on to their educational attainment, most of them attained high school level because most indigenous people tend to have less access and have poorer quality of education than other groups. The findings showed that the majority of the respondents were unemployed. This is because most of them only attain high school level. People who have higher educational attainment tend to have better job opportunities, and this statement is congruent to the research of Acosta and others that educational attainment correlates positively with formal employment. Almost all of the respondents has an average monthly income of less than 11,690 pesos. Based on the data from the Philippine Statistics Authority's 2018 Family and Income Expenditure Survey, they belong to the income group of poor. This is because most of them are unemployed. Table 1.2, the distribution of the respondents in terms of clinical profile. The table 1.2 presents the clinical profile of the respondents. The majority of the respondents have no current illness and no comorbidities. When it comes to their vices, most of the respondents are non-smokers and abstainers or never drink alcohol at all. It is because smoking and drinking alcohol are most common in male. According to the final results from the 2009 Global Adult Tobacco Survey by PSA, men account for 47% of smokers while women account for 9%. Male daily smokers smoke 11 cigarettes per day on average, while female daily smokers smoke 7 cigarettes per day on average. In terms of alcohol consumption in 2019, 49.4% of men and 14.8% of women among the aging population were alcohol drinkers in the Philippines. The per capita consumption of alcohol in the Philippines was higher for men compared to women. Females consume less alcohol than males do, and they appear to be less prone to exhibiting certain risk indicators for alcohol abuse and health problems. Table 1.3 is the distribution of the respondents in terms of health-seeking behavior. The table presents the health-seeking behavior of the respondents where the person that the respondents visit when they need medical advice is a doctor. Seeking medical advice from the doctor is more reliable and effective given the years they spent in their studies and trainings. They are already equipped with knowledge and skills when it comes to health that help the people with medical concerns. 63 respondents indicate that the institution that they visited when they have a medical concerns is the hospital because it is where they can have a consultation with a doctor. Since they prefer doctors for seeking medical advice, hospitals give a better quality of patient care since they have more advanced facilities, and equipments. Most of the respondents prefer face-to-face consultation because whenever they have questions or queries, they can easily be answered or addressed by the doctor. It is also easier to understand the advice of their doctors when it is face-to-face consultation since there is a lower communication barrier.
From the responses gathered during the interview, the following themes and sub-themes were derived. In the management and treatment of respiratory diseases, the theme is treatment and management of asthma, and the sub-themes are boiled vinegar and nebulization. According to respondent 1, who has a child with asthma, said in the interview that whenever her child's asthma attack, she either let her drink a boiled vinegar or let her use the nebulizer. In the case of using boiled vinegar in the management of asthma, according to her, she will just boil the vinegar and add some water and she will let her child drink it. We use vinegar, we boil the vinegar and put some water and then we will just give it to her, but sometimes we let her use the nebulizer. According to Sayer, vinegar has been used as a traditional folk remedy for thousands of years. It was used by Hippocrates as an antibiotic treatment and as a wound disinfectant in wartime. Studies have been carried out investigating some of the claimed benefits, but there is no scientific evidence that vinegar will improve asthma. While nebulizer can be a variety of medications, both for controlling asthma symptoms and for relief right away. She was also asked on what does she prefer, whether using indigenous practices or mainstream medicine, and she have said that it is just the same as they can both cure diseases. For me, it is just the same because when I use the indigenous practices, it can also cure, and when I combine it with usual, it is still okay. Next slide, please. In the treatment and management of pneumonia, they consult to a doctor. All of the respondents in the interview, only one has a family member who has a pneumonia. Respondent 4, who is a healthcare worker, have said that when she observed that something is wrong with her child, she immediately brought her to the hospital and they found out that her child has pneumonia. The doctor discussed to her the things that they need to do, which includes taking a maintenance medicine. When I observed that something is wrong, I immediately brought her to the hospital. And they said that it was pneumonia. That is why I talked to her doctor to ask what we need to do. The doctor told us that she needs to take maintenance for 6 months. That is why we continued the maintenance. And with God's grace, her pneumonia improved. When you get a pneumonia diagnosis, your doctor will work with you to develop a treatment plan. Treatment for pneumonia depends on the type of pneumonia you have, how sick you are feeling, your age, and whether you have other health conditions. Take any medications as prescribed by your doctor. When she was asked if they have tried incorporating indigenous practices in the treatment and management of her child's pneumonia, she said that they never tried using it. They only rely on the doctors have advised them. I don't know because the only medicine I used was the medicine that the doctors prescribed. I have never experienced using medicine that was not on the market or given by a doctor. Next slide, please. In the treatment and management of tuberculosis, they also consult to a doctor. There is no indigenous healthcare practices for tuberculosis, though there are a lot of available plants around them. It is better to consult a doctor to have an appropriate management and treatment. As a respondent 5, who is an elderly, have said during the interview that there is no indigenous practices in managing and treating tuberculosis. Yes, there are a lot of leaves and they are using, but none of those can be used to manage and treat tuberculosis. It is better to consult a doctor if you have a TB in order for them to give you the appropriate medication. Next slide, please. in the prognosis improved. When respondents were asked about the prognosis of the disease after doing those treatment and management procedure, respondent 1 have said that nothing bad happened to her child when she let her drink the boiled vinegar to manage her asthma attack. In fact, her child feels better after doing it. Nothing bad happened to her after doing it. Her asthma improved and feels much better. While respondent 2 said that her child's pneumonia really improved because they follow the doctor's order, especially the medicine that has been prescribed, and that is the only that they did. Yes, because we follow the doctor's order, doctor's prescription. That is the only thing that we use. That is why she became better even though we did not use other medicines.
Table 2.1. The perceived effectiveness of SNAG mothers on their indigenous practices towards the management and treatment of respiratory diseases in terms of safety. As presented in the table, SNAG mothers believe that indigenous healthcare practices is not harmful with a mean of 3.8, which is interpreted as safe. It is also evident in the table that there is a lesser side effect when taking natural remedies with the mean of 3.81, which is equivalent to safe. This is because whenever they are using their indigenous healthcare practices, they do not experience further harm or complications. According to Moreira and his colleagues, the lack of observations on its adverse effects suggests that these particular endpoints are safe. The categorical weighted mean for safety is equal to 3.81 and is approximately equal to 4, which means the mothers perceived the effectiveness of indigenous practices in the management and treatment of respiratory diseases in terms of safety is safe. The table 2.2 perceived the effectiveness of SNAG mothers on their indigenous practices towards the management and treatment of respiratory diseases in terms of efficacy. The table presents that SNAG mothers perceive that indigenous healthcare practices help in relieving symptoms of various respiratory diseases with a mean of 3.83, which is interpreted as moderately effective. Herbal remedies for the treatment of respiratory disorders are common practice in many parts of the world. It is also evident from the table that indigenous healthcare practices are more efficacious than mainstream medicine with a mean of 3.67, which is equivalent to moderately effective. Medical plants from indigenous pharmaceutical are considered moderate in efficacy and thus less toxic than most pharmaceutical agents. In research by Grant and others, traditional medicine has proven to be quite effective in treating both chronic diseases and psychological problems, especially those associated with stress. It is evident from the table that the respondents believed that indigenous healthcare practices involve natural plant formulas that are healthier than taking drugs given by the doctor and have a mean of 3.62, which is interpreted as moderately effective. The finding shows that indigenous mothers agrees that indigenous healthcare practices build up the body's own defenses and promote self-healing with a mean of 3.61. The categorical weighted mean for efficacy is equal to 3.68 and is approximately equal to 4, which means that the mothers perceive the effectiveness of indigenous practices in the management and treatment of respiratory diseases in terms of efficacy and moderately effective. The table 2.3 is the perceived effectiveness of SNAG mothers on their indigenous practices towards the management and treatment of respiratory diseases in terms of cause. It is apparent from the table that indigenous mothers say that they don't need to spend money when using indigenous healthcare practices with a mean of 3.73, which is considered not costly. According to Effort and Thomas, in 2010, it is estimated that two-thirds of the world population resort to medicinal plant derived from folk medicines because traditional medicines are cheaper than drugs from pharmaceutical companies. In many cases, medicinal plants from folk medicines are only source of healthcare. This is especially true in rural areas. With a mean of 2.16, indigenous mothers agree that healthcare services are more costly than indigenous healthcare practices. This is congruent with the study of Kemper in 2001, which found that there is a widespread assertion that camp practices are less expensive than mainstream medicine, and using such therapies will lower overall healthcare costs. It is also evident in the table that snag mothers don't need to buy medicines because herbal plants are just around with a mean of 3.77, which is equivalent to not costly. This means that they do not need to spend a lot of money and is accessible to them. This is congruent with the study of Sewell and others, which stated that herbal medicines have continued to be substantial demand in the developing world, not only because they are readily available and moderately inexpensive, but also because of cultural acceptability. The categorical weighted mean for safety is equal to 3.77 and approximately equal to 4, which means that mothers perceive the effectiveness of indigenous practices in the management and treatment of respiratory diseases in terms of cost as not costly.
Yes.
The,
Nawala
tab- the table 3.1 is the difference between the perceived effectiveness of indigenous practices when grouped by profile variables. The table shows the difference between the perceived effectiveness of indigenous practices when grouped according to profile variables. It can be seen from the result that there is a significant difference between the perceived effectiveness of indigenous practices in terms of barangay of residence. Since both of these barangay are in remote area, far from the city, where they do not have an immediate access to medical consultation, therefore, all they have to do is to depend on their indigenous practices as their immediate response to health condition or issues which they believe to heal or alleviate the signs and symptoms of a respiratory disease or any diseases. That is why they have a high assessment on the perceived effectiveness of their indigenous practices in the management and treatment of respiratory diseases. It is also evident in the table that there is a significant difference between perceived effectiveness of indigenous practices in the management and treatment of respiratory diseases in terms of cigarette smoking with computed probability of 0.001. Cigarette smokers were most likely to develop respiratory diseases, and it can be also triggering factor that can exacerbate the present lung disease of an individual. Therefore, they are the ones who are most likely to use or to include different indigenous healthcare practices in managing and treating respiratory diseases. That is why they have a high assessment on the effectiveness of indigenous practices in the management and treatment of respiratory diseases. According to Nelson, and others, cigarette smokers were less likely to use herbal preparations. In the table 3.1, it shows the difference between. It is also evident in the table that there is a significant difference between the perceived effectiveness of indigenous practices in the management In Table 3.2, in contrast to Table 3.2, difference between the perceived effectiveness of indigenous practices when grouped by profile variables. The table shows the difference between the perceived effectiveness of indigenous practices when grouped according to the profile variables. It can be seen from the result that there is a significant difference between the perceived effectiveness of indigenous practices in terms of modalities utilized during consultation. This is due to the fact that this can affect their understanding towards the use of indigenous practices in the management and treatment of respiratory diseases. When they are exposed to someone who is well informed about medicine and healthcare, this will contribute in having a more updated knowledge on how to treat and manage respiratory diseases. And from there, SNEG mothers will consider that modern medicine or mainstream medicine is effective. Next slide po. Table 3.3 shows the post-hoc analysis using Turkey HSP.
From the responses gathered during the interview, the following themes and subthemes were derived. Factors that affect the indigenous practices of SNEG mothers in the management and treatment of respiratory diseases. The theme is mainstream medicines and the subthemes are doctor and medicine. In terms of doctors, mainstream medicine has affected the way the SNEG mothers perform their healthcare practices. Due to the emerging development in medicine and healthcare, practices of SNEGs are shaken to some extent. According to one of the respondents, they only use medicines given by a doctor and they never use those that are not prescribed by a doctor. The only medicine I used was the medicine that the doctor prescribed. I have never experienced using medicine that was not on the market or given by a doctor. The other respondents have said that whenever they feel ill or sick, they visit a doctor to seek some medical advices. When someone is sick in our family, we go to the doctor for medical consultation because we know that they are the one who can help us feel better. In terms of medicines, SNEG mothers trust more the medicine from a doctor than herbal medicines. As stated by one of the mothers, I don't quite believe in herbal medicines because I believe more in the medicines given by a doctor. The other respondents said that going to hospital is better because she believes that medicines from the hospital is more effective and can immediately relieve the symptoms of a disease. It is more efficient when going to hospital because the medicine from the hospital is much more effective. It can alleviate the disease immediately. Next slide. Effectiveness. In terms of the recurrence of disease, the effectiveness of indigenous healthcare practices is one of the factors that affect the use of their practices, as based on their experiences in using both indigenous practices and mainstream medicine, they have proven that mainstream medicine is much more effective and more reliable when it comes to managing and treating certain disease. Indigenous practices is more on using leaves, and SNEG mothers believe that there is a possibility that the disease will recur. Compared when they use medicines given by a doctor, the disease does not recur. If it is about our indigenous practices, it is more on using leaves and the diseases will have a tendency to recur, not like when we use medicines given by the doctor, the disease does not recur. Difficult to recover. One of the SNEG mothers already tried using indigenous practices in the management and treatment process of her disease, and she said that If you rely on using indigenous practices, it will be difficult for you to recover from the disease. That is why she bought medicines from the pharmacy because, according to her, it is much better. If you use indigenous medicine, it will be hard for you to recover because me, myself, already tried using it. That is why medicine that we buy from the pharmacy is much better. The other respondents said that if you use herbal medicine alone, it will not reduce or relieve the pain, especially when the medicine or drugs is not given by a doctor. If the herbal medicine is used alone, it will not relieve the pain if the medicine is not prescribed by a doctor. Next slide.
The summary of findings. The findings revealed that most of the respondents were aged 30 to 39 years old. The majority of them were residents of barangays Upper Maton, Pudtol, and Apayao. Most of the respondents' family types are nuclear, and almost all of them were Roman Catholic. Most of the SNEG mothers attained high school level, and most of them were unemployed and had an average monthly income of less than 11,690 pesos. Moving on to their clinical profile, the majority of the respondents have no current illness or ailments and no comorbidities. When it comes to their vices, most of them were non-smokers and abstainers or never drank alcohol at all. In terms of their health-seeking behavior, most of the respondents prefer to visit a doctor and go to the hospital. A majority of them prefer to face-to-face consultation as a modality utilized in seeking medical advice. The study found that mothers managed and treated their asthma with boiled vinegar and nebulization, while they sought medical attention for pneumonia and tuberculosis. In terms of prognosis, they have seen a good prognosis for the diseases after incorporating these practices. The study showed that the perceived effectiveness of SNEG mothers in the management and treatment of respiratory diseases in terms of safety is safe. In terms of efficacy, it is moderately effective, and when it comes to cost, it is not costly. Based on the study's findings, the researcher concluded that SNEG mothers in Upper Maton and Lower Maton do not anymore incorporate their indigenous practices in the management and treatment of respiratory diseases. This is due to the fact that SNEG mothers in the said barangays rely more on using mainstream medicine, which they believe is more effective. In addition to that, there are factors that affect the implementation of indigenous mothers' indigenous practices in the management and treatment of respiratory diseases, which include mainstream medicine and effectiveness. This is due to the fact that they experience a recurrence of the disease and difficulty in recovering from the disease when indigenous practices are used.
SNEG mothers, since SNEG mothers perceive indigenous practices in the treatment and management of respiratory diseases as moderately effective and safe. Further study should be done to identify the components of the different tools that they use in performing their practices, especially when they use plants available around them that they think are useful and beneficial. Through this, they can identify components of the plants that are useful and effective to treat certain respiratory diseases and also identify which of the tools they are using or components of the plants they are using are not beneficial and may pose harm to the user. Second, since there is no study that proved that vinegar can help in relieving asthma attacks, barangay healthcare workers should further educate their community regarding respiratory diseases, especially asthma, and particularly its proper management. Next, the SNEG mothers need to consult experts like doctors regarding the effectiveness of their practices, be well informed of their benefits, if any, and adverse effects, in order to conclude that those practices can truly help in the management and treatment of respiratory diseases. The Department of Health must support the integration of traditional medicine into their healthcare systems. These include the preparation of guidelines for the appropriate use of herbal medicines and promoting the proper use of herbal medicines, which are flexible, feasible, and practical. And last, for a higher reliability of the study's responses, it would be best if future researchers include those respondents who personally experience and perform indigenous healthcare practices in the management and treatment of respiratory diseases. That would be all. Thank you for listening.
Thank you so much, Group 9C. Medyo problemado ko sa paper nyo, no? But we listen first to the recommendations and suggestions of Sir Julius. Sir?
Yeah,
Direct,
go back.
are you here?
Yeah, kindly go back to your title. I'm lost. No, I think the title does not talk about the entirety of the research. There, siguro. Yan na lang, yan na lang. Yun na lang, yun na lang. Huwag na yung... okay. Sige, yan. Sige pa. Yan. Your title kasi mga anak, Vince and the rest. Where are you? Vince, where are you?
Sir, dito po sa Payaw, sir.
Tignan niyo yung title niyo, anak. Indigenous Practices. Nasaan yung indigenous practices? What I was expecting is that you're going to tell us about, you have to showcase the practices. It turned out in your research that it was a perception on the use, effectiveness of the indigenous practices. Instead of selling the indigenous practices, it turned out that it is something that should not be, done already. The concept of the paper, if you look into your conceptual framework, because you make use of, PTAC, creation, and then you have the SDGs, there is a blend, and there must be a blend between contemporary and conventional, or what we refer to as traditional, and the contemporary medicine, di ba? Kaya TICAM, traditional and complementary alternative medicine. In other words, ang gusto ko sanang nangyari dyan ay, yung sa chronic asthma, ito yung ginagawa nila. What are the indigenous practices? For example, sa asthma, meron silang tinatawag na yung anong tawag doon, ma'am? Yung steaming. For example lang steaming yung asthma. Yung isa namang asthma, kumakain ng lizard. Mga ganon, di ba? Yung isa naman, asthma, as far as I know, kunwari, naglalakad siya daw every morning, mga 4 hanggang 5, when the breeze is doon sa near the river. I mean, salt, ganun daw, no? Ganun sana, iniisip ko, saan yung indigenous practices? Yun yung gusto kong i-showcase nyo muna. Okay? Kung baga, sa chronic asthma ba, kumakain ba sila ng, for example, kasi sabi nila sa ibang lugar, lalo na sa Apayao, ay meron daw yung mga honey na inalalagay nila sa blend ng coffee kasi iwas asthma daw. Yun yung hinahanap ko. Nasaan yung mga indigenous practices? Isa lang ang nakita ko dyan, vinegar. Kung naiinom sila ng vinegar. Wait lang. Correct. So, nasaan yung indigenous practices ng chronic asthma? Nasaan naman yung indigenous practices ng pulmonary tuberculosis? Nasaan yung indigenous practices ng community-acquired pneumonia? Pag sinasabing indigenous practices, hindi lang anak na may iniinom sila. Pwedeng may sinusuot sila. Ayan, for example, indigenous practice. No? Kailangan isuot ko to, bertud ko to para hindi ako magkakaroon ng mga sakit. Nakita nyo ba kung bakit araw-araw akong merong ganitip? Kasi indigenous practice pala yan. Mga ganon. Nasaan siya? Gusto kong i-highlight yun kasi ang sinasabi nila ngayon, anak, no, sa literature, bumabalik tayo dun sa olden days. Sa tama naman. We are looking at the possibility na safer pa rin, naintindihan, yung ating mga natural products, yung may mga pagkakataon na yung ating mga indigenous practices, no, kailangan siyang i-blend, naintindihan, sa mga contemporary, use ng antibiotics para mas magaling gumaling yung tao. Parang gano'n, yung pagpunta nila sa mga afa, indigenous practice yan. Yung pupunta sila sa elder, indigenous, nasaan lahat yun? Kasi if you try to take a look, no, doon sa National Convention ng mga manggagamot noon at mga mangkukulam, kasi I was part of that, isa sa mga assemblyman ng mga national manggagamot and espiritistas convention, which was done in CSU Carig 2 years ago. Sanabi ko pa na pumunta sila, Ma'am Jinky, try nila yung mga modalities doon. Di ba? Bakit? Doon sa convention nalaman ko na yung mga doctors, no, kapag wala silang tinatawag na spiritual, emotional, and psychological approach, lagi lang na treatment. Pagpunta ko, for example, no, yung kapatid ni Ma'am Jen, magiging doctor yan later. Pupunta sa pasyente yan. Oh, inubo ka ba? Tumae ka ba? Ito yung mga gamot mo. Period. Lalayasan niya na yan. Wala pang 10 minutes ang mga doktor na yun sa mga pasyente nila sa dami. Pero pag blend mo yan, naintindihan, for example, ng mga pupunta sa yung mga aafa, ganun. Di ba? Yung paghihilot. Hindi 10 minutes ang ganito, ganyan, itong gawin mo, ito kasi. Naintindihan, nandun yung parang, yung emotional, psychological wellness, yun yung nakukuha sa mga babaylan, may mga nagdadasal para sa kanila. Yung mga doktor, hindi yan magdadasal para sa mga pasyente nila. Correct? Yun yung hinahanap ko, nasaan yung mga indigenous practices. Kumakain ba sila ng charcoal? Malay ko ba kung ganyan? O naglalagay ng minsan, Viernes, no, pumunta ako sa isang barangay. Nakita ko, bakit lahat ng mga barangay, merong maliliit na cross, tapos merong nakatali na yellow at saka white na ribbon. Tinanong ko yan, bakit yan? An-anib mi day 2. Correct? Okay, for example, meron, di ba, ewan ko kay Ma'am Jinky at Ma'am Jen, pagkatapos ng Semana Santa, di ba, Sunday, ano yung, yung Easter, yung ganun yung Domingo Ramos, ano yan, how do you call that?
Palaspas.
After nung palaspasan mo nalalagay yan, di ba doon sa baryo, ilalagay doon sa harap ng bintana, iharap sa, parang ganun, correct? Yun yung hinahanap ko dun sa number 2, nasaan yung indigenous practice para matuwa sana ako na, ay, ganito pala ang ginagawa nila, para maintindihan ko sila. So from, yes, please.
Nung nag-interview po ako, sir, wala naman po kasi silang asthma, ganun, sir, TB.
Correct, maintindihan. Ang problema, anak, dyan, no? Number 1, who did you interview, no? Correct? Kung hindi sana mothers, di pupunta ka sa elderly. Correct? Or kung walang asthma doon, lumipat ka ng lugar. Kasi there seems to be, hinulaan mo lang naman yung lugar na yan nung ikaw, wala ka namang, in conducting the research, there should be a preliminary or prelude activity. You investigate. It's not a reason like, wala kasi silang cases. All the more na, alam mo na palang walang cases, bakit mo pa kinuha yung lokal na yan? Gets? So sana gano'n, no? That should have been number. You know why? Because from number 2, you answer number 3. Pumunta ka na sa number 3. If you were not able to identify the practices, how can you perceive the effectiveness? of the practices. Do you understand? Yun yung problema. I-identify mo muna. Example, yung mga kumain ng butiki. Correct? Perceive effectiveness. No? Sabi niya, ay hindi ma'am effective kasi yung buong butiki pala na buhay ang kakainin, hindi pala ipiprito. O di, at least alam na natin, ay mali kasi ang sinasabi ay dapat buhay. Prinito mo. Naintindihan, parang ganun sana. Kukunin natin yung kwento. In fact dito, hindi nga quanti ang gusto ko dito No, kung pwede nga lang sana tanggalin mo na yung number 4 diyan, basta magkwento ka na lang ng mga nangyayari. Yung matutuwa ka na may bago tayong nado-document. I remember ng proposal yung sinasabi ko pa na minsan magkakatay sila ng manok tapos iwarsi-warsi nila dun sa pinto, ganun, para lang to drive away yung mga yung mga may spirits kasi they cause the disease. What we are trying to look here are the indigenous practices. Yun sana. Tapos i-evaluate natin ang effectiveness. So, tignan natin doon sa number 2 and 3 mo, mukhang nagka-problema. Kaya, doon sa study design, nagka-problema na din. Pagdating doon sa results, hindi mo ba napansin, anak Viernes, na mga pinagsasabi mo kanina ay contradicting sa sinasabi ni Ms. Villanos? Hindi mo napansin mo? O hindi? O ako lang nakapansin? Na yung sinasabi ni Villanos ay ginagamit nila, they perceive it effective, no? Medyo ganito yung ginagawa nila. Tapos pagdating kay Viernes, ang sasabihin niya or it's the other way around. Si Viernes ang nagsasabi na effective, so sinasabi na Villanos hindi na. Ayaw na nilang gamitin. Ayaw na nilang gawin. Di ba? Hindi sila naniniwala. Sabi niya, the effectiveness is good, no? But they make use of the conventional approaches na, the contemporary approaches na. Nag-antibiotic na lang sila, ganun. So, may contradictory na doon. Kung talagang effective yan, sinasabi sana nila ay ginagawa nila plus, no? Meron silang tinatawag na contemporary measures sa medicine pa, yung nagte-take sila antibiotic, tapos ginagawa din nila yan. Parang ganun sana. Ito talagang hindi na nila ginagawa Diba? So parang yung study, anak, hindi na siya yung title niya. Ang study mo na lang ay perceived effectiveness. And the answer is, they are not, effective, and in which case, they do not make use of it. Neither do they endorse. Yun yung conclusion mo. Actually, yun yung conclusion mo. No? They find it not effective. That's why they stick to the contemporary ways of managing diseases, and that is through antibiotics. Ganun yung naging conclusion. Kasi perceived effectiveness. But it's not perceived effectiveness. The title is the indigenous practices. Naintindihan, more than effectiveness, we should have showcased the indigenous practices. So, Viernes, ang iniisip ko dito, nagpakita ka ng picture, naintindihan, na ito yung ginagawa nila. Naintindihan? Okay, tapos, ganun, i-discuss nyo kung ano yung modality na yon. That is, in fact, how I wanted you to package the research during the proposal. No? May mga pictures na nangyayari, tapos dinidiscuss mo kung ano, para matuwa ko, ganun pala yung indigenous practices. Naintindihan? Yung parang na-educate kami kung ano yung mga pinaggagawa doon din. Para ang susunod ay yung degree of effectiveness niya. No? Alin dyan ang ginagawa, alin dyan ang hindi ginagawa, no? Dahil ang perceived effectiveness ay low. Ganun. The issues would be dun sa perceived effectiveness, you have to ask them, why do they think it's effective? Why do they think it's not effective? Ang ganda sana. Tingin na gano'n. No? Tipo kung may TB, nakita ko pa yan sa isang study ni Dr. Sia. Yung mga taong may mga pulmonary cases or cutaneous cases, umaakyat sila sa isang cave Naintindihan? Tapos dun sa isang cave, parang may ermitanyo o merong lanaan da isuna. Lanaan would mean may oil. Tapos magtirik ng kandila kasi may image ni doon ng isang Mama Mary. Tapos magdadasal sila. Ganon. No? So parang, ganun pala. For example, Mount Tabungaw. Tabungaw, susulat na kinagan. Parang ganun. Nasaan siya? Hindi ko natuloy. Maganda yung title. Akala ko yun yung laman. Nung nakita ko na, problema ko na. Okay, so, pero sabi mo, what factors affect the implementation of the indigenous practices? Doon sa question, ano yung factor? Sige nga, dito sa factors mo kasi, di ba, yung number 3 mo, yung perceived effectiveness mo, may mga variables yan. Correct? Access, ano yung mga ginamit mo doon sa table 3 mo nga? Tignan ko nga. How did you measure the effectiveness, perceived effectiveness? Parang yan, ma'am, may themes pa sila. Saan nila bakit may themes? Saan ano yung sinasagot ng themes? Yung diniscuss ni Vince kanina, bakit may themes? Balik ka nga doon pala. Ano yan?
Sir, yun po yung sa qualitative na part po. Dun sa indigenous practices po. Yung sa interview sa indigenous practices po nila.
Bumalik ka sa objectives para maliwanag. Ano yung sinasabi mong quali dyan? Ayan.
Yung number 2 po and number 5 is quali po.
Number 2 and number 5.
Yes.
Quali.
Opo.
Okay, tas yung quali, ayun pala. Yung number 2 mo is quali, ano yung mga ginagamit nila, di ba? Anong tinanong nyo doon sa quali? Parang hindi naman indigenous practice. Bumalik ka nga doon sa indigenous practices. Mali naman ata yung sagot nyo.
Tinanong po kasi namin sila direct pero wala daw po silang indigenous practices pag sa asthma, pneumonia, and tuberculosis po.
In other words, they should not really have had been the correct respondents. Inanalyze nyo sana yan na mali. Di ba in every step of the way, magkakaroon ka ng problema. You should have had talk to your advisor or your teacher. Correct? Sabi mo, ma'am, problema ito, wala naman silang masabi kasi parang elders na lang, okay, mga mumbaki na lang. Kasi katulad nito, manage, bakit tinanong mo ang management? Ang tinatanong naman doon sa question ay what are the indigenous practices? Tapos ang sagot mo, consult a doctor. Di ba? Parang naging indigenous practice yung consult a doctor. Parang tapos nebulization. Paano naging indigenous yung nebulization? Tapos naging siya.
Yung first question po kasi namin sa may interview po, tinanong po muna namin yung mothers kung may asthma ba, ganun po sila, or may family member po silang may asthma. Tapos nung sumagot po sila ng meron, tinanong po namin kung paano po nila minamanage yun or kung may indigenous practices po ba silang ginagawa para i-treat or i-manage po yung disease. Sabi po
And do you think that's the correct attack to answer number 2? Di ba? Yun yung problema mo. You are going to document You know, ang maganda sana dyan doon sa elders. Bakit? Lahat ng mothers pumupunta doon sa elders para magpagamot. Di ba? More than the mothers. Kasi hindi lahat ng mothers. Example, I know of a lot of manghuhula, mang-aafa in Tugigaraw. But if you ask Ma'am Lily, dinala mo na ba yan sa sa faith healer, yung anak mo nung nagka-inong umubo, nagkapilay, ganyan? Hindi pa. Ma'am Jinky, tignan pa natin, hasyendera. Ma'am Jinky, dinala mo na ba yan?
Ako, sarili kong dinala ko.
Naintindihan. Pero yung bata wala pa. Ako kasi, we go, mommy and I, even, for example, Ako, I still go. Naintindihan? Parang ganun. Eh, tinan mo, mga health practitioners kami. Not all
Yeah.
mothers will have to tell you ginagawa nila. Pero pag pumunta ka direct doon sa nagpe-perform ng procedure, malamang marami siyang makukwento. Tama ba, Grishel? Yung siya
Yes
mismo
po.
yung gumagawa na. Oh.
Actually
Marami
po,
na
naghanap po kami ng faith healer po, pero hindi po siya pumayag. Bawal daw po.
pumayag na alin?
Na i-interview po.
Oh, ilang faith healer yung pinuntahan mo? Iisa.
Vince, ilan? Si Vince po kasi.
Sir, tatlo po. Pero sabi po kasi ng kasama ko, sir, baka magamot ka kung nanamagamin, sir.
Hindi. Yan ang sinasabi. Mother Jinky, ang nangyari pala, umurong yung mga buntot nila. Oh, nakita mo na? Ito kasi, it takes courage to join. Naintindihan? At saka hindi mo naman siya kasi tatanungin. Minsan kasi pupunta ka rin lang, tapos mag-observe ka rin lang naman. O naintindihan? Minsan, okay, ito palang ginagawa nila. Okay. Or minsan, hindi. Bakit yung iba nagagawa nilang i-document? Naintindihan na may consent din naman yung tao? Because, yun yun. For me kasi, nagkaroon talaga ng hindi talaga natin nasagot yung problem. You look at the main problem, hindi nasagot yan. No? Yung number 2, hindi rin natin nasagot. Kasi ang subthemes mo dito ay nebulization kada consult a doctor which is no longer indigenous. So ma'am, to reconcile, paano kaya ito? Hindi naman natin, kung tatanggalin yung indigenous, kasi hindi naman na talaga siya indigenous, pero indigenous, sakit sa ulo, paano ba ito? Sige, ibaba mo pa nga, tignan nga natin paano ba iayos ito. Kahit man lang, sige, Vince, aside from boiling and sneaking the vinegar, ano pa yung sinabi nila?
Sir, yun lang po yung nasabi kasi, sir.
Tapos tinan mo yung perceived effectiveness. Yung perceived effectiveness is per modality eh. Pag nakita, for example, 5 yung modality doon, yun yung titignan natin yung effectiveness niya. Ang nangyari dito, perceived effectiveness of indigenous practices as a whole. Ang iniisip ko dito is, we will look into the perceived effectiveness of the modality, of each modality. Ang nangyari dito on a general context, yun yung nangyari. I don't know. For example, yung safety sana, there is lesser side effect when taking it with other of the standard treatment. Parang ganun sana. Perceived effectiveness. Paano ba ito? So, Ma'am Jinky, I recommend palitan yung title. So, yung title na lang would be yung perceived effectiveness. Kasi yun ang showcase na nila eh. Wala na talaga siyang practices. No? Perceived effectiveness of indigenous. Tapos ang sagot pa naman.
I don't even know kung anong indigenous practices ang sinasabi dito.
Sabi na nga, vinegar na nga daw, parang igaganon na lang, ikakapsulate na lang natin ganun. Kasi for example, ito kasi Vince and the rest, sabi nyo, wala silang indigenous practices. So bakit pa tayo gumawa ng study na ganito kung wala naman palang sagot, di ba? Oh. Dapat, in-ascertain nyo muna na merong indigenous practices, kaya malamang kung hindi sa nanay, doon talaga kayo sa elderly. So, ikakalibrate talaga kasi mali talaga yung laman, no? Perceived effectiveness of ISNEG mothers on the use of, anong tawag ito? Boiled vinegar? Ganun, ma'am. In the treatment of respiratory diseases. Kung na lang. Di ba, ma'am? Tama. Very shallow na siya. Hello, Villanos? Naintindihan nyo? O wala?
Yes po.
Iulit mo nga. Kung hindi, kukulutin kita dyan.
Yung title po is Perceived Effectiveness of the Use of Boiled Vinegar in the Management and Treatment of Respiratory Diseases.
O, ganun na lang. Perceived effectiveness of snag mothers. Ganun. Di ba? Perceived effectiveness of boiled vinegar in the treatment of respiratory diseases. Tapos open the case of snag mothers. Ganun na lang, ma'am. The case of snag mothers. O, tapos number 1 niya, profile variable. Number 2, tinanong lang nila kung wag na nilang itanong yung yung number 2 kasi nga yun yung sagot na boiled, di ba? So ang number 2 nila would be the perceived effectiveness, right? Okay, tapos ang number 4 mo, is there an association na? Correct? Tapos ang number 5 niya, pwede yung factors. Patingin yung factors mo, anak. Tingnan ko lang, baka pwede nating ilagay. So perceived effectiveness, Ma'am Jinky, in terms of letter A, safety, letter B, ano yun, anak? Pero papalitan niyo yung discussions nyo, kasi ang inassess na lang natin yung boiled vinegar.
Yun na lang.
Correct? So letter A mo, effectiveness, letter B, efficacy, di ba? Meron pa bang ibang factor doon? Wala na.
Yung cost po at saka
Cost,
safe.
okay. And then, ano yung isa pa?
Cost, safety, and efficacy po.
Ma'am, cost efficiency, ano yun? Effectiveness.
Efficacy po.
Cost efficacy, effectiveness, at saka?
Magkakahiwalay po yun.
Alam
Cost,
po, letter
tapo,
D. Hindi ngayon pwede yung cost. hindi pwedeng cost, anak. Sabi mo, cost efficiency. Kasjay.
Opo.
Okay, so number 1, letter A is cost efficiency. Number 2, effectiveness. Kasi pag sinabi mong cost, magkano kung nanantuloy dyan? Naintindihan? So cost efficiency, effectiveness, at saka dun sa table. Kita ko na nga kanina yun. Fairness, ano yun? Efficiency, ano yun? Ayun safety, di ba? Cost, sabi mo may costs, efficiency. O cost effectiveness na lang kasi efficacy ka pala dyan. Cost, effectiveness, safety, efficacy. Nasaan yung cost? That should be table 2.3. Wala naman. Ano yung sinasabi ni Villanos na cost? O cost. Cost. Hindi ko naintindihan na talaga. Bakit may table 2. Asan yung efficiency kanina? Table ano yon? So tignan mo kasi table 2.1, table 2.2, tapos yung efficacy mo, table 2.1 ulit. Hanapin mo nga yung costs. 2.1 na naman. Ilan bang 2.1? Ilang table 2.2? Diyos ko. So tatlong parameters yan. Cost effectiveness, efficacy, at saka safety. Diba? That would be effectiveness. That would be your objective number 2. In terms of cost, effectiveness, efficacy, and safety. Tapos, ang number 3 mo is factors. So, nasaan na yung factors? May factors ka, di ba? Yung factors mo is the, ano pa din? Quali?
Yes po.
Nag-quali ka pa. Mali din yung sagot. Kasi what factors? Kung na effectiveness. Kung na naman hindi tan. Tanggalin mo na rin yan. What factor? Ang number 3 niya na lang, ma'am, is there a significant difference? Parang naging investigative research na lang siya. So, tatlo lang yung objectives nyo. Respondents, efficacy, perceived effectiveness, tapos is there an association? Um, Pwede bang lagyan natin ng number 2 para kasi ang tsaka naman ng paper. Ang number 2 mo is what is the prevalence nga? Kunin mo nga ang prevalence for the past 5 years. Makita ko lang ang trend ng respiratory ailments dyan sa lugar na yan. So that would be objective number 1. Hello? Sige nga, mag-prevalence nga para makita lang natin kung meron. Tapos number 2 would number 1 would be profile variable. Number 2 would be yung prevalence. Number 3 would be the efficiency of the young vinegar na yan. Perceived effectiveness of the vinegar na yan. Tapos, is there a significant difference na? 2 and numeric 2 and 3 for number 4. Okay? So Viernes and the rest, I think you have to overhaul the discussion because this time it is centered on the effectiveness of the vinegar, of the boiled vinegar. No? And then Viernes, if I may, you please make kwento of how they use the boiled vinegar. The boiled vinegar is being drunk or it is being sniffed, inhaled, or the boiled vinegar is pagdigos. Anong gagawin?
Iniinom po, sir.
And how frequent it is? I mean, what kind of vinegar? Vinegar na Del Monte? Ganun?
Yung nabibili po sa bote-bote po, sir. Yung ginagawa po nila.
It's their vinegar product.
Yes po, sir.
Anyway, that's my piece. I think, Ma'am Jinky, they need to overhaul based on the new objectives I have actually recommended. Thank you.
Yes, sir. Thank you, Sir Julius. At least magagawan pa ng paraan kasi hindi ko makitaan ng paraan kanina. Anyway, let's hear from Ma'am Lily. Are you here, Ma'am Lily? Sige, mukhang busy pa si Ma'am Lily. Ma'am Jen, best friend, are you there?
Yes, best friend. Actually, dun sa parang naging out of words din ako, best friend, kasi hindi nga tumugma yung content ng research nila dun sa title. So, it's more of na lang, total na sabi na lahat ni Direk, yung mga sobrang rich na nung insights ni Direk. Yun lang, it could have been better if you are so careful with your inclusion criteria. Dapat sana ang kinuha nyo dito, anak, una munang filtering question nyo dyan is, ginagawa ba nila ang indigenous practice? Yun muna sana, bago nyo sila kukunin na bilang isang respondent. Kasi and the result is saying that they find that the indigenous practices are actually moderate effective, yet hindi nila pinapractice. So hindi talaga siya pwede. Yung sampling technique, yung characteristic ng samples na kinuha nyo, hindi siya tumugma dun sa yung objective ng study. So I think the problem stem there, na hindi talaga siya indigenous practices kasi hindi na nga nila pinapractice. So yun lang sa akin, best friend, kasi may suggestion na din si Derek on how we can actually recalibrate this paper in a way na hindi nila uulitin yung pag-conduct ng study. Kasi talagang hindi talaga kasi pwede. Because you talk to the wrong people kasi. In the first place, hindi sila yung mga tao makakasagot doon sa objectives ng study ninyo. Yet you have findings that they have a very moderate effectiveness. They find the indigenous practices as moderate, yet hindi sila yung tamang people to tell whether it is effective or not. So, but again, there's everything has its first time. I hope na yung yung experience nyo dito, it's not going to drive your motivation of doing still researches in the future. So, ganun lang talaga siya. We keep on improving each time. So, still congratulations. Thank you.
Thank you. Nag-message na lang si Ma'am Lily. Wala din daw siyang masabi. So, hindi ko na babasahin yung notes ko kasi sumakit talaga yung ulo ko. Richella, sumakit yung ulo ko dito sa papel ninyo. Yun nga, exactly yung thoughts ni Ma'am Jen kanina. The title of your study is talking about indigenous practices and looking at your results and conclusion, lalo na yung sa FGD nyo or sa interview nyo na hindi sila gumagamit. So, mali na mismo yung taong mga pinuntahan ninyo. And kung ano yung sinabi ni Sir Julius kanina, maganda yung study, maganda yung title, maganda yung objectives nyo. If tama yung kinuhanan nyo ng answers. Ang pinakaunang tanong nyo, number 2 pa lang na question yun eh. Ano yung practices, indigenous practices na ginagawa nila? Kasi we would like to see sana yung compendium. Kung hindi sana sa respiratory diseases, kung wala sa respiratory diseases, as a whole na lang sana, lahat ng sakit nila, kung walang specific for asthma, walang specific for TB, walang specific for pneumonia. Pero you did not come naman sa amin, or hindi ko alam kung nagtanong din kayo kay Sir Kelvin, na wala silang practices. Wala kayong nasabi sa akin na wala silang practices at all. Parang ganun. Kasi kung wala silang practices, hindi dapat na ginawa tong paper na to sa mga ISNEG. Naghanap sana tayo ng iba. Kaso, tinuloy nyo pa rin. So, mali na yung number 3 nyo. You got yung mga perception ng mga ISNEG na wala naman silang indigenous practices. I don't know why they answered, they felt it's safe, ganun, hindi naman sila nagpa-practice. All the more yung nag-interview, dun nyo nakita na wala talaga silang practice. So ano ulit yung title na sinabi ni Sir Julius na ibabago nyo? Na ipapalit ninyo?
Yung perceived effectiveness of the boiled vinegar in the management and treatment of respiratory diseases, the case of ISNEG matters.
O yun na nga lang. Yun na nga lang yung, para hindi na kayo umulit. Actually, kung ako lang, papaulitin ko kayo ng bongga. Pero ayun na, ano na si Sir Julius na, yun na lang para siguro hindi sayang itong nagawa nyo na, natapos nyo na. So, I hope overall to, palitan nyo to ng bago. From the very start sa group na to, hindi na kayo pupunta dun sa indigenous people, indigenous practices from the introduction. Hindi na dapat yun ang makikita namin. Makikita na siguro namin na ito ay isa sa mga indigenous practices nila. But you focus only on the vinegar kasi yun lang ang nakuha ninyo na practice nila. Do you understand that?
Yes po.
Yun. So, yun nga. Sana tribal leader ang pinuntahan nyo din aside from yung mga mismong faith healers. Tribal leader na yung medyo, yung nga, elder na. Kasi you can ask kung ano yung mga dating practices siguro nila. I mean, we move on. We move on from indigenous practices. So, yun na. I hope na understand ng group. Hindi ko na ilalabas yung mga notes ko kanina. Sir Kelvin, meron ka po bang question for this group?
Wala po, ma'am.
Wala. Huwag natin pagsalitain masyado, Sir Kelvin, kasi sinisipon siya. Sa group, Richella, Vince, meron ba kayong tanong?
Wala na po.
Sure ka, Vince? Sure na walang tanong? Okay. Anyway, yes. Thank you, Sir Kelvin, for sitting down also with us. Kahit na masakit ka. Thank you po. Okay, if there are no questions from this group, we move on to the last group. Dave?
Yes po, ma'am. Tina. So, good afternoon, everyone. It's my honor to present to you our research entitled Effectiveness of Lens as an Online Platform, the case of CSU RT Department. My group is Castillo Apelaila Zelfa, Castillo Jalina, Collado Justin Kyle, and Cornejo Princess Anne, and yours truly. So next, Tina. Next, please. Next slide, please. So for the background of the study, COVID-19 pandemic has COVID-19 pandemic has compromised the traditional learning system, resulting in the suspension of face-to-face classes and hospital rotations of allied health sciences programs in Cagayan State University or CSU. With the implemented learning policy at home by tertiary institutions, many lecturers began to use the Learning Management System or LMS platform. LMS is an internet-based software allowing instructors to manage materials distribution, assignments, communications, and other instruction aspects for their courses. Learning Environment Network System, or LENS, the LMS utilized by CSU, is an instructional and flexible delivery platform wherein the students access their online modules and make learning possible even this time of pandemic. CSU Lens, powered by Moodle, is a third-party software used by many colleges and universities globally. Moodle is a learning platform designed to provide educators and learners with a secure and integrated system to create personalized learning environments. Next, please. However, no studies describe utilizing the current capacity for online learning with the adoption of learning management system in the Philippines allied health sciences universities and colleges according to Baticalan 2020. Not to mention that despite the students had acknowledged technology's benefit in support of their learning, still there are difficulties through the limits around the technical capability of the software, particularly in terms of its functionality. Hence, this study evaluated the effectiveness of LENS as an online platform. This study used the functionality and collaborative tools, knowledge acquisition, and learning attitude of respiratory therapy students as indicator in evaluating LENS as an online platform. This study also scrutinized the existing issues and concerns of students, faculty, and administrators with LENS. This study served as a basis for helping the learners and instructors to coordinate, plan, deliver, and track their learning and teaching activities. Next, please. For the statement of the problem, it generally evaluated the effectiveness of LENS as an online platform in the CSU RT department. And specifically, the study sought to answer the following question. Number one is to find what is the profile of the RT students in terms of age, gender, year level, enrollment status, academic standing, and technological resources to access LENS. And next one, the number two is what are the perceptions of the students on LENS as an online platform in terms of functionality and collaborative tools, knowledge acquisition, and learning attitude. And then number three is what are the issues of LENS as an online platform as perceived by administrators, faculty, and students. And lastly, is there a significant difference on the perceived effectiveness of LENS as an online platform when respondents are grouped according to the profile variables? Next, please. And for the methodology, first, the study was designed in Descriptive inferential, Sloven's formula and proportional allocation method was used to determine the sample size since the stratified random sampling was employed. Next. And the researchers adapted a questionnaire to serve as the survey guide, and it was validated by the experts. Next, please. And the next procedure was we conducted the survey pilot test and had it checked for its reliability by an expert or statistician. And the researchers then asked permission from the Office of the Chair of the Department of Respiratory Therapy and the Office of the Dean of the College of Allied Health Sciences. And next one. Next, please. And after the approval, the researchers distributed the letter of consent to the respondents to ask their participation in the study. And next, please. And the researchers then gathered data through Google Forms and distributed the link to the mayors of each class per year level for the students respondents and for the faculty respondents, and the link was directly sent to them. And after all of these, after the data gathering, we analyzed and we've summarized all the data that we have gathered. And next one, for the discussion and results, Ms. Cornejo will discuss it.
Table 1 presented the frequency and percentage distribution of the respondents in terms of age, sex, year level, and enrollment status. Among 205 student respondents, 33.7% or 69 students are 21 years of age, 31.7% or 65 students are 20 years of age, 23.9% or 49 students are 19 years of age, 9.8% or 20 students are 22 years old, and finally, only 1% or 2 students are 18 years old. The data implies that the majority of the respondents are 21 years old. Among 205 student respondents, 82.4% or 169 students are females, whereas 16.1% or 33 students are males. It is also seen in the table that 1.5% or 3 students classify themselves as non-binary or prefer not to say their sex. The data implies that the majority of the respondents are females. 39% or 80 students are on their second year in college. 34.1% or 70 students are on fourth year level, whereas 26.8% or 55 students are third year levels. The data implies that most of the respondents are second year students. 96.8% or 198 students are regular, whereas 7 students comprising 3.4% are irregulars. The data implies that majority of the respondents are regular students. The trend from the age, sex, year level, and enrollment status findings of the study could be explained by the proportion of RT students in the study sample, thus generating a general age, sex, year level, and enrollment status of the student's profile of the sample of the study, of which RT students' data profile were collected from internal and published sources. Next slide, please. Table 2 presented the frequency and percentage distribution of the respondents in terms of the general weighted average or GWA and the first semester of academic year 2020-2021. Among 205 student respondents, 34.6% or 71 students have a GWA ranging from 85 to 89. 27.3% or 56 students have a GWA ranging from 80 to 84. 20% or 41 students have a GWA ranging from 90 to 94. Finally, only 4.9% or 10 students have a GWA ranging from 75 to 79. The data implies that most of the respondents have a GWA on the first sem ranging from 85 to 89. It can also be observed from the same table that 13.2% or 27 students have a missing data. Table 3 presented the frequency and percentage distribution of the respondents in terms of their general weighted average in the second semester of academic year 2020 to 2021. Among 205 student respondents, 47.8% or 98 students have a GWA ranging from 85 to 89. It is interesting to note that the range 90 to 94 and 80 to 84 are distributed equally, each of them having a 17.6% or comprising 36 students. The data implies that most of the respondents have a GWA on the first sem ranging from 85 to 89. It can also be observed from the same table that 17.1% or 35 students have a missing data. Next slide, please. Okay. Table 4 presented the frequency and percentage distribution of the respondents in terms of their device used to access lens. Among 205 student respondents, 64.4% or 132 students use a smartphone to access lens. 31.7% or 65 students use PC or laptop to access lens. Finally, only 3.9% or 8 students use tablet to access lens. The data implies that majority of the respondents use a smartphone to access lens. The finding of the study is consistent to prior researches. Kalogianakis et al. 2018, Bahian et al. 2020, and Basha and Daud 2020 revealed in their study that majority of the respondents use mobile phones or smartphones to access learning management system. This is due to the fact that smartphones is more convenient and user-friendly to access lens. This belief is substantiated by Kalogianakis et al. 2018 as they revealed in their study that students preferred carrying out easy and low-stake Moodle tasks on their mobile phones, such as accessing learning materials. However, interestingly, this finding is in contrast to the findings of ERA and DIRA 2018. It was emphasized in their study that the respondents rarely use mobile phones to access learning management system. Table 5 presented the frequency and percentage distribution of the respondents in terms of the type of internet access used to access lens. Among 205 student respondents, 59% or 121 students use prepaid mobile data, whereas 41% or 84 students use postpaid subscription to access lens. The data implies that majority of the respondents use prepaid mobile data. The finding of the study is in line with Bahian et al. 2020. They revealed from their study that most of their respondents had an access of mobile data. This could be due to the fact that majority by accessing lens. Table 6 presented the frequency and percentage distribution of the respondents in terms of the amount of time they have spent in using lens. Among 205 student respondents, 51.7% or 62 students use lens from 30 minutes to an hour. 30.2% or 62 students use lens for more than an hour. Finally, only 18% or 36 students use lens for less than 30 minutes. The data implies that majority of the respondents use lens for 30 minutes up to an hour. The finding of the study, however, is not in agreement with the result which was found by Basha and Daud 2016, as they emphasize in their study that around 70% of the participants spend more than 2 hours per day on online activities related to their learning. The finding is posited by Ibrahim Gonzalez 2011 as he revealed that majority of his respondents spend less than an hour on learning management system. The small amount of time spent in accessing lens is due to the fact that most of the exercises are done asynchronously. This belief is supported by Ibrahim Gonzalez 2011 as students attempt most of the exercises online by downloading the relevant files, while others prefer to do the exercises online. Evident in Table 7 is the perceived effectiveness of Lens as an online platform in terms of its functionality. Excuse me po. Evident in Table 7 is the perceived effectiveness of Lens as an online platform in terms of its functionality and collaborative tools. Among the respondents were they viewed somewhat effective to all of their parameters: downloading course materials, checking course announcements, checking student portfolios, checking my courses, checking the course syllabus, submitting assignments, self-assessment, participating in forum discussions, excuse me. JD, excuse me po.
Hello.
Nangangati po kasi yung lalamunan ko, ma'am.
Hello, Dave. Are you here?
Meron pa, ma'am. So, I'm just continuing. So, evident in the table 7 is the perceived effectiveness of Lens is an online platform in terms of its functionality and collaborative tools among the respondents, where they viewed somewhat effective to all of the parameters, such as these: downloading course materials, checking course announcements, checking student portfolios, checking my courses, checking the course syllabus, submitting assignments, and self-assessment, and participating in forum discussions, and also the orientation help guide or assistance, and the visual appearance, Lens interface, progress review of courses, and assessing viewing calendar, receiving notification and allowing self-enrollment or allow self-enrolling, and online users visibility with min ranging from 2.77 to 3.48. All of these students respondent viewed all of the parameters as somewhat effective. This finding is supported with the works of Kaplan and Ashley 2003, as they claim that many asynchronous tools were listed as effective for teaching and learning, like the discussion boards and weblogs that is useful for sharing ideas and comments, the learning objects as effective for teaching and training, databases for managing information and knowledge surveys, and polls as an effective tool for capturing information and trends, shared calendars that is effective in coordinating activities, and website links that is useful for providing resources and references effectively. On the other hand, an analysis of the usability, navigation, posted course content, and perceived usefulness conducted by Kinto and Zhu 2016 revealed that to a large extent, the learners made use of the tools and resources and perceived them as effective and useful. The learners were excellent in utilization of messaging, logging into the system, use of the calendar, forum discussion, posting work to the instructor, downloading files, and the news forum. Their overrating of the LMS usage was satisfactory and considered it as effective. According to Tim Ness and Lee 2020, also discussed that despite the cultural differences, the students valued certain features of LMS, such as reviewing grade, downloading multiple files, and its access through mobile app. The LMS features related to users' convenience seems equally effective. In addition, for the functionality, the students felt the system had enough functionalities to meet their needs, according to Najmul 2013. The categorical mean of 3.16 implies that the respondents view Lens in terms of its functionality and collaborative tools as somewhat effective. And next one for the table 8. Next one, please. Next, please. In this table, it is evident that the perceived effectiveness of Lens as an online platform in terms of learning attitudes among the students respondents, where they strongly agree to the parameters. The materials uploaded by the instructor in Lens are relevant and appropriate with a mean of 3.55. The student respondents agree to the following parameters. Lens helps keep up with the course works easy and fast. Lens give me less freedom in choosing an appropriate time to the activities. I have willingness So I have willingness to learn through Lens. I find using Lens for learning as stimulating. I have problems assessing and going through the materials on my own in Lens, and I feel I am in the control of learnings as I review the materials provided in Lens, and I'm not satisfied with my experience of using Lens and learning from it with a mean ranging from 2.53 to 2.74. Most of the respondents have positive learning attitude towards Lens. The students' positive views and opinions regarding Lens as an environment to facilitate learning can be explained by the fact that the online platforms such as Lens provide straightforward interaction and communications. Such positive attitude could then lead to increased confidence in knowledge acquisition and a sense of connectedness among the students, according to Wang and Chen, 2007. This only means that the Lens allows and facilitates the necessary interaction with teacher-students connection. In addition, the positive learning attitude might have been resulted from the usage various activities, quizzes, discussion forums that make the students have a conscious effort to understand and learn, according to Gulbinski et al. 2017. And next one, please, for the table 9. Evident in this table also that the issues of Lens as an online platform in terms among the student respondents were they rank most experienced to some parameters, crashing of servers and slow loading of Lens pages with a mean ranging from 2.65 to 2.67. On the other hand, the student respondents rank moderately experienced to some parameters such as some activities or resource can be viewed only a desktop or laptop. Next one is the unsafe answer during quizzes exams, not enough training how to use tools efficiently and difficulty logging in, and an unreliable scoring system, difficulty submitting assignment with a mean ranging from 1.79 to 2.28. And it is noteworthy that the student respondents rank least experienced to some parameters, unable to download uploaded materials and not downloadable, not working URL or links with a mean of 1.50 to 1.67. The issues of Lens as identified by the researchers are consistent with the prevailing issues of learning management systems seen in the previous researchers. According to Valerie and Lord, 2000, learners enrolled in courses of learning management system often face technical problems. This dilemma could be due to the reasons of less advanced e-learning infrastructure, a small management team, and a lack of course designer and developer skills. This phenomenon in turn may influence the effectiveness of the system. It is therefore paramount to have a supportive technical staff of Lens who has a good control of the technology and to perform basic troubleshooting tasks. The categorical mean of 2.02 implies that the student respondents rank moderately experienced with the issues of Lens. And next one for the table 10. It evident here also that the issues of Lens as an online platform as perceived by the faculty of instruction, it is shown from the table that some of the respondents answered moderately experienced to the parameters. Crashing of servers, inputting quizzes, exam is tedious, and the maximum upload size is limited to only 128 MB and bigger files cannot be uploaded. And lastly is the slow time required to clear or load materials with a mean of ranging from 1.90 to 2.20. On the other hand, the faculty responded least experienced to the parameters, difficult course organization, a responsive system while updating course content, lack of mass show, hide, or move resources, limited test type, and unreliable online gradebook, and or unreliable automated student tracking or grading, and the poor accessibility compliance of my students with a mean ranging from 1.20 to 1.60. This finding is consistent with the work of Bennett and Lockyer 2004 as they claim that there are academics who have resisted a dropout from using the LMS offered by Firm Response their university due to various recorded issues. Some of these issues include poor or low technological skills, leading to the intimidation of technology generally among the older generation of the academics. Complains that the use of LMS increased administrative work for academics, poor activity response from students, repeated crashing of an LMS due to the inability to manage high traffic from its users, and additional problems often associated with the quality offered by LMS are low performance of the LMS, poor usability that causes serious problems for teachers and students, poor customizability of the system so that it makes it difficult to serve specific needs of institution, limited interoperability with other LMS, and poor reusability and high cost. And moreover, the members of the staff negatively rated the software on its usability in assessing tests and quizzes. The highest negatively rates items were knowledge, time and equipment failure, difficulty of using Blackboard network connectivity, inability to cope, workload due to design, release time, tools, and software campus support and suitability. For course content received above 56% negative rating. All other items received less than 40% negative rating. Technical difficulties of loading the software, loss of emails, security issues, and caching system. In addition, according to Mills, Witz, and Sadera 2008, instructors are sometimes dissatisfied with the system because it is often suffers from functional and technical problems, causing it to fail. Malfunctioning of the e-learning software was one of the most important problems because most users argue when the system fails and contingency plan do not exist to enable the teacher and faculty members to recover the lost time. The problem is critical, especially when teachers often quizzes on a given timeline. And the categorical mean of 1.68 implies that the faculty respond least experience with the views about the various issues of Lens as an online platform for teaching. And next one, we move on for the inferential statistics. And the table 11, next one, please. And the table 11 shows the significant difference in post-hoc test analysis to the significant difference on effectiveness of Lens as an online platform in terms of functionality and collaborative. And according in this table, the significant difference in the post-hoc test analysis, effectiveness of Lens in terms of functionality and collaborative tools and profile variables, it is apparent here that above that there are no significant differences when grouped according to age, 6-year level, enrollment status, device used to access Lens, internet access on Lens, time spent in using Lens, and the findings of the study are in agreement to prior studies of similar nature. Yao and Cheng 2012 revealed that the concerns of the variation in the perception of effectiveness by the age group, students exhibited statistically no significant difference in perception of the age interval was quite narrow. On the other hand, Taran 2019 revealed that the perception of learning management system effectiveness by the three different groups of students with a smartphone, with personal computer, and with internal access at home has no significant difference. This implies that whether or not students have smartphones, personal computers, or internet access at home, they generally have the same perception that learning management system is very effective. On the other hand, table 15 shows the significant difference and post-hoc test analysis of the significant difference on the effectiveness of Lens as an online platform in terms of learning attitude. And it, according to this table, it is apparent that there is no significant difference of effectiveness of Lens in terms of learning attitude when grouped according to age. Although age may not be a direct factor in the adoption of technology, exposure to computers may have resulted in significant difference in computer literacy and perceptions of effectiveness of learning management system. Familiarity with learning management system is an important factor significant to implementation. It's according to Chip et al. 2015 that this belief in their study, which explained the high computer literacy, was associated with both high usefulness and effectiveness of learning management system tools for the older students. In the younger health science students, computer literacy did not affect either of these measures, which may be explained by the fact that for younger students, technology adoption has already occurred. It is also apparent from the table that there is no significant difference when grouped according to sex, year level, enrollment status, device used to access lens, internet access on lens, time spent in using lens. The findings of the study are in agreement to prior studies of similar nature. And the findings of the study is consistent with prior studies at Wong et al. 2012 reported that there was no significant difference between male and female students in their attitude toward the effectiveness of learning management system. And he further claimed that this may be due to the fact that computers in education have permitted the everyday lives of press service teachers, and difference in the use between males and females have been narrowed till it was no longer be significant. This trend may be due to the fact that regardless of the students' demographics, they have a positive attitude toward the effectiveness of learning management system. This belief in accordance to prior researches. Hua et al. Claimed that all students, regardless of the gender, level of study, and course of study, have agreed on the effectiveness of learning management system. And according to Shiratudin 2002, a software should be easy to use and easy to learn by different groups of users. For instance, experienced and novice users, male and female users, and so on. And this is in line with Molich and Nielsen 1990, as they claim that any system designed for people to use should be easy to learn and remember, effective and pleasant to use. In conclusion, LENS may be considered a successful LMS that was perceived by different students of different gender, levels of study, and course of study as an effective online platform. And next one. Next one, please. And for the summary of the findings, balik po. And for the summary of the findings, this study was conducted for the purpose of evaluating the effectiveness of LENS as an online platform among the students of respiratory therapy department in Cagayan State University. The gathering of data was utilized with the use of descriptive inferential research design. The online survey questionnaire served as the research instrument for collecting the data. And the study has 205 students from the RT department as the respondents. The study was conducted during the academic year 2020 to 2021, and most of the RT student respondents are 21 years old, females, and were in second year level, enrolled as regular students, has a GWA ranging from 85 to 89 both in the first and second semester of academic year 2020 to 2021. Majority of the respondents perceive somewhat effective the functionality and collaborative tools of LENS, such as the downloading course materials and the checking course announcement, checking student portfolios, checking my courses, checking the course syllabus, submitting assignments, self-assessment, and participating in forum discussions, orientations, health guide or assistance, visual appearance, to LENS interface, and progress review of courses, accessing or viewing calendar and receiving notification, and allowing self-enrollment and online users visibility. Next one, please. Most of the student learning attitude includes the materials uploaded by the instructor in LENS are relevant and appropriate. LENS helps keep up with the courseworks easy and fast. And number 3, LENS give them less freedom in choosing an appropriate time to do the activities. And 4, they have willingness to learn through LENS, and they find using LENS for learning as a stimulating, and they have a problem accessing and going through the materials on their own in LENS, and they feel they are in control of their learning as they review the materials provided in LENS. And lastly, they are not satisfied with the experience of using LENS and learning from it. But most of the students perceive issues in LENS are slow loading of LENS pages, crashing of servers, some activities or resources can be viewed only at desktop or laptop, unsaved answer during quizzes or exams, not enough training how to use tools efficiently, and difficulty logging in. Number 7 is the unreliable scoring system. Number 8 is the difficulty submitting assignment. And most of the faculty's perceived issues are crashing of servers, inputting quizzes exam is tedious, and the maximum upload size is limited to 128 MB, and for bigger files cannot be uploaded. Slow time required to clear reload materials. And next one, for the limitation and conclusion of the study. But before, the study showed that there was no significant difference in the effectiveness of LENS in terms of functionality and collaborative tools when grouped according to respondents' profile variables, specifically their age, sex, year level, and enrollment status, device used to access LENS, type of internet access subscription they have, and the amount of time they had spent using LENS. And furthermore, the study showed that there was a significant difference in the effectiveness of LENS in terms of students' learning attitude when grouped according to their age. However, the study found that there was no significant difference when grouped according to their sex, year level, enrollment status, device used to access LENS, the type of internet access subscription they have, and amount of the time they had spent using LENS. Finally, the study showed that there was a significant difference in the rank issues perceived by the student respondents when grouped according to their age and the type of the internet access subscription they have. However, the study found that there was no significant difference when grouped according to their sex, year level, enrollment status, device used to access LENS, and amount of the time they had spent using LENS. Next one, please. So for the limitation and conclusion, the study, like other studies of similar nature, had limitations. This research did not include another group of LENS users, the course administrators. This also lacked the measurement of effectiveness among faculty of instruction. Since the faculty has a crucial role in the content delivery of quality education, it is paramount to examine the faculty's perception of LENS with regards to its effectiveness. Secondly, the findings of this research had limitation in terms of generalizability to the whole of CSU population, considering the data were collected from a single college department of limited size. It should be noted that the researchers did not have the control of ascertaining the respondents' knowledge of their own general weighted average, an indicator of students' achievement which can reflect as a measurement of student knowledge acquisition. Next, please. And based on the findings of the study, the main conclusions are as follows. At number one, the initial findings from evaluations of the effectiveness of LENS in terms of functionality and collaborative tools as a mode of delivery of education indicate that the students appreciated the LENS interfaces and tools and LENS-based activities. And number two, the students showed positive learning attitude toward LENS-based learning, appreciating the opportunities for collaborative works and self-assessment activities. And for the number three, the researchers believe that the further practice of LENS-based activities which are relevant to the course of the students. The recommendation part. Number one, HEI should develop strategic plans and provide guidelines concerning the utilization of learning management system to ensure critical success for the sustainable deployment and maintenance of learning management system among CUCs. And the number two, the provision of technical support is crucial in ensuring ongoing learner engagement in learning management system. Thus, it is paramount to pool an effective professional technical staff in order to maintain learning and smooth interfaces of learning management system. In light with this, in the event that learners or instructor face any difficulty, quick support should be provided to avoid user disruption. It's also recommended for CSU administration to upgrade their system memory so as to avoid frequent occurrence of LENS technical issues such as crashing of servers. And number three, the last, future studies should expand the sample size by recruiting participants from different college departments of CSU. And number two, it should also be noted to rely on objective data sources such as the usage patterns as reflected in the LENS systems logs to effectively measure the effectiveness of the system. And number three, the application of technology acceptance model in the utilization of survey questionnaire is suggested. And number 4, it is also paramount to take into account the inclusion of group of course administrators respondents to further give reflection on the issues of lens they first-handedly experience. And lastly, in order to determine the level of engagement of lens users, it is recommended to evaluate the most and least frequently used functionality and collaborative tools of lens among the respondents. With that, we are ready to hear for the recommendation and suggestions for the panelists. Thank you for listening.
Thank you, Group 4A. We now hear the comments and suggestions of Ma'am Jen for your group. Ma'am
Best
Jen?
friend. Doon lang sa research design nila, best friend, no? Descriptive inferential? Talaga?
Yes po, ma'am.
Pakibalik mo nga doon sa ano niya, anak. Pakibalik mo doon sa research question niyo, dear. This siguro based sa pagkakaano ko anak, no, this is more of descriptive comparative na ano kasi you try to look into the differences on the perceived effectiveness of lens online platform when grouped according to their profile variables. No, so this is more of descriptive comparative yung research design. Sige anak, So nagkaroon, hello, can you hear me darling? Tanggal pala yung ano ko. Okay, sige. So, sige anak. Sige. How did you determine anak yung effectiveness niya? When you say somewhat effective, what do we mean by that? Kasi overall in terms of the effectiveness of lens on an online platform, kasi may mga categories to, di ba? In terms of functionality and collaborative tools, what do you mean by somewhat effective?
Ma'am, bale, for Likert scale po kasi yan. Tapos yung it indicates na very effective. Tapos yung 3, somewhat effective. Tapos yung 2, somewhat ineffective. Tapos yung 1 po is very ineffective po, ma'am.
How is ito kasi yung isa sa mga challenges pag gumagamit ng Likert scale anak, no, lalo na kapag siya ay in-split mo siya into different sections at hindi siya yung split into different variables, parang ganon. So how is somewhat effective different from very effective?
Ay, ma'am, I'm under the impression po kasi na parang kung i-hierarchy mo po sila is parang mas mataas po yung very effective in comparison sa somewhat effective po, ma'am.
Oh, see. Specifically, parang ganun anak, parang may ano kasi siya, parang when you say somewhat effective, ibig sabihin, parang ano ba yung character pag sinabi nating somewhat effective? Are you getting it?
Yes po, ma'am.
O parang ano ba, how is somewhat effective different sa very effective in terms of parang yung overall na character niya, parang ganun. So yung siguro yung for example, I am a senior RT student, tapos the other student is at junior RT student, how do they differ apart from the hierarchy? Ang junior student ay third year, ang senior student ay fourth year. Parang ganun ba? Parang may specific definition na exclusive para doon sa ano, in order for us to see the differences. Okay? Kasi we need to give meaning on the scale that you have made. Pero aminado tayo dito, no? Isa ito sa mga ang pangalan nito, isa ito sa challenge talaga pag gumagamit tayo ng scale, ng Likert scale na ini-split. Kasi yung fine line between the level of effectiveness dun sa attribute na ginagamit natin, yan yung extra challenge kung paano mo i-differentiate yung somewhat effective sa very effective. Apart from by ranking, syempre very effective is far better than the somewhat effective. But in what way? Na ano mo ba, Nak? Parang ganun lang yung ano ko, yung isa sa mga nakikita ko dito, no? And then, sige darling, bababa mo, Nak. Kagaya din dun sa general comment ko din dun sa kabila, since this is talking about effectiveness of lens as online in terms of learning attitude, okay lang kaya that the verbal interpretation will be interpreted in terms of effectiveness kasi yun naman yung variable na inaaral natin. Parang ganun. So instead of we just merely settle with strongly agree, strongly disagree, mga ganyan, pwede kaya, convertible kaya yan into describing the effectiveness. Parang ganun. Instead of just settling with the verbal interpretation. Sige. So far sa akin, anak, yun lang yung general comment ko dyan, darling, no? So, I'll get back to you once na meron akong maano ulit, no? Kasi tingnan ko pa yung doon sa baba na part. Okay? Sige. So, Ma'am Jinky, yun lang po. Pero congratulations sa mga batang nag-conduct ng study na ito kasi magiging malaki ang utilization nito kasi nga parang wala pang conducted research to assess the effectiveness ng paggamit natin ng LETS, especially sa atin mga students na nakaka-relate, sometimes nagbabag down siya. So maybe key points for improvement on the side kung paano pa ma-improve yung services na ino-offer through LENS. Okay? So thank you so much po.
Thank you so much, best friend. Sir Julius, you're back. Ang hirap i-assess ng effectiveness, ano?
Oo, kaya nga. Oo, totoo. Totoo.
Actually, I have a problem here because on my bias as an administrator and as a faculty, I have some issues on number 9. I feel I learned more about lens and we talk about disagree. Disagree ang sagot, no? But dear students, that is what I would want to correct, naintindihan dito sa paper natin, no? And the way I would like to correct is that you bring back to the title and then I think I have to input some in the introduction so that I will definitely help you in balancing the score sheets relative to the lens. Why am I having this as a dilemma, no? I visited several of schools, as an administrator and as a creditor. And you know one thing that I figured out? CSU is far advanced as compared to other universities. ISU, for example, does not have an account like this. They don't have a lens account. Whatever the teacher wants to utilize, they have the freedom. They don't have such a common platform. Second, when you go to private universities, well, some has, what they have is the free version, of which you can't do anything except, to just be contented or become satisfied with what a free version can allow. But CSU actually has paid in so much of money just so we will be able to acquire lens, train everyone about lens, and eventually optimize the use of lens. In a world where there's pandemic really, there's such a thing as adjustments. I'll give you one. You know the CSU hymn, the first time that I actually have heard of it, it was not good, to be honest. But today, if I hear it and I synthesize about the lyrics, I love it better than the former. You see? Parang ganun, no? In the parlance of education, because I also am a philosopher in the field of education, in science education, sometimes, no, we are trying to be resistant about new things. And then only to find out that these are the better ones. That is why, when I was an accreditor, I thought CSU is the best. But when I came out of CSU, I realized there are more institutions which are best. I thought living in the Philippines is best. But when I went to other countries, I made it a point to realize what are still in other countries that we haven't seen here. In other words, your eyes were just focused, okay, on CSU lens, of which there was not a benchmark that you have done in literatures. See, that is what I want to see in the introduction. Go back, not unlike the other groups where I just have had focus on the main problem, right? You go back to your title, and I'd like to see the introduction so that I will make a lot of input so as to balance the score sheets, as I've said. So the title is Effectiveness of Lens. Well, hello. As an online platform, the case of CSU RT department. Okay. So now the title is, in fact, Lens is an online platform. It's redundant, correct? Lens is learning environment network system, right? Okay. So effectiveness of learning environment network system of CSU as a tool for instruction. Ganun siya. Intindihan? Hindi siya, kasi yung lens na yan, it in itself is online. So, as a tool for instruction. Okay? Tapos, ilagay nyo dyan, hindi yan the case of CSU RT, effectiveness of learning environment network system as a tool for online instruction, as a tool for instruction. As a tool for, sige, pwede rin, as a tool for online instruction, actually, ma'am, hindi rin effectiveness, assessment. Correct? Assessment. Tanggalin natin yung effectiveness kasi magiging bias tayo.
Direct, yun yung
assessment. Assessment lang ito. Assessment, no? Among, ganun na lang, not the case of CSU RT department, among CSU RT students. Okay na tayo? CSU RT students. So it should be, let's change the entire of the title. Okay, assessment of the learning environment network system, close open parenthesis lens, as an instructional platform during the pandemic. During the pandemic, among CSU RT students. Okay? So yun yung bago nating title. Naintindihan ko yan. Sino nag-present kanina? I think you'd rather become a mascom than an RT. Sorry. Joke lang. Mr. Corpus. Anyway, that would be the title. Okay, so get into the introduction. Okay lang, Mr. Collado, Miss Castillo, and the rest. There are two Castillos here. Are you twins? No one is answering, I wonder.
Oh, dear.
You are just but
surname lang ata.
Nagkataon lang po direct na parehas po.
Castillo. Okay. So anyway, what I would like to strengthen in the background, katulad ng sinabi ko kanina is, CSU has an online management system for instruction unlike any other state university in colleges in Region 2. That is a fact. No, I asked my friends about it, and I must say this is a fact. Tayo lang ang meron yan, no? Tanggalin yung leeg ko ngayon kung may ginagamit ang ISU, Batanes State, Quirino State, wala. Naintindihan? Just imagine, you have to be thankful.
Laila direct from Batanes yan.
No, di ba? Wala silang ganito, di ba, ma'am? Kung Fu, kung Zoom, bahala ka na. Kung si Ma'am Lily, agtitipon, ngayon, Zoom, bukas, Google Classroom, next, Jitsi. In other words, mawang alipo na estudyante. No? They have all the apps in their in their laptop or in their mobile phones because they don't know what the teacher will use. Imagine. Okay? So kung kayo hirap, di lalo naman na sila. Okay? And then, ilagay nyo kung kailan natin ginamit yung lens. Kasi sa background of the study, there are 4 elements. I would wish to go back to my basic lectures. What are the basic elements? Number 1, known. So during the offshoot of the pandemic, we didn't have any other recourse except to shift to online platform. Lens was given birth. I think that was like first semester, some 2 years ago, right? Correct? And there were like trainings both of faculty, lens administrators in the colleges, and subsequently students, right? Okay. And then, what is lens as an instructional platform? You just have ito ba ay hango sa design ng ganyan o gano'n, no? Na it is, ilagay nyo din dyan na binabayaran din ng eskwela, parang ganun. Okay? So lens ang bida, no? Get. So what do we know and what do we have to tell the public about lens? Facts. Naintindihan? Known. Are you with me? Then from there, you have to reiterate that even RT students, were actually were made to subscribe about lens as an online platform where exams, modules are uploaded, and all other things that you do with that. Now, the second element would be the unknown. Doon na kayo papasok. I love what Ma'am Jen was like telling kanina, not of a research was done to assess lens. Correct? Significantly, this is the first research to assess the implementation of lens in the RT department of Cagayan State University. Wala gaps lahat, unknown lahat yan. Naintindihan? Wala pang ganyan. In fact, there is no literature that talks about how effective lens is as an instructional tool during the COVID pandemic. So lahat yan ilagay mo sa second element ng introduction, which is the gap. Third is the most important. The second element is the unknown. Third is the most important, which is the gap. When you talk about the gap, what are the reasons why we need to do this study? Yung tipong iiyak na ako. Kasi pag hindi natin i-assess yung lens, hindi natin alam kung paano i-improve yung instructional platform, yung lens mismo, or there are other issues that needs to be addressed, correct? From among faculty and students as to how we are going to make use of lens. Before you know it, baka naman there's more of lens that we haven't discovered or we refused using. Correct? To tell you honestly, as a teacher ako, I learned lens, on attending one of the briefing, but all other parts of the lens, I discovered it my own. Parang ganun lang nangyari, So parang, yun yung sinasabi ko na pag hindi natin in-analyze ito, kung hindi natin alam kung effective siya or hindi effective, paano natin i-address? Hindi pwedeng tanggalin mo ang lens. Ang sinasabi ko, hindi natin pwedeng i-recommend na tanggalin ang lens kasi nga, tayo lang ang may ganito, tayo lang nga ang nagbigay ng ng fund kahit wala tayong Unifast, kasi nakatulong talaga yung lens as compared to the other schools na talagang nangangapa hanggang ngayon kasi hindi kaya nilang bumili ng ganitong platform. Okay, so paano natin siya i-improve? Parang ganun. Second, whether you like it or not, after pandemic, this pandemic, we cannot get back to full face-to-face operation. That is one thing I am sure. There would always be like limited face-to-face. And what would be limited? The laboratory. But as to the lecture, we will be online. We will never get back to online na pagtuturo to, hindi na. Skills na lang. Yung mga lab-based, doon tayo babalik. Naranasan nating mag-online, pwede pala. The strength of lens is that you can invite some pool of like foreign researchers, foreign instructors, naintindihan? And then they can join us. They can be resource speakers. Right? Mga ganon. Ibalansehin nyo yung kwento, naintindihan? Kung paano natin, for example, ang makita ko dyan, paano natin ma-optimize pa yung lens. Kasi whether you like it or not, there are pros and cons. No? Katulad ng sinasabi ko kanina, kaya na nating mag-cross borders. The world is flat relative to information, relative to resource speakers coming in, naintindihan? Or sharing of resources, and a whole lot. So pwedeng ganyan yung sa background of the study. And the last one is, what do you want to do in this research? No? Which is to assess lens as a instructional tool. So I hope that you guys will have to improve on your backgrounder. Okay? Just to make everything balance in terms of discussions. Okay? Naintindihan? Right here in your background, the way I appraise it now, kapos ang known, walang unknown, yung gaps, wala din, naintindihan? And that's why I would recommend you change the background. Okay, next. Sige na, dun sa introduction, dun sa statement of the problem. Okay. Now, you are going to assess, wait lang guys, wait lang. Hirap naman ng ganito. Okay, so profile of artist. Can you talk about profile of artist student? Ang ingay, wait lang. So when you talk about the profile of artist students kasi, imagine that all students are actually innately different from the rest. You don't only should profile them according to, for example, your demographic. Your demographic talks about your age, your sex. Instead of gender, you place sex. Year level, what else? Your enrollment status. But I think what you also need to, what you should have had profile sana would be yung kanilang perceived level of effectiveness kapag online yung pinag-uusapan. Anong tawag mo doon? There is such thing as that no? Yung kanilang proficiency level sa computer, how do they perceive their status to be? Kasi isa ding factor yan. Naintindihan? Yung iba na techie, magaling talaga sa computer, walang problema yung lens. Pero yung walang interest sa mga ganyan, problema mo din yan. Okay? In fact, you should have described about their economic status. Talagang may problema ang bata sa lens kung siya ay poor. Correct? Bakit? No? Kasi syempre, pag lens, kailangan mo ng mag-load. Naintindihan? Kailangan mo ng, how do you call it? Ng data. Right? Okay yes, na? So dapat inaral mo din kung ito ba ay issue ng mga poor or issue ng rich and poor. Yan. Ito ba ay issue ng mga mag-techie sa computer or both? Ganon. Yan yung mga dapat dinabas natin. Another is, tignan nyo kung saan siya galing, yung kanyang, how do you call it? Yung background niya as to yung nung high school siya. Kasi merong mga schools, naintindihan, na may mga computer subjects na madami, may mga schools na hindi. Example, gawin ko ng example, St. Louis. Kapag science strand ka, marami kang subject, advanced yung mga subject. Pag regular strand ka, hindi masyado. Okay, kasi katulad ko noon, no, I think alam din ni Ma'am Jenny yan kasi nagturo yan sa St. Louis. May pagkakaiba ang regular. Kahit diyan sa Cagayan High, di ba? Iba yung pang-cluster nila sa gold,
Science
silver,
section.
tapos
Opo.
regular, di ba? Ganon.
Regular
Correct?
section. Opo, direct. Opo.
Ayun, may mga ganong eksena bardang kasi kung tutuusin, ang pag-profile natin sa RT student, hindi yan katulad ng medtech. Nasa medtech mga anak, talagang top of the class talaga makukuha mo kasi nga ang daming nagpa-qualify, kokonti lang yung nase-select. Sa RT hindi ganyan ang status. Believe it or not, kasi ako ay dean, alam ko ang profile ng mga estudyante sa RT. Alam ko ang pagkakaiba nyo sa profile sa mga estudyante sa medtech. At alam ko din pagkakaiba nyo sa profile sa mga estudyante natin sa public health. So parang ganun sana. Saan siya nanggaling? Naintindihan? Sa isang science ba? Or dito sa regular ganon na section? Kasi may pagkakaiba talaga sa mga subjects yan. Okay? Maganda rin naman yung sinasabi mong technological resource. Technological resource would be nagla-laptop ba siya, iPad pa siya, tawag dito, cellphone lang ba ang gamit niya? Naintindihan? In fact, nakalimutan mo pang sabihin, nasaan yung kanyang source ng connectivity? In-assess mo ba? Kung yan ay communal Wi-Fi, kung yan ay packet Wi-Fi, kung yan ay kunwari yung RBC na may Wi-Fi, kung PLDT, mga ganyan. Nasaan yan? Sa technological resource?
Yes po din. Dalawa lang po siya. Either prepaid mobile data and...
saan yung gamit niya? Yung gadget na gamit niya?
Meron po din.
Saan yun? Saan siya nagpo-fall?
Technological resources to access lens din po.
So paano yung technological resources mo? Ano yung mga questions yan? Anong parameters dyan? Gadgets used, tapos?
Yes po. Device use, time spent na yung amount of time na ginugugol nila sa pag-access ng lens. Tapos po yung type ng internet access nila, either prepaid mobile data ba or postpaid Wi-Fi subscription po.
So I think it should have been it should not fall under yan. Ito na yung sinasabi ko. Siguro number 1 is the socio-demographic, Ma'am Jinky. Yung socio-demographic niya, kunin mo ang A hanggang sa academic standing. Tapos yung letter F niya should be connectivity status or connectivity profile in terms of connectivity. Online connectivity. Or kung technological resources naman, profile in terms of technological resources, sige, pwede din yung ABC na sinasabi niya. So dalawa dapat yan.
Sa akin, direct, sineparate ko to kasi kamukha siya nung isang study na ginagawa. Nakaseparate yung demographic, economic, tsaka yung education profile. Andun yung education sources niya, yung kung anong devices ang ginagamit niya, tsaka kung anong source of internet niya. And then, andyan kasi yung GWA din nila eh. I think kinuha din itong group na to.
Yes,
Pero I
ma'am.
don't see a GWA here. Where's the GWA?
It's under academic standing po din.
Okay, that's make us really confused because when you talk about profile, it should be succinct. Succinct. So, example, i-cluster mo together yung biodemographics niya, yung academic status niya, naintindihan? Yung connectivity status, mga ganyan. Dapat nandyan yan nandito na yan. Kasi in other words, marami palang nakapaloob sa academic standing, marami ring nakapaloob pagdating sa technological resources. So gawin mo yung letter A, ganon, no? Letter A yung socio-demographic niya na lang siguro, letter B yung economic niya kung inaral niya, letter C would be the academic standing, letter D would be ganun lang. So under ABCD, merong mga 1, 2, 3 pa. Okay na tayo, dear students? Kasi ang dami palang magagandang profile variables pero hindi ko ma-appreciate dito sa objectives nyo kasi kaya nga tinawag na specific objectives, no? Saan natin i-clip ang mga yan? Pwede mo lang hindi pakita yan sa paradigm ng study mo. Kasi the objectives will come, no? After we are going to discuss the paradigm. Mauna muna yung objectives. So pag klaro na yung sa objectives, sa paradigm, kahit yung 4 na lang na variables or 5. Okay na? Yung profile natin, naintindihan ba? Tapos, yung mga wala dun sa hindi nyo pre-profile, ilagay nyo na lang siguro sa recommendations later on. Kasi para sa akin, importante talaga yon. Okay? Another would talk about yung perception nila, no? Yung functionality, saan nyo kinuha yung questionnaire dito? Functionality and collaborative tools, knowledge acquisition, tas learning attitude?
Dean, first, dito po sa knowledge acquisition, yung ginawa po naming indicator dito sana is yung jiwa po. Kaso lang, hindi po kasi yung mga ibang students po kasi is hindi nila alam yung mga jiwa po nila.
Hindi, ang tanong ko, simple lang naman, saan nyo kinuha yung questionnaire para sa number 2?
JD.
Ginawa nyo?
Yes, hindi po din. Inadapt po namin yun.
Saan?
JD, open mo nga yung chapter 3 natin.
Hindi na, wag yung chapter 3. Ilagay mo ako doon sa tools. Doon sa data gathering tool. Bring me to number 2. Table 2 siguro yan. Ano yan? Nandun, oh. Pati yung mga tables nyo, hindi ganyan. Kunwari, table 1, profile variable yun, di ba? So, lahat ng mga patungkol sa profile variable, table 1 pa rin siya. Table 1.1, table 1.2, table 1. Parang dito, ang dami-dami mong tables. Some of the tables are just but in support of a major table. Hindi yan. Kailangan ko doon sa isa. Doon sa table na, ano na yun, ma'am? Yung, sige, baba mo pa. Iba yan. So, itong mga to hindi ganyan. Yan, ito ata. Ito
Yes.
ba yung table? Collaborative tools.
Yes po, yan po yung mga features sa lens po.
Hindi, balik mo doon. Ibalik mo doon. Tingnan natin kung tama siya. Hindi, ibalik mo doon sa kanina, yung sa table kanina.
Sige pa, Atina. Yan po.
Yan. Ito na, di ba?
Yes po.
Functionality. Progress view. Accessing view. Receiving notifications. Tira mo baka naman functionality lang yan. Ano yung collaborative tools? Tignan mo yung step natin. Effectiveness as an online platform in terms of collaborative tools?
Papasok po kasi dyan yung number 8 po din sa participating in forum discussions po.
Number 8 lang?
Also sa submitting assignments, meron po kasi yung by group na assignments po na pinapasa.
So I think functionality lang talaga ito. And part and parcel of your indicator of faculty is it's being assistive of collaborative activities. Tama ba? Kasi functionality is too generic as a indicator, and collaborative tools, no, is another, no, which may be interpreted as forming part only of functionality. Am I right?
Yes po, Dean.
So, wag na yung collaborative tools. You have to discuss in your definition of terms that forming criteria to assess functionality is it being assistive, no, in collaborative activities. Okay? Gets nyo na? Kasi
Yes,
tignan mo yung frame niya mismo iba, no? Parang effectiveness of Lens as an online platform in terms of functionality. That is number 1. Number 2 is effectiveness of Lens as an online platform in terms of collaborative tools. Wrong. Naintindihan? Okay na? Wrong na siya. Naintindihan? Kasi you make use of a conjunction which is and. Not unless functionality and collaborative tools are to be taken together, which I surmise is not. Magkaibang bagay yan, correct? Or you might as well determine which of these do you think are measures of functionality and which are the measures for collaborative tools, which is harder to do than just but omitting collaborative tools there and having it defined as a measure of functionality, right?
Yes po.
Now, in the discussions here, Mr. Corpus, no, you have to determine that yung ating scale na ginamit ay 5, tama ba? Or 4?
4 po.
Okay, how did you interpret yung 4? Very effective, somewhat effective, tapos
Ineffective. Somewhat ineffective yung 3 po. Tapos yung ay 2. Tapos yung 1 is very ineffective.
so in other words, it still is good. In terms of functionality, correct? Mr. Corpus? It's effective. Correct? Okay. Now, since it is, tignan mo yung discussions mo kanina. So, generally, table 7, which should be table 2, table 2.1 ito. Correct? Did you get that, Corpus? This is table 2.1, no? Generally, in terms of Lens as a platform, it is considered functional, no? The categorical mean is 3.16 with a verbal interpretation of somewhat effective. This goes to show that bakit siya somewhat effective. Good pa rin siya. Okay na? Bakit siya effective? Sige nga, Corpus, bakit siya effective? Naririnig ko kasi yung mga pinagsasabi mo kanina na parang hindi na halos going to the hindi siya effective. Correct? Nakikita mo ngayon dito na since ginamit mo ang 4-point Likert scale, effective siya. Hindi talaga siya ganun ka-effective. Which is your table 8. Next, please. Okay, so here, effectiveness in terms of learning attitude. Okay, ito yung problema natin, Ma'am Jinky. Bakit? Iba yung measure or iba yung interpretation ng kanilang effectiveness for table 7 sa table 8 sa table 9. I mean like, kanina, very effective. Di ba 4 yon, Mr. Corpus, sabi mo? Di ba?
Opo.
Oh. Di ba, yung effectiveness ang mineasure natin sa functionality.
Opo.
Ito, effectiveness rin in terms of learning attitude. Correct?
Opo. Opo.
So dapat ganun din. Di ba, effective ba siya or hindi siya effective? 4 din. So when you say anak, it is strongly agree, would that mean it is, ano yung measure mo, yung pinakamataas mo kanina? Would
Very
that
effective
very
po.
effective? Tama ba
Opo.
yun? So,
Opo.
ang magiging interpretation nito, hindi kasi verbal interpretation, ang tawag dyan anak, descriptive value, o descriptive value lang yan. Mean, descriptive value, tapos interpretation. Gets? Yung descriptive value mo is strongly agree, disagree, agree, ganon. Pero yung interpretation mo is, yun pa din yung kanina, effective at channeling. Gets? So, ang categorical mean dito ay agree. Meaning somewhat ano na yung kanina? Yung kanina. How did we had it? Yung effectiveness niya?
Somewhat effective.
Somewhat effective po.
So meaning sa statement ito somewhat effective
Somewhat
pa rin.
effective po.
Itong table 8 mo, which is supposed to be table 2.2, is somewhat effective pa rin. Meaning effective pa rin siya. Correct? Gets. Nakikita mo na, except for item number 9, correct? Where students feel that they learn so much from lens, right? And for number 2, of which they feel they prefer to learn through lens rather than, yun lang. May problema ka dyan sa number 2 and number 9. You look at number 2. I prefer to learn through lens rather than the traditional face-to-face. I feel I learn more in lens. I prefer to learn in lens. I feel I learn. Okay. So, except for number 2 and number 9. Correct? So, if that's the case, you have to discuss why they feel that mali kasi ma'am. Balik ka nga dun sa original table 7. Things sabi ko sa tools eh. The tools should be perfected kasi before you start with data gathering, because you see, you look at your statements for number 7. In terms of functionality, they were assessed using a third-person statement. Correct? Na anak, kama ba? Corpus. Am I right? Naintindihan?
Opo.
Pumunta ka dun sa susunod, sa number 8. Laging first. Sige, number 8. Table 8. I-translate nyo nga lahat ito. Look at number 1. It is in third person, correct? The materials uploaded are relevant and appropriate. How come for item number 2 until 10, it became already I? Naintindihan?
Opo.
Palitan, wrong. Naintindihan? So, for example, there's a preference to learn through lens rather than traditional face-to-face. You look at number 3 and 4, they are on the third person, correct? Tapos biglang 5 to 10, iba na naman, naging I na naman siya, right?
Opo.
Yes? Okay, so the way it should be interpreted is, what is the categorical mean? And then you have to interpret. And then you look at significant findings. That would be statement number 2 and statement number 9. You discuss that elaboratively. Okay, gets. Another thing that you have to discuss is number 1. That's the trend of the discussion. Okay? Naintindihan? Yun lang ang kailangan kong malaman dyan. Okay na tayo? Number 2 and 9, and then number 1. Naiintindihan niyo ba ako?
Yes po, Dean.
Okay, next. Table 9, which is supposed to be table 2.3. What is this? This is table. No. There are 3 indicators for your effectiveness. Di ba? without moving your objectives, kindly read, without moving your slides, kindly read objective number 2. How many were measures of effectiveness? I saw 3.
Functionality and collaborative tools, knowledge
That's number
acquisition.
1. Knowledge acquisition is number 2. And what is number 3?
Yung learning attitude po.
Where is number 2?
Yung sa knowledge acquisition din, hindi po namin yun na-include po. Nasa limitations po yun.
Hindi siya magparang doon sa objectives kung wala naman pala. Naintindihan?
Yes po.
Oh, so dalawa lang yung measures natin for effectiveness, right? Kaya meron kang table 7 and 8 which are supposed to be table 2.1 and table 2.2. Correct?
Yes po, dalawa lang po.
Okay, so i-discuss na tapos ang table 2.3 mo doon ay yung categorical mean together to compute for the weighted mean. Pag kinompute mo yung weighted mean, anong sagot? Bakit ganon? Bakit mas mataas yung effectiveness in terms of knowledge, blah, blah, rather than yung pangalawa? Correct? Tama ba?
Yung functionality and collaborative tools
Mas mataas.
Sa learning attitude.
Correct. Okay. Yun yung table 2.3. Gets mo ba? Sa table 2.3, you talk of the weighted mean. Iko-compare mo dyan yung categorical mean ng 2.1 versus the categorical mean of 2.2, right?
I mean difference po ang hindi to din.
Mother Jinky, parang ba ayan ang sinasabi ko kasi, okay, yung objectives mo, di ba, objective 2 mo, measure of effectiveness. Dalawang parameters mo, kaya 2.1 is effectiveness on functionality, correct? Table 2.2, measure of effectiveness on attitudinal blah blah, correct?
Yes po.
Table 2.3 is you're going to compare the categorical mean to come up with the weighted mean. Correct? So in table 2.3, you're going to interpret the weighted mean first, where will it fall, and you have also to discuss why the functionality why the effectiveness in terms of functionality is perceived is higher than the functionality in terms of the attitudinal blah blah. That is table 2.3. Did you get that?
Yes, Podi.
Because you left them not compared, and they should be compared. Okay?
Yes po, since
so that you will get the strength of lens. Nakita nyo na kung bakit pangit yung pagka-discuss ng findings kasi nga nag-concentrate lang talaga kayo doon sa isang category tapos hindi nyo naman tinake into consideration the entirety na intindihan ng kanyang effectiveness. So table 3 would be issues. How did you do the issues? Again, mean. Mean? Was it, ang problema ko sa issues nyo anak ay, was it multiple answers?
Hindi po din. Bale, nag-rank po sila. Sa 3 is most experience, tapos yung 2, moderately experienced, tapos yung 1, least experience na issue na encounter po nila din. For example po, sa some activities or resources can be viewed only on a desktop or laptop. Pumili po sila din kung most experienced ba to sa kanila or moderate ba or least. Ganun.
So the way they experience, no?
Yes po.
For example,
parang ganun.
For example, unable to download uploaded materials. So probably most of them answered 2. Kasi they sometimes experience. The moderate there kasi is a problem. When you talk about frequency of it being experienced, no? Commonly experienced, sometimes experienced, not experienced. Kuna na kumaa. Correct?
Yes po.
Gets mo na. Tatlong order ang hierarchy mo. Di ba? Commonly experienced or frequently experienced, no? Sometimes experienced, not experienced. Paki-change yung verbal interpretation. Correct? Naintindihan?
Yes po.
Okay. So yung least experience, no? Not commonly experienced. Na yan. Sa interpretation mo.
Pwede din pong rarely experienced din.
Paano mo nga kapag hindi niya, pwede rin, rarely experienced. So magiging ano natin doon ay frequently experienced, sometimes experienced, and rarely experienced. O mas maganda pa. Okay na?
Yes po.
Okay. So ang categorical mean nito ay sometimes experienced. Bakit? Ano yung mga rason? Bakit kaya nagkakaganon? Tapos in terms of the statements, ano yung mga pangit na result? Ano yung pangit? In other words, ito yung lagi nilang na-experience. For example, number 3, number 6, right? Yan yung mauuna. Tama? Huwag mo nang i-discuss yung least experience. Kasi yung least experience, ibig sabihin, walang problema dyan. Yung rare experience mo, hindi nila problema yan. Correct? Pero ang pinaka-problema dito ay yung commonly na experience nila. Which brings you to discuss more of number 6 and number 3. Number 3. Number 2. Kasi number 3. Number 4. Kung wala naman. Kasi tignan mo naman yung line mo
Hindi magkapantay, anak.
Correct. Kaya pati ako nalulukring. Sabi niya, laptop ko na 1.5. Ano yan? Ibaba mo din. Gets mo na? Kaya pati ako, ano yan? Gets mo na? Kaya pati ako, ano yun? Okay? Ibaba. Gets mo na? Hoy.
Opo din. 4 and 7 po.
Corpus, gusto mong ibitin kita dun sa puno? Yung 1.5 is supposed to be for unable to download uploaded materials, right? Am I right?
Yes po.
Opo.
Oo, kita. So anong problema dyan? Yung mostly experience would be 1, 2, 3, 4. Item
4
number
and 7
4.
po.
Yung slow loading of lens pages. Right?
Opo.
Okay, and then the other one is?
Crashing of servers pa ata yun.
Wala namang crash. Crashing. 1. Hindi, pang-anim. Hindi yan 10, 9, 8, 7. 7, crashing. So bakit na naman yun yung problema niya? Correct? I-discuss mo din kung bakit may problema dun sa moderately experienced na medyo matataas. For example, alin sa moderately experience? Moderately sometimes di ba? Anong matataas diyan? That is 2.28, 1.98, 1.90. Yang tatlo lang. Gets?
Opo.
Yun, i-discuss mo yan. Yung iba, wag mo nang i-discuss. Discuss mo yan isa-isa. Okay na. Corpus.
Opo din.
Okay, next. Table 10. Table 10 which is supposed to be teachers na ba to? O faculty? Okay, this should be table 3.2. Right? Hi, 3.2. And when you say the categorical mean is 1.68, the descriptive value would be sometimes experience. So it's, di ba? Sometimes. Right? Naintindihan?
Yes po.
Okay. And what are the problematic parts? You all the moderately experienced. So number 1, number 2, number 4, and number 6. You don't discuss about lists experience because that's not an issue. Did you get that?
Yes po.
Okay na. Nakita nyo na? Kasi I believe you can do it right. No? Ang ganda-ganda nung pagdi-discuss lang kanina. Pero sabi ko nga, are really those the things which I want to see in the paper? Mukhang hindi. Okay, sige. Kaya na. So ang number 1 dyan is categorical mean. Tapos, after categorical mean that you are going to interpret, bumalik ka na doon sa contents ng table kung saan yun yung talagang problema nila. Okay na. Now, your table 3.3 is a comparison for the perception of the students and the faculty. Naintindihan? Categorical mean lang. Alin ang mas mataas ang mean? Yung students o yung faculty? Mr. Corpus, 1.68 ang faculty. Yung students kanina, anong categorical mean niya?
2.20 po.
O, anong ibig sabihin nun? Mas walang nagiging problema ang students kesa dun sa faculty. Tama ba? Di ba? While both are moderate, no, in term, while both no have sometimes experiencing issues on the online platform, naintindihan, mas mataas yung mas mataas yung degree ng issue ng faculty kesa sa students. Ay hindi. Mas mataas yung degree ng issues ng students. Tama ba? Tama, kasi least experience is mababa, di ba? Mas maraming issues ang students kesa sa faculty. Am I right? Kasi yung 1.68 sa faculty, that's nearly sinasabi niyang least experience or wala siyang problema. Tama ba? Okay. So, ganun. Meron kayong table, summary table. Kahit dadalawa lang yung categorical mean, kailangan makuha mo ang weighted mean, i-discuss mo bakit ganyan ang weighted mean, and where lies the difference, or you have to justify yung trend na nakikita nyo doon sa categorical means na na-sum together. So, you miss that in your paper. You understand? Di ba ang ganda na ng discussion? If I have to ask you, Mr. Corpus, why do you think na hindi masyadong problema ang length sa mga teachers as compared sa students?
Maybe po may proper training po yung mga teachers po kaysa sa mga students, since hindi madami po mga students na hindi po techy, ganun po.
You know, the very good observation, but I think you have to admit for yourself that we are mandated to make use of the tool. So whether we like it or not, naintindihan, ina-assess kami dyan Sa sunungin din, nag-upload ba kayo? Di ba? Tignan nga nasaan yung minomonitor din kaya kami dyan. Yung mga attendance namin. Di ba? Nagkakaroon tayo ng accomplishment report, Ma'am Jen. So whether we like it or not, talagang gagamitin namin yan.
Yes,
before we even start having sessions with you, dapat naka-upload na kami ng modules dyan, mga ganun.
Yes.
Expectation nila sa amin yan. Sa mga students kasi, hindi. Naintindihan? Kasi you look for students. We can actually have you submit all of your completed for at least a month kung kulang na pa. Naintindihan? Correct? Mga ganun. Yung hindi na kaya ng length, sa ganito na lang gawin. Kung na maraming sa inyo. Sa amin kasi, yun, i-discuss nyo yan. Importante yan. Other than the trainings we have, mandato kasi namin talagang ilagay siya dyan. No? Okay. And then, other than that, you have to consider na yung how do you call it? Yung aming mas stable ata kami. For example, anak, sa school, meron na kaming connectivity. Papasok lang kami para mag-conduct na lang. Wala kaming problemahin. Wala kaming problema sa connectivity. Hindi kami maglo-load. Naintindihan? Hindi kami, di ba, naiintindihan mo yung issue ko? Hindi katulad ng estudyante na problema nyo lahat yan. Sa amin, hindi namin problema. Kung wala kaming laptop, maraming desktop sa school. Maski pag ilabe mo, desktop nga na. Di ba? Ganun pang ginagawa natin. Iwi mo na yung desktop. Wala na pa. Yung desktop mo, pumasok ka, mag-connect ka sa wifi, wala kaming gagastusin. Ganun lang. Hindi sa inyo na ang dami-dami yung mga kailangan. Yun yung kwento na kailangan ko dito. Gets? Meron pa kayong succeeding tables, anak?
Meron po yung...
Sige nga, ibaba mo pa. Kasi, magaling yung group na to eh. Yun nga lang, kailangan kong tutukan ano yung ilalagay mo para maging bongga. No? Maging bongga itong papel. Sige, table 11. Ano naman ang sasagutin niyan? Move mo nga, anak. Wala namang sumak. Neneng. Athena, na-disable. Gayahin mo yung Athena sa Athena Park, walang kamay. Ano naman ito? Post-Hoc na siya. O yun. Sa Post-Hoc, sabi niya, in terms of effectiveness, no, vis-a-vis hindi mali yung table title mo. This is Post-Hoc, significant difference ng effectiveness when, ano yung other? Kasi pag sinabi mong statistics, you are going to marry two variables. The first variable is effectiveness of lens as an online platform in terms of functionality with that of the profile variable. Correct? So yung table mo, di ba? So kulang lang when dun sa profile variable. Tapos dun sa table 11, walang kinalaman. Alam mo yung ibig sabihin niyan? Walang kinalaman ang lens. Tag dito. Ano pa? Regardless of the profile variable, pare-pareho ang perception ng mga respondents sa effectiveness ng lens as an online platform. Walang pagkakaiba. Yun ang sinasabi niya. Gets mo na? Huwag mong i-discuss na age, sex, not significant, lahat. Ang sinasabi mo lang, table 11 shows that regardless of the profile variables, the respondents' rating on the effectiveness of lens as an online platform in terms of functionality are not different. So pare-pareho sila ng rating. So ang tanong ko, anak, anong rating nila? Effective siya o hindi?
Effective po.
Oh, yun. Sinasabi mo kanina hindi siya effective. Naintindihan? So generally, table 11 is saying it's effective, anak. Regardless of the profile of the student raters. In terms of lens as a platform, no? In terms of lens functionality, effective. Okay. Punta tayo sa table 12. Itong table 12 ang i-discuss mo. In terms of age is a significant kasi siya. In terms of age, sabi niya, they will tend to differ. The age ng students ito, no? The age of the student. Depending on the age of the students, no? They tend to differ in terms of assessing lens as an online platform in terms of learning attitude. Bakit? Anong sinasabi ng literature? Mas hirap ba yung mga bata, anak? Or mas hirap? Age kasi talks about younger and then di ba? Mas hirap yung first year kesa sa second and third year. Tama ba ako? Corpus?
Opo.
Bakit?
Opo. Siyempre po, in terms of discipline po, mas higher po yung mas matatanda kumpara sa mga bata. Yung tolerance
in terms of discipline, I think it has something to do about, number one, alam na kasi dati ng second and third year yan. Nakapag-adjust na sila. Correct?
Opo.
And of which case, mas maganda na yung attitude nila sa paggamit ng lens. Correct? Tama ba?
Opo.
Oh. Nasaan yan sa discussion mo? Gets mo lang yung table 12. Ganun palang ibig sabihin ng table 12. Yung matatanda, yung second, third year, least they complain about lens in terms of learning attitude kasi gamay na nila. Maganda na pag magpa-quiz si ma'am ngayon, mag-upload siya ngayon, alam na nila kung paano i-open, alam nila yung gagawin nila kasi yung first year, hala, kung isang sangitan na, paano ito? Kung kuna na mo, naintindihan? For example, nakalagay doon, 1 attempt, 2 attempts, kung hindi na alam kung magte-test na siya o hindi, baka wrong daw kung kuna na. Naintindihan? Yun yung age. Okay na, mas kaya na nung third year, fourth year, yung medyo mas matanda na. Gets? Yung upper class na kapag, kumbaga, accustomed na. Gets? So, is that your discussion for table 12? Huwag mo nang i-discuss yung not significant. Okay na, Mr. Corpus? Miss Cornejo, Miss Castillo, and another Miss Castillo. O, di ba ang dali-dali? Dami-dami mong sinasabi kanina. O, next table. Sabi ko kay Ma'am Jinky, wait lang ma'am, kakain muna kami ni Mami, tapos na kami kumain, hindi ka pa rin tapos mag-defend. Ano sinasabi niya? Okay, naintindihan. So, with that anak, no, gawin mo na yung summary of findings mo, overhaul your summary of findings based on my suggestions. Gets? Tama? Okay na?
Yes.
Hi. Kaya?
Kaya
The
po.
highlights of the discussion was those I told you a while back. Pumunta ka na sa conclusions. Tignan ko nga. Nakita mo ang conclusion natin, effective siya. Aping may tayik pala dayta. Bakit may limitations? Punta ka sa conclusion. Bakit ito palang nasasabi ko may limitations and conclusions. Conclusions lang ito. So anong conclusion natin? Conclusion. Next page. So anong conclusion natin? Ano yung conclusion niya? The conclusion answers the objective. So how do you assess lens? It is effective. So where is the effective there? Wala naman. So you revise your conclusion. Generally, lens for students and faculty are effective. Correct? And therefore, we have to continue using lens. That is the conclusion. Di ba, Ma'am Jen? Ma'am Jinky?
Yes po, Derek.
Did you understand, Corpus?
Opo.
The conclusion is as simple as that. Continue using lens. Okay na. It is effective. No? Okay. Look at recommendations. Okay. So recommendation number 1, no? Balik ka na doon sa kwan kanina. Just anak, ganito sa recommendation. Pagdating mo doon sa table 2.1 kanina, functionality in terms of ano na nga? Hindi, no, parang assessment in terms of functionality. Di ba may 3 areas doon or 4 na pangit ang result? Yun na yung lagyan mo ng recommendation. Doon, naintindihan, doon sa 2.2 mo, assessment in terms of yung attitude, di ba may 3 area na pangit? Lagyan mo yun ng recommendation. Right? Doon sa issues ng students, ilan yung issue niya kanina? 5? Lagyan mo yun ng recommendation. In fact, doon sa issue ng faculty, di ba nagka-crash kasama nung issue ng student, lagyan mo siya ng recommendation. Did you understand that? Corpus, Cornejo, and the 2 Castillos. So, ganun lang yung paggawa ng research. Ang dali, di ba? Okay na, Corpus, and Castillo, and Cornejo.
Opo, Direk.
Okay.
Yes, thank you.
So, before I proceed, Mr. Corpus, what is the conclusion? Lens is?
Effective.
And therefore?
Continue using.
And back, continue, di ba? But the recommendations, ano ang i-improve natin doon sa paggamit ng lens? That is the recommendation. Okay?
Opo.
Ma'am
Thank you
Jinky,
po.
tapos na ang pageant.
Thank you
And
so much.
yeah, Ma'am Jinky, there's a research competition in the university. You include this so long that gawin niya yung sinabi kong gawin niya yung sinabi kong modality. Yung mga corrections niya para maging bongga.
Yes, Direk. Yes po. They have time to do the recommendations and revisions recommended by you. Thank you so much, Direk. We ask Ma'am Lily. Ma'am Lily, can you talk? Ma'am Lily, kayang talk? Hindi ata. So, minessage na lang niya sa akin ang kanyang recommendations. Saan na ba? So, agree at mag-change pa ba tayo ng title to assessment? So, parang nag-fall din tayo sa effectiveness.
Assessment. Assessment on the effectiveness ko namlatan.
Yes, assessment on the effectiveness para andun tayo sa effectiveness pa rin pero assessment ito. Yes. Kasi mahirap i-measure, si Ma'am Lily to, mahirap i-measure objectively ang level of effectiveness if doon patungo. Overall, ang lens, effective tool yan to facilitate delivery of instruction. Sabi nga ni Direk, fortunate tayo that we have that system and as to its effectiveness sa learning, baka nakadepende yan sa learner at sa facilitator kung paano niya i-maximize yung usability or functionality ng system. So sa recommendations naman, sabi ni Ma'am Lily, yung interpretation lang ng results. So she admires the group for using the literatures to support the data they gathered. Pero kung nag-triangulate sila, mas maikukwento sila kung bakit yun yung mga result ng responses ng students. So andyan lang naman yung students natin. You can always go back dun sa mga respondents ninyo. Pwede kayong mag-triangulate pa to ask bakit yun ang sinabi nilang least effective or least experienced, most experienced na lang kasi yun yung i-discuss ninyo. Then very useful ang result nila in updating the system kasi walang perfect na system. Understand lang na walang perfect na system. As to the users of system, siguro more exploration para ma-maximize at ma-utilize ng mabuti yung system. Yun nga, depends dito sa literacy in using up-to-date technology, lalo na sa digital age na tayo. So yun ang recommendations ni Ma'am Lily. So sa akin naman, maganda yung study kasi lalo na lahat tayo first hand ang experience natin with Lens. For the group, congratulations, pero marami akong dito sa papel niyo, medyo madugo sa ating paper. So number 1, hindi niyo finalo yung template, Dave, na binigay ko sa inyo. Then sa lahat. And then number 2, lahat ng parts ng paper nyo naka-future tense pa except chapters 4 to 5. I asked you already sa start actually ng SEM natin na what you can do agad is to revise, change all yung mga future tense nyo to past tense after the data gathering already. Lahat is naka-future tense. Yeah, and then sa scope and delimitation, wala tayong inclusion, exclusion, walang nakalakip dun sa scope and limitations ng questionnaire natin. And then sa results na tayo. Marami nang inad si Direk doon sa yun. I think naayos naman na ng mabuti ni Direct yung ating results. Sa research instrument nyo, hindi nyo sinabi kung, that's why tinanong pa ni Direct kanina, kung kayo ba yung gumawa nung paper or in-adapt nyo. So is it adopted, a researcher made, na pilot test ba to, validated? Walang nakalagay all throughout your paper. And then yun nga, naka-future tense pa rin lahat. And then, yun, tulad ng findings ni Ma'am Lily, I appreciate na lahat ng results nyo dito is nilagyan nyo ng kalakip na discussion. Pero meron akong, saan yung ano ko? Yun nga, same as dun sa nakita ni Direk kanina, dapat nakahiwalay yung sa profiling ninyo, nakahiwalay siya according to the demographic, economic, and then nalimutan ko na yung sinabi ni Direk na dun sa next. So wala kayong ganun. So hiwa-hiwalay, hindi siya cohesive ba? And then, yun, I appreciate kung paano nyo diniscuss kung bakit kailangan nyo yung device used for the lens and yung internet access, yung source of internet ninyo. And then dito sa functionality and collaborative, ayos na ito ni Direk.
Hey, that's my phone.
Yan, naayos na to ni Direk sa part na to. Saan pa yung medyo itatanong ko dito? Yung sa inferential nyo, nasabi na kanina ni Direk, yung wala yung significant difference between blank and blank. And then yung table 14 nyo dito, magbabago yung table numbers ninyo as to the recommendations of Direk. Pero yung first na table nyo sa inferential stat ninyo, it's only significant difference. So wala siyang post-hoc kasi wala namang significant dun sa mga nakita ninyong results. Ang meron lang post-hoc is yung meron lang significant. Diba, Ma'am Jen? Statistician na rin ako.
Oo, yun. At kung doon lang sa age nagkaroon ng difference, anak, you create that, you illustrate in which particular specific group nagkaroon ng differences. So you create a separate table for your post-hoc analysis. Hindi mo siya isasabay doon sa result ng stat mo na may significant difference. Na? Okay, sige. Thank you.
Yes. And yung actually may significant difference lang sila, Ma'am Jen, yung pangalawang table nila, yung first. Kasi nila ng title na significant difference and post-hoc analysis. Pero lahat naman ng ano nila is not significant. So yun. And also, yung sinasabi ko dito, hindi nyo na ilalagay yung decision dun sa last na column. Hanggang dun na lang kayo sa p-value. Kasi dun naman sa ilalim nakalagay kung sino lang si may asterisk, siya lang si significant. So tanggalin nyo na yung last na column natin, yung decision na nakalagay na not significant siya and significant. Kasi parang redundant lahat yung andon. Nandun naman na yung asterisk. Lahat yung naka-asterisk lang, siya lang yung significant at this level. And then, ayun. Wala tayong limitations na nilalagay sa conclusion. Kaya medyo naano kanina si Direk, but may limitations sa conclusion. So the conclusion just answers your title. So yun nga, binarecite na kanina ni Direk kay JD kung paano sasabihin, paano i-state yung conclusion natin. And ito ang ina-expect namin, maraming recommendations according to the per statement, per findings, per finding na nakita ninyo, dun sa inyong mga results and discussion, yun ang bibigyan nyo ng corresponding recommendation. So hindi tayo magre-recommend ng ganito sa mga group members. Itong HEIs should develop strategic plans and provide guidelines concerning it. Meron na silang ganito. Meron na silang guidelines kung paano namin gagamitin yung LMS, mga ganun. So, hindi dapat ganito ka-general ang ating recommendation. You need to specify yung recommendations nyo according to dun sa yung finding nyo mismo sa study nyo. So, hindi siya dapat ganito ka-general. So, kung nakita nyo na because of, mahirap mag-upload ng manual, mga ganun, or mahirap mag-grade, kung hindi naman ang sinabi ng mga teachers. And then, pwedeng i-recommend na mayroon silang training for the utilization of the grade sheet and the sampling of the lens. Kasi sabi nga ni Sir Julius, tinuturuan namin, yun mga yun, hindi tinuro sa amin during the trainings and webinars. Pero, ang dali palang gamitin yun, hindi na namin kailangan mag-compute through Excel kung alam mo paano gamitin yung grade sheet ng lens. So, yun yung mga specific dapat kung ano yung i-recommend nyo. Kasi pwede nga namin tong i-share sa mismong university for the improvement of the utilization of lens para mas effective siya both for faculty and for students. Yun lang. Hello po sa ating advisor, Ma'am Lara. Thank you so much for attending our defense.
Yes, ma'am.
Yes, and thank you so much for accepting yung pagiging advisor nitong group na ito kesa kahit na sobrang layo sa ating
True. Pero
ganun talaga. Lahat binapasok na natin. Ma'am Lara, meron ka bang question for this group?
Wala naman, ma'am. Ano na lang namin. Ayusin na lang namin yung paper.
Yes,
hindi ko kasi alam yung format, so hindi pala sila follow ng format.
Yes, Ma'am Lara, pero hindi ko pagagalitan ko dito sila kasi sa kanila ko binigay ang kanilang, yung sample proposal, mga ganon. Sample paper. So, dapat nakita na nila yon yung template ng mga yon. Anyway, hi Ma'am Lara.
Hello.
Tapos na tayong ma-Omicron.
Hindi, nilalagnan na naman ako. Kakabooster ko kahapon.
Ano yan? Reinfection?
Hindi. Nag-booster kasi ako kahapon. Ito pala yung tama ng Pfizer.
Oo. Lalagnatin ka talaga dyan. Ganyan din ako nung na-booster ako.
Kaya nga. Sige na lang, laban na lang. Sakit-sakit na ngayon para this year. Okay na.
Yes. Thank you so much, Ma'am Lara. For the group members, JD and Castillo, Collado, and Cornejo. Meron ba tayong tanong for the panel? May hindi naintindihan? You want to clarify things?
Wala na po, ma'am.
Okay, if there are no more questions, yes, JD, we may close already our batch 5 final defense.
Wait lang, Ma'am Jen, hindi kita masagot. Ma'am Jen, isubmit pa rin yung FR para marilisan tayo ng new funds.
Opo. Meron na sa kanila direct pero ang general comment nila nung na-receive nila direct masyado pa daw malaki yung balance kaya hindi daw po ma-justify yung pag-release ng last tranche. Dun sa ang nakarating po kasi sa kanila na FR direct is as of October 2021. Pag pupunta na po tayo ng November, December, nagne-negative na yung fund natin. Only that hindi po na-release ng taga-accounting yung FR na yun. Kaya hindi na tayo sumasahod, ganun. Baka pagkahihintayin pa po kasi yung direct, baka mas lalong ma-delay yung fund transfer. Kapag
nasubmit yun, di ba? Nasubmit na
po direct
FR?
FR ng as of October 2021. Pero yun, sabi nila, masyado daw malaki yung naka-reflect sa unexpended budget. Kaya ang gusto ko sana nila direct yung...
Doon sa FR ba natin ngayon, ma'am, ilan pa yung yung...
Nasa 120 something pa direct yung nakarating sa kanila eh. Kasi October na reposting po yun. Pero
in other words, wala, di ba, kukunti na lang yung kukunin natin, nasa 100 plus na lang.
Opo, direct.
So I wonder, bakit hindi nila i-release? Meron na tayong bagong FR. Na 100 plus na nga lang ang balance.
Opo, direct. Yun ang sabi nila, Mother Lara.
Ano kasi, Mother, yung di ba yung parang nirelease nilang fund ng third tranche, parang doon kasi sa FR, parang pinapakita na may natira pa doon. Kaya ayaw i-release ng DOST na parang bakit kayo magre-release para dito sa FR nyo, meron pa namang pera. Kaya nag-send na si accounting nung Friday, nung updated yung negative na. Opo, sir. So, parang ihabol na lang natin yun on Monday.
Yun yung ihabol nyo para i-release nila yung kulang pa. Kasi anong pambayad natin sa publication fee pag hindi sila mag-release, ma'am? Malaki.
Pero doon naka-charge po yung publication fee natin direct sa CSU. Hindi po sa kanila direct.
Yung isang publication?
Both po. Study
Both
1 and 2 po.
publications ay
Opo.
sa
Sa
CSU.
CSU po. CSU po.
Okay, tapos pero yung mga honoraria galing sa
Oh,
kanila.
yun direct. Yun ang
Pero
case.
yun, mother, kasi yun muna yung pambabayad natin. So, kailangan yung fund natin.
Yes, yes. Kunin mo. So in other words, na-submit nyo na yung FR?
Opo, direct. Pero yun yung FR
Yung
hindi
FR
nung October direct.
Yeah, okay lang. Kasi Ma'am Lara, you have to make them understand na we need the money for the deliverables to happen. Correct?
Yes,
Tapos saka tayo mag-0-0 sa kanila. You tell them about the provisions ng contract.
Yes po, direct.
Kasi nakapag-submit naman na tayo ng deliverable nakapag-submit na tayo ng report. Meaning, trabaho nilang mag-download sa atin ng pera para sa final tranche.
Opo,
direct.
Diba? Kasi yun lang sinasabi, hindi naman final tranche bago deliverable. Hindi Deliverable bago final tranche. So yun naman.
Opo.
Opo, direct.
Tawagan mo na lang si Clyde, siyang magpag-away dyan.
Yes po, direct. Na-COVID na din silang lahat.
Meron. Actually, pati si Clyde is COVID. Yung nag-text siya sa akin kanina.
Pati yung cashier daw direct. Kaya hindi makapag-release ng walang pipirma. Yung cashier ng DOST na COVID.
Mas problema ko yung dalawang project ni Ma'am Jinky ngayon. Yung hindi yung bago ma'am, yung existing. Hindi, 2 buwan nang walang sahod yung RAs. Kasalanan naman nila kasi deduct sila ng deduct, hindi naman sila humingi ng fund hanggang sa na-drain na pala yung fund nila.
Yes po. At saka December pa hinihingi ni Ma'am Clyde yun para ma-release na sana nung December.
Ewan ko ba, hindi natin kasalanan yan. Alam naman nila from the very start, nung ako ay nag-orient, na kailangan tignan-tignan nila kung magkano pang naiwan. So, ganun na lang, Ma'am Lara, Ma'am Jen. Si Ma'am Lara kasi meron kang doon, meron kang kahit papaano kakilala doon sa loob. Napakita mo MOA, correct? Tapos yun naman talaga ang after our deliverables na na-submit na natin nung Friday, kailangan nilang i-download yung last tranche. Tapos saka tayo mag-0-0. Diba?
Total, hindi pa naman po ito yung final na FR natin.
FR.
Kung pwedeng ganon.
In fact, yung final na FR kasi, doon lang talaga tayo mag-0-0. Pero paano tayo mag-0-0 kung hindi nila tayo releasean ng fund, saan natin ibabawas yan?
Opo, direct.
Hindi natin may uubos yung fund hanggang hindi sila mag-replenish. Di ba?
Opo, direct.
So, kailangan nilang mag-replenish, Ma'am Lara.
Yes po, direct.
I think, Ma'am Jinky, internal naman na problema ng DOST kung paano solusyonan yung walang pipirma. 2 buwan nang hindi sumasahod ng RA.
Yes.
1 month na rin.
Laging may COVID sa kanila.
1 month na rin yung papel dyan sa kanila. So, ganun na lang ba yun? Sabi, COVID, so COVID forever. Hindi pwede. Mamamatay yung mga RA natin dyan. May COVID pa man din sila. Paano na yan? Correct? So, you ask kung anong pwedeng, kasi Ma'am Jinky, ang nangyari dyan, nandun na yung cheque.
Yes.
Actually, the check is existing. Wala lang talagang pipirma. As far as I know, pumapasok naman si ARD. Kasama ko ulit si OIC Ma'am Tess Tabaog sa Monday, sa Carig.
Tsaka,
yung accountant lang, baka may
isolation ngayon
So, kung yung accountant rin lang naman pala yan, bakit hindi gawan? Kung internal problem ng organization yan, hindi atin yan. Tanong mo nga kung paano naman solusyonan. Kasi syempre this time, lalo at kino-COVID yung mga staff natin, baka pwede namang bigyan na lang sila ng pera. Yung sahod nila, i-fast track. Sabi mo, sabihin mo, nag-COVID sila, kaya i-fast track din nila. Hindi lang sila may karapat lang mag-COVID. Nagka-COVID na yung 4. So, sweldohan na nila lalo na.
Yes.
So, then, Ma'am Lara, work on it.
Mother Lara, thank you.
Yes,
work on it. Ma'am Jinky, closing na tayo? Closing na ba?
Yes po, closing remarks na. JD? JD, closing remarks na.
Before we end this day, of course, we would like to award the Certificate of Appreciations to our dear panelists. Altina,
Si Athena, bumalik na ata sa school. Ay, bong.
Now I have the honor to award the Certificate of Appreciations, and I'm going to read the whole content. Republic of the Philippines, Cagayan State University, Andres Campus, College of Allied Health Sciences, Department of Respiratory Therapy. The Certificate of Appreciation is hereby awarded to Julius T. Capili, PhD, in grateful acknowledgement for his valuable time and expertise as the chair of the panel during the final defense of the fourth year Bachelor of Science in Respiratory Therapy students of Cagayan State University Andres Campus, held via Zoom meeting on January 22, 2022, given this 22nd day of January 2022. Signed by Maria Nancy T. Martinez, RTRP, MPH, the Department Chair of Respiratory Therapy, and Dorina De Sabatin, RMT, MPH, CBO, and the College Dean. And the next certificate is awarded to Athena. Jinky Mariti Chua, RPH and MPH. And also the same certificate is awarded to Lilian C. Malabo, RNMSN, for being the member of the panel. And lastly, may last po ba?
Best friend, sorry, hindi pa nila napalitan.
Carry lang.
And lastly for
Pakipalitan
Ma'am
to
Jennifer
Jane.
Kasi
Lauren
si
Loyan.
Din talaga yung ano. Sige, thank you. Sige.
Thank you po, finally.
Pasend ulit kasi nagluloko. Pasend ulit kasi nalagay ko ata yung salamat na lang. Napindot ko ata. Hindi ka namin marinig, Ma'am Jinky.
Yes, direct.
Thank you.
Thank
Okay
you.
na? Bye-bye.
Okay, thank you so
Thank you
much
po.
po.
Thank you
everyone.
Thank you so much. Thank you. Congrats sa group. Direct yung grade mo. Ikaw na lang hinihintay natin.
Yeah, kasi send mo ulit kasi hindi ako makapag-input.
Yes po. Okay po. Thank you.
Congrats.
Thank you, everyone.
Thank you po.